is Taylor Sledge.
All right. Then we have Taylor, Sledge, Mr. Davis, will you get the witness list?
Ms. Sledge, if you would raise your right hand. You swear affirm testimony you shall give here before this court is the truth, the whole truth, and nothing but the truth, so help you God.
Yes, I do.
You would state your name for the record, please,
Taylor Sledge Ragsdale.
and if you don't mind, would you spell your name?
Taylor, Taylor, Sledge, Sledge, Ragsdale, Ragsdale.
All right, thank you, Ms. Sledge. If you would, tell us what you do.
Right now I work as a paraprofessional at Cochran High School.
Have you always done that?
Before that I worked at Primary Pediatrics
When did you work at primary pediatrics?
from August 2020 until last summer.
And what did you do at primary pediatrics?
First I worked up front and then I became a tech and then I was the lab manager.
So you said you started at primary pediatrics in August of 2020, did I hear that right?
Yes.
Let me take your attention to November of 2020, so just a little while later. You were the receptionist at that point?
I was.
And in November of 2020, do you recall a man bringing a small child into the office on the 17th?
Yes, I did.
Okay, tell me what you recall about that.
I remember him bringing him into the office. It was a black African-American male. The little boy was limp in his arms, and he just said he needed some help.
Did he indicate to you what was wrong with the child?
No,
And what did you observe about the child?
he was limp, he was lifeless, wasn't moving. He was in the arms of him.
And what did you do when you saw this?
Called back to the back to get some help, and then called 911
Well, this is a pediatrics facility. Why would you call 911?
to get help because the child wasn't breathing. He wasn't responsive.
So to get more emergent help? Now, when this male came in, did he say anything to you?
He just said that he needed help.
What was his demeanor like? Was he brushed?
He seemed just, wasn't really concerned. He just was, he brought it, I mean, you could tell that the little boy needed help, but he didn't show any emotion.
And would you happen to remember what he was wearing?
A white tank top or a white shirt and khaki shorts, I believe.
So you saw this man bringing an essentially lifeless child in and then called 911?
Yes.
And Ms. Sledge, I want you to think back about anything that this man said to you. Did he tell you who he was, anything like that? Did he say anything about the child falling, anything like that?
He said he was fighting him on the ride to the office.
But nothing about him, say, falling on the couch?
Judge, that's a leading question.
The objection's overruled.
Nothing about him falling off the couch or falling out of the floor? Nothing further at this time.
Mr. Griggs, chief with you.
Just a couple of questions, Your Honor. Good morning, ma'am, or afternoon. Tell me your last name again.
Ragsdale?
Ragsdale,
Yes.
and you were a Sledge at the time, is that correct?
Yes, sir.
That you went to work at this primary pediatrics August of 2020,
Yes, sir.
So it was, you worked as a receptionist at that place from August until when?
As a receptionist, I was a receptionist about 4 months, and then I moved to the back as a tech.
As a,
Tech,
what does a tech do?
to pull them back, get their weight, height, and get them prepared for the doctor.
Oh, okay. But on November the 17th, and is that when it was, November the 17th of 2020,
Yes, sir.
had you had any medical training?
To know whenever someone comes in and needs help, yes.
Okay, I mean, what training, where did you get your training at?
At primary pediatrics.
I mean, you didn't get it from school or from a technical college or anything like that?
No, sir.
So you worked as a receptionist, and I guess by being a receptionist, you acquired knowledge to be able to question people when they came in the front door?
Yes, sir.
All right. And I take it that on this particular day, you don't remember?
Emily Baker. Can you raise your right hand, please? You swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Thank you. You can be seated. Can you state your name for the record, please?
Not that one, Miss Baker, that's the extra one. The flat one in front of you. I know, we should move that so that it's not distracting you. Go ahead.
It's Emily Baker.
Is that just a common spelling? Is that a common spelling, Emily Baker? Can you spell it before report, please?
EMILYBAKER.
Ms. Baker, how are you employed currently?
I am employed, I'm in the Air National Guard full-time. I work at Karter Pediatrics on Mondays.
Okay, how long have you worked with primary pediatrics?
Before I joined the military, I was there 7 years.
7 years. Okay, so did you work there in 2020,
Yes, sir.
in November of 2020?
Yes, sir.
Okay. And do you recall on November 17th of 2020, does that date stick out to you at all?
Yes, sir.
Okay, why?
That is the day that Karter Ambrose came in and we had a problem.
Okay, so what were you doing?
It was the beginning of the morning, so we didn't really start working yet, and it was still kind of at the end of COVID. And then we had a call from the front stating that there was a guy with a lifeless child. So we went out there, me and one of the nurses. So we went out, told him to come back, we put him in a room, went in there, asked the guy, we had to assess what was going on, and then realized that he needed attention fast.
So let me back up. You said that you were in the back?
Yes, so
What were your duties?
So I'm a medical tech.
Okay.
So I usually work with the patients, find out what's going on, get vitals on them,
Okay.
and then put it in the system and let the doctors know what's going on.
Okay. So you're at work this Tuesday morning,
Yes.
just like it's an ordinary day,
Right.
right? Okay. And then you said a man came with a child?
Yes.
Okay. Did you know who that man was?
No, sir.
Okay. Who was the child?
It was Karter Ambrose.
Okay. Did the man know who the child was?
Yes.
Did he provide any of his information?
Any of
Karter's.
Karter's information?
Correct.
He provided the basic information that he knew.
Okay.
We found out that he was a boyfriend of the mom.
Okay. All right. But you didn't really know at that time.
Right.
All that. Okay. So where did you first see Karter?
In the waiting room. Like
Okay.
our doors are right here, but like if you're facing the parking lot, our door's to the left. So that's the forward hall. So, and when they come in, like he was in the lobby. So he was holding Karter in his arms, and so we directed him to a room.
Okay, you said we directed him to a room?
Me and Casey,
Okay.
the nurse.
Casey, what's Casey's last name? Do you recall her last name?
Hold on, I went blank.
Is it Cochran?
Yes.
Okay.
Sorry.
So you ushered Karter to a room?
Right, correct.
Okay. And how many people went to that room?
So me, Casey, Dr. Robert Ford was in there. There was a nurse practitioner, like about 2 nurse practitioners, and another nurse that I recall.
And what was the atmosphere like with everybody in there? What was going on?
Everybody was just working together. I know someone, they were going to get IV so they could start an IV. Dr. Robert Ford was on the table, he was listening to him, and then he could tell like there was barely any heartbeat. So he got on the table, started doing compressions. So it was kind of like calm chaos.
Mm-hmm.
And then I would come out, call 911, and they asked for address, phone number, all the basic information, and we were just relaying it back and forth.
So what, I think, did you say Dr. Ford?
Dr. Robert Ford.
Robert Ford, okay. You said, I think, compressions, is that right?
He was doing CPR.
CPR, okay.
They did the shot machine on him. So that-
EKG or
Yeah.
Okay. When you first saw the child, what did he look like?
He was limp, lifeless. The bottom of his feet were like white. There was no color to him, and his eyes were rolled in the back of his head.
And the man who brought him in, did he say anything about the child's situation?
Once we got in the room, he did.
What did he say?
He stated that the night before, that he was vomiting, and then he said he gave him a breathing treatment. And he said that, I'm not sure if it was before or after the breathing treatment, that he was bent down on his hand, kind of, I'm assuming like a seizure, he was having a seizure. And then he said, before he brought him in, he said that he had a bowel movement.
Had a bowel movement. Did he say the child was throwing up or anything like that?
Yes, that was later, or during the night.
Okay. And so you called 911, so did EMS show up?
They,
Now, I know it was a long time ago, but do you recall roughly how long the child was there at primary pediatrics receiving care before EMS came?
I would say at least 20 minutes
Okay.
before they arrived.
Judge, the state calls Amanda Gattie.
Gattie, this way, please.
Ms. Gattie, if you would, raise your right hand. Do you swear affirm testimony you will give here before this board is the truth, the whole truth, and nothing but the truth, so help you God? If you would, state your name for the record, please.
Amanda Danielle Gattie.
And if you don't mind spelling your name too.
Whole name? Yes. AMANDA DANIELLE GATTIE.
Thank you, Ms. Gattie. and you're a little bit soft-spoken, so if you could speak into, that one doesn't work.
Now, Kianna Davis, move that please, so that we can view the post. Thank you.
All right, Ms. Gattie, if you would, tell us what you do.
I'm a pediatric nurse practitioner at Karter Pediatrics,
And how long have you worked in primary pediatrics?
10 years.
And you are a nurse practitioner. Tell me what degrees you have.
All of them? I have several, sorry. So my first degree is in information technology, and then I went back and got my RN, and then returned again for my bachelor's, and returned finally for my master's degree.
So how long have you been a nurse practitioner?
A nurse practitioner of 10 years.
Now, you would have been a nurse practitioner at primary pediatrics back in 2020, is that right?
That's correct.
I'm going to turn your attention back to November of 2020. Do you recall on November 17th a child being brought in?
Yes.
And if you would, tell us what you remember.
Okay. On that morning, I was sitting in the office, which was on the back hallway of our office, and around 8:45-ish, I and another nurse practitioner heard a nurse hollering for help. So
When you heard another nurse yell for help, what did you do at that point?
So I left my office and walked to the hallway where she was calling for help from.
And what did you see?
I walked into the room, it was exam room 4 that they had put the baby in. I walked in there, and the nurse, Casey, and Casey was in there assessing the baby, and Amy Wood, who's the other practitioner that was with me, she walked on in there, and Casey said he's unresponsive, we got the doctor. So I then left the exam room and went to the doctor's offices and asked Dr. Fords, Jesse, and Robert to come into exam room 4.
So you ran and got more help.
That's right.
Now, what did you notice about the toddler? You said he was like lifeless.
Yes, on the exam table, t-shirt and diaper.
And you described him as lifeless, so unresponsive.
That's right.
And after you went to get more help, what happened at that point?
At that point, I started talking with the guy that brought the baby in and trying to get information, birthday, last name, what happened, kind of give us a history while they were working on Karter.
And did he give you any information about himself, who he was, name?
No name, no, he said I'm stepfather.
So he referred to himself as stepfather?
That's right.
And was he able to give you basic information about the child?
No last name, no date of birth. He just said I'm mom's boyfriend. As he told me what happened through the night, he knew that he had breathing problems, but that was the only information I could get from him during that time.
During that time. So you sort of took on a comfort role for him? Okay. And what is going on while you're talking to him?
They're resuscitating Karter.
So they're trying to perform life-saving measures?
That's correct.
While they're trying to perform life-saving measures, the other medical personnel in the office, did the man that you were talking to tell you anything else?
Yeah, he had told me that Karter had been vomiting all night, and that when he went to get him up that morning, that he was in a large amount of vomit and stool. And he knew that he had breathing issues, so he put him on the breathing machine. And as he had Karter on the breathing machine, Karter kept passing out. So he stopped and just brought him into our office because we were close. But on the way, he stated Karter bit me, or he was biting me.
Now, was he in the room, was he on the phone with anybody?
He was on FaceTime with Mom.
How were you able to determine who he was on the phone with?
He stated that.
And did you at that point know who Mom was?
I had seen her in the office previously with Karter.
Her name?
No,
But you had physically seen her with Karter before?
I have.
And while everybody else in the room is working on Karter, did he say anything else?
Yeah, he kept questioning, is Karter okay? Is he breathing? And he was talking to Mom on the phone, and he would say, I can't see, there's too many people in here, I just need you to hurry up and get here. And then he would ask again, he asked several times, was he breathing? And then he would rely that to mom on the phone and just say, I can't tell, again, there's so many people in here, I need you to get here. Babe, that doesn't matter, I just need you to get here. Babe, that can wait, I just need you to get here. When I asked what Carter's last name was, we were trying to get basic information, he said, then to mom on the phone, babe, what is his last name?
And you had mentioned you'd seen Carter in the pediatrics. And you remember mom,
Yes.
she would bring them.
Yes. Mom and
Now,
dad, different times.
and that would be biological then, correct?
Yes.
Okay, not the man who brought him in that day.
Correct. I had never seen the man that brought him in that morning.
Okay, thank you. Now, this is a pediatrics place. Do you keep medical records?
We did.
And are you familiar with how medical records are kept?
I
You write notes yourself?
I did.
And you do that because you are a nurse practitioner.
That's correct.
So when you see patients, tell me that process.
Like in our office?
Yes.
Yes. So patients come in, I see them completely, document as I'm in the room, document when they leave. I fully document like an HBI, which is a history of present illness of what's stated from the parents or caregiver that's going on. Document my full exam, full treatment, diagnosis, any follow-up recommendations.
And had you previously reviewed any medical records for Carter?
At that point, no. I had seen Carter, so I had created medical records, but I had not reviewed them necessarily.
Well,
Is that what you're asking me?
Let me clarify, that's a little bit confusing. Since then, have you reviewed medical records for Carter?
Only with you guys.
So you have.
Yes.
If I were to show you those medical records, would you be able to identify them?
Yes.
May I approach them?
You may.
Ms. Gattie, if you would, tell me what this is.
This is our medical record. This is what every kid gets when they come into our office.
For the record, Your Honor, I'm showing Ms. Gattie what's been marked as State's Exhibit 1. And are these medical records, correct?
That's correct.
And are they regularly kept in the course of business?
Yes.
And you reviewed those medical records?
Yes.
Are those medical records for Carter?
Yes.
Karter Ambrose? And are they a fair and accurate representation of those medical records?
Yes.
Have they been changed or altered in any way?
No.
Your Honor, at this time, the state will tender into evidence State's Exhibit 1 medical records for Karter Ambrose.
They're admitted.
All right, Ms. Gattie, if you would take a look at those. Before this date, the date of November 17th of 2020, you've been brought into the office. Right.
Yes.
What are some of the things that he had been previously seen for?
Cochran nose, low-grade fever. This one looks like he had been sick and just needed to kind of be cleared to go back to the sitter. Swollen mouth. Looked like he had eaten something maybe that caused an allergic reaction or swelling. Ear infection.
Make sure you're speaking up for me.
Okay, I'm sorry. Cough, breathing heavy, runny nose. That was a well child check on that one. Diarrhea and cough. We had some chest x-ray results that mom was called back about. Cough, runny nose. These are just like inhaler refills for his inhalers. Hand, foot, and mouth. cough with a history of asthma. Well-child check. Rash. Refills. Runny nose and breathing issues. Recheck ears, bump on his left butt cheek. Cough. Ear recheck. Cough. Cough and pulling my ears. Cough and sneezing. Bug bites. Cough, congestion, breathing hard. Runny nose and congestion. Well-child check. And fever and congestion.
Ms. Gattie. So these would be, say, breathing problems, stuff that you would see for a small child.
That's right.
Do you swear a firm testimony about to give me the truth, whole truth, and nothing but the truth, so help you God?
I do.
Thank you. You can put your hand down. Can you state your name for the record, please?
Megan Kelly,
Can you spell that for the court reporter?
MEGANKELLEY.
How are you employed, Ms. Kelly?
I work for a hospice now,
Okay.
but I did work for Primary Pediatrics.
Okay, you used to work for Primary Pediatrics. When did you work for them?
2017, maybe 2020,
Okay.
maybe 2019.
Okay. For Primary Pediatrics?
Yes.
All right.
My youngest was,
Were you working for them November 17th?
yes,
Okay, so sometime after.
yes.
Okay. And what did you do for Primary Pediatrics?
I was a float nurse, one of the float doctors.
What is a float nurse?
I helped with basically anything. I took calls for the doctors. I helped with the nurse practitioner who was helping one of the doctors.
And I had mentioned November 17th of 2020. Do you recall that date?
Yes.
What do you recall about that date?
We had a very bad case come in, pediatric case come in. A little boy, he was lifeless when he came in.
Okay. And what, do you remember what time it was?
It was in the morning time.
In the morning? Okay. So you said it was a very bad case. What were you doing that morning?
I was in my little cubby where I sit as a float nurse, and I was getting ready for the day, so I think it was right after we opened, and I was getting ready for the day, and I heard a lot of commotion and yelling, and one of our other nurses was coming into the supply room to grab code supplies.
Okay. And at some point, did you figure out kind of what was happening?
Yes,
And
I
what
went,
was
I
happening?
went to help. There was basically a code in place. A pediatric came in, either did not have a heartbeat or lost a heartbeat on the table.
Okay. And you say code. What does code mean?
Code blue, sorry.
Okay. What is code?
No, they're not breathing, they don't have a heartbeat.
Okay. And do you know who it was who was code blue?
At the time, I did not tell them to
Did
the
you
room.
did you see at all who?
Yes, it was very small, pediatric, African-American boy, very pale, especially his feet and his hands, and just very lifeless.
Okay. So you heard yelling. Where did you see the child?
On the bed when I finally got to the room.
Okay. And do you recall which room that was?
It was on Dr. Ford's side, I believe room 4.
Okay. And what did you go into the room?
Yes.
And what did you do when you went in the room?
I assessed the situation. I tried to ask the man who brought him in. At the time, I didn't know who he was until I asked questions. I asked him some questions, who he was, what happened, and then I just started working on the child.
Okay. When you started working on the child, what did you do?
I tried to place an IV.
Okay. And were others in the room with you?
Yes.
Okay. Who all was in the room with you?
Dr. Robert Ford was in the room. Jessica Woods was in the room. She's RN. Gattie was in the room. boyfriend, we thought was the stepdad at the time. He was in the room, and then the work.
So you said that you tried to put an IV in him. What were other people doing?
CPR was in place, oxygen was being placed on. I know there was others outside calling 911. There was just a lot in commotion, and then trying to figure out what was going on with them.
Okay. And, I mean, there was a lot of trying to figure out what was going on, so, I mean, did you kind of figure out what was going on?
It was hard. It was from just bits and pieces of the story, but from what I gathered, he either had some breathing issues and was brought in, and I knew there was more to it than what was in our face.
Okay, so let me say this. Do you know who the man was who brought the child in?
At the time, no.
Okay.
I believe he was the boyfriend of the mother.
Did you have any interactions with him while he was there with the child?
Yes, I tried to ask the child's last name. I believe he was on the phone with the mom, and he had to ask the last name, date of birth, and all the information.
And so you overheard them conversing? Okay, was anything else said?
She sounded like she was at work, and he was telling her not to worry about something and just get here. He just kept saying, don't worry about that, get here.
Did he say anything about the child's symptoms prior to bringing the child in?
That he was throwing up and just having some breathing problems and very lethargic.
Did he say, he just said the child was lethargic, did he say the child was doing anything else?
I don't recall.
Do you know how long y'all worked on the child?
Maybe 30, 45 minutes before EMS came.
Okay, before, so did somebody call 911?
Yes.
Okay, and so then EMS came?
Mhm.
Okay, and then what happened when the EMS got there?
EMS came, assessed the scene, took him to their truck and took him to the hospital.
Okay, do you know where they took him?
Peach County, I believe.
Did you do anything kind of after they took the child?
I just remember we all just kind of debriefed and tried to figure out what exactly just happened and did our statements while it was fresh on our brain.
And let me ask you this, do you recall the man who brought the child in, if he said anything about the child losing consciousness?
I believe so when he came in because he said he had been sick for a couple of days and had been vomiting and having diarrhea, and so he was kind of lethargic and in and out of it.
Would state your name for the record, please.
Lisa James?
Okay, and that would be just common spelling.
Yes.
Okay, Ms. James, what do you do?
I'm an RN,
How long have you been an RN?
16 years.
And where do you work?
I currently work at Habit Home Health.
Have you already worked there?
No, it just started.
Where did you work previously?
Peach County ER.
As an RN?
Yes, ma'am.
What did you do for Peach County ER as an RN?
I was the charge nurse for day shift.
Explain to me what a charge nurse is.
I'm responsible for all the patients in the emergency room as well as the nurses and anything emergent that comes in.
So you're a nurse but also from management too?
Yes,
Thank you.
I was at that time.
Thank you for clarification. Right, I'm going to turn your attention back to November of 2020. Did you work at Peach County ER then?
Yes.
And do you remember a small African-American child being brought in at some point?
There was one brought in, yes, unresponsive. Is that?
Tell me what you remember from that.
EMS called in reports, which we can hear in the ER, and we respond back, and they said they were coming in with a approximate 2-year-old infant that was not breathing and had no pulse.
And did you observe the infant yourself?
Yes.
Tell me what you observed.
If it was not breathing and did not have a pulse, the baby was cold to the touch. His clothes were wet. We don't. I mean, he was just covered from head to toe in water.
And do you recall if any ER personnel, nurses, anyone actually worked on the child?
I do not recall if we actually worked the child or not because he was already deceased at that point, and there had been some time frame in between.
So essentially what you observed was an unresponsive lifeless child.
Yes.
Next witness.
The state calls Casey Cochran.
Aye.
Can you raise your hand, please? Do you swear or affirm the testimony about you to be the truth, the whole truth, and nothing but the truth, so help you God? Can you state your name for the record, please?
Casey Cochran.
Can you spell your name for court reporter?
Casey, last name is Cochran.
And Ms. Cochran, how are you employed?
I'm currently a pediatric nurse practitioner at Pediatric Convenient Care.
Okay. How long have you been nurse practitioner?
A year and a half.
Okay. And before that, were you in the medical field?
Yes.
And what did you do?
I was a RN, previously at Primary Pediatrics for 9 years.
For 9 years. Were you working there November 17th of 2020?
Yes.
And what was your role at that time for Primary Pediatrics?
A nurse.
Okay. And so do you remember specifically the date that I'm talking about?
Absolutely.
Did something happen that day that was out of the norm?
Absolutely.
And what happened?
I was called from the front desk that somebody up front needed help. And so I went up front, but I guess I had passed the gentleman that had Karter, and so I met him in the back hallway, and came upon a gentleman holding Karter, who was lifeless, and we put him in room 4, laid him on the table.
Okay, when you say lifeless, what do you mean?
He was limp, eyes were rolled in the back of his head, mouth was open, not breathing, pale.
So you said you put him on the table in room 4? Okay, what happened then?
Then I asked the gentleman what his name was, and he said Karter. And so I tried to stimulate him and said Karter, Karter, trying to wake him up. And he wasn't responding. And so then I checked for pulses and did not feel a pulse.
Okay, what happened? Well, let me ask you this. Did you know who the man that brought Karter in was?
I did not.
At some point, did you figure out who he was? Okay. So when you didn't feel a pulse on Karter, what happened?
I then lifted his shirt up just to check for air movement, but I didn't see anything. At about that time, a nurse practitioner walked in and was checking after me, and we started CPR.
Okay. And who all was in the room?
Initially, it was just me, and then Amy Wood, the nurse practitioner, came in and started chest compressions.
Okay. Was it just you two, or were there kind of a bunch of people following?
They were coming in as Amy walked in, but initially it was just me with Karter and the gentleman.
Okay. And so I think you said, is it Dr. Wood?
Amy Wood.
Amy Wood.
She's a nurse practitioner.
Okay, nurse practitioner. I apologize. She was performing CPR.
She started chest compressions.
At any point, did you guys get a pulse?
I don't believe so.
Okay. Was CPR the only procedure that was performed at that time?
When she started chest compressions, other employees showed up with a crash cart, and we started with the ambu bag and did the chest compression CPR.
What's the ambu bag?
That is what you put around the nose and the mouth to breathe air into their lungs.
Was there any trachea that was put in, or
No.
they call it like a trach or
Yeah,
something?
no, sir.
Okay. Can you explain to us what that is for the jury, please?
The trach.
Yeah.
We have access to that, but it wasn't done. But it's a tube, an artificial tube that would go down into the esophagus, into the lungs, and breathe for the child through the ambu bag.
Now, was there, I call it an AED machine. Did you guys have one of those?
We did.
What is that?
That is a machine that you put pads on, and it pretty much shocks the body to hopefully get a heartbeat going, or put the heart heart rate into a normal sinus rhythm, which is like a normal heartbeat.
Okay. And was that employed on Karter?
Yes.
And what happened?
The machine actually tells you if there is what they call a shockable rhythm. So it detects something that you're able to shock the heart. And it did say there was a shockable rhythm. And so we did we all cleared and shocked Karter.
Okay. And what happened after that?
His body was shocked, and then it kind of just went back flatline on the AED. There was no heartbeat.
Were there chest compressions?
We started that chest compressions, yes, sir.
Okay. And I think some of your coworkers called 911, correct?
Yes.
So at some point, did EMS arrive?
Yes.
Okay. And what happened once they got there?
Once they got there, we got Karter on the gurney. Chest compressions were being performed as he was being taken out of the building all the way into the ambulance.
Okay. And what did you do? So did the ambulance take him somewhere
No,
else?
they stayed in the parking lot for a little bit. I believe they were trying to get an IO on him because we couldn't get
What is that?
An IO actually goes into the bone, and it's another way that he can get fluids or life-saving
So it's a different kind of IV?
solutions. Correct.
Okay, okay. And were they, so the EMS is still there trying to do that. At some point, did you see them leave? Do you know?
I don't think I saw them leave. Like, I didn't visualize them leaving.
Okay. And when EMS had Karter, what were you doing?
I stayed outside with the gentleman that brought him in, just kind of consulting him, and I believe I asked where Mom was, and he was sitting like 5 minutes away, but I kind of just stood out there in the parking lot for a little bit.
Okay, did Mom ever show up? Was he on the phone at all?
Mm-hmm.
Okay, did you overhear anything?
I did hear
And
the
of course,
gentleman.
Cheryl, please, I would object to that. I mean, that's blatant hearsay.
Well, it's a statement by a co-conspirator.
The objections overruled.
What did you hear him say?
I heard the gentleman tell Mom on the phone, I should have brought him in last night when you told me to.
Okay. And, I mean, it seems, was that kind of the only part of the conversation that you picked up?
Mm-hmm.
Okay. You know who was driving?
It was a Mustang. I don't remember the color.
Do you recall if you saw him leaving the Mustang?
Yes.
Okay. Was that when EMS had left?
I don't remember.
Dr. Brown.
All right.
Thanks. Okay. No, I don't.
Can you raise your right hand?
Sure.
Swear affirm testimony about today will be the truth, whole truth, and nothing but the truth, so help you God.
I do.
Thank you, sir. Can you state your name for the record?
Sure, my name is Daniel Brown.
Can you spell it for the court report?
Sure, D-A-N-I-E-L-B-R-O-W-N.
Mr. Brown, are you currently employed?
Yes, part-time, yes.
All right, can you go ahead and explain that?
I worked with Georgia Bureau of Investigation as the medical examiner in Augusta for 15 years. And when I retired, I went to work for the city of Philadelphia in Pennsylvania for another 5 years, and then moved back to Akron, Ohio, because that's where my wife's family's from. And then those are basically the jobs that I've had.
For Philadelphia, the city of Philadelphia.
City of Philadelphia, right, medical examiners.
And when did you retire from GBI?
2014.
2014, okay. Did you ever come back and work for GBI in any capacity?
I do. After I retired, when I left Philadelphia and I came back to Ohio, I was contacted by GBI and they asked me if I would be interested in working as a part-time medical examiner. So I accepted that in June of 2020, and so I've been doing that ever since. I come back 1 week a month to do cases, either in Savannah or Macon.
And can you explain what exactly a medical examiner does?
Medical examiner is a physician who's trained in forensic pathology, and we basically are charged with determining the cause and manner of death in whatever jurisdiction we're in.
So you perform autopsies?
Yes, sir.
Okay. And what kind of education do you have?
I earned a bachelor's degree at Kent State in Ohio. I earned my medical degree at American University in Coral Gables, Florida. I did my training in anatomic pathology, which is just general pathology, at the University of Tennessee in Knoxville. I did my forensic training at the Office of the Chief Medical Examiner for the state of Maryland in Baltimore. And after that, I came to work for Georgia Bureau of Investigation. I was the medical examiner in Augusta.
Dr. Brown, will you do me a favor? Will
Sure.
you pull that mic a little bit that way so it's in front of your
Oh, yeah,
mouth
sure,
when you
sure.
turn?
Yeah.
And there you go.
Okay.
Thank you.
Sure.
No problem.
So let me back up a little bit. You said you got your undergraduate degree from Kent State?
Yeah.
And that's a 4-year degree?
Correct.
And what was your degree in?
Criminal justice and biology.
Okay, biology. And then you went to medical school?
Yes.
Okay, and how long was medical school?
4 years.
4 years, okay. And then afterwards, where did you go?
Then I went to University of Tennessee to do a residency in pathology.
And what is the residency?
A residency is after you train as a medical, no matter what type of physician you become, if you choose to specialize, you do a fellowship in internal medicine, cardiovascular surgery, whatever your interest is. My interest was in forensic pathology, so I did my fellowship, which is 2 years in addition to my 3 years at the University of Tennessee, which was general pathology. I did 2 years at the Office of the Chief Medical Examiner in Baltimore, and that was my fellowship. And from there I went.
How many years was that?
Total? Or you mean just for forensic
The
pathology?
residency and then the fellowship.
Residency was 3 years and fellowship was 2 more.
And in this residency, in this fellowship, were you actually performing autopsies?
Yes, absolutely.
Okay. So, are you a board certified doctor or MD?
Yeah, certified by the Board of Forensic Medicine.
Are you still?
Yes.
And so this residency and fellowship, that's like training and performing autopsies, right?
That's correct.
Okay. Roughly how many autopsies have you performed in your career?
Over 15,000, I don't know the exact number. I do about 300 autopsies a year for the last 24 years, whatever it's been.
And have you had the occasion to testify in court about any of your autopsies?
Yes.
About how many?
How many times testifying?
Yes.
200 or 300. I mean, it's more than 200. I don't know if it's 300, but it's more than 200.
Of those times, have you been deemed an expert in forensic pathology?
I have.
And is it all the time, some of the time?
I've never not been, but
Okay. So let me do this. So when you perform an autopsy, can you just give us just like a 360,000-foot view of kind of what that process is?
Sure. Whenever, and I'll mostly talk about it as far as Georgia goes, whenever we get notified by a coroner that there has been a death, then we decide with the coroner whether or not it's a case that needs to be seen. Some cases do not need to be seen by a medical examiner. If we deem that it is necessary to be seen, it's brought to our facility. The coroner brings it and half the bodies have been put in a body bag from wherever the scene was, whether they died at the hospital or died at home or wherever. They get put in a body bag. It's brought to a GPI, medical examiner's office. First thing we do is we open the bag and we take photographs. And this is just to show, not just for our purpose, but for this kind of purpose, is to see what we saw whenever we received the body. After we've done that, then the body is, we clothing, and we look for any signs of injury or any signs of pathology. And once we've done that and documented it, either written word or photographs, usually photographs, if there is any injury or pathology to document. After that, then we do either a limited autopsy or we do a full close. A limited autopsy would be somebody that had a history of heart disease and passed out at home. We may do a limited on them just to show that they actually did have, the coronary artery disease. Or a full autopsy. Full autopsy is, we look at all the internal organs, the brain, all of the body's tissues inside. We look to see if there's any kind of injury or pathology in the internal examination.
Okay. And so, did you perform an autopsy in this case?
I did.
Okay. And so let me,
Judge, before we get too far, I have no questions as to the qualifications of this witness.
and at this point, the state would ask the court to deem Dr. Brown an expert in forensic pathology.
We have no objection based on what I've heard.
He'll be so qualified.
Thank you. So, do you need a copy of your report to go over this?
I stuck one in my pocket.
Okay. All right.
You wanna use
Well,
that?
don't read from it. I just want to make sure you have it in front of you in case you need
Okay.
it.
What if I want to refresh my memory?
Yeah.
Okay.
And we'll handle that if we need
All
to.
right.
So you received a body in this case, did you not?
Yes.
Okay. Do you recall the name?
No, off the top of my head. The deceased's name was Karter Ambrose.
How old was he?
He was 2 years and 10 months.
So you performed a full autopsy on him, correct?
That's correct.
Is an autopsy on a child different than an adult?
Well, we look at everything on a child, but we will look for things that maybe a child has, as a child would not normally be able to say to their parents or to their caretakers. So we look for signs of injury on children that are nonverbal or they're one of the degree that they can talk to somebody and tell them how they were hurt or how they were injured or what was happening with them. We usually get that from parents, and whether they've had high fever, whether they had vomiting and things like that. But we look for all these things, especially in a child, because we want to make sure that we cover all our bases as far as like injury and pathology.
Okay. And you say you're looking for injury, stuff like that, right?
Correct.
Do you document that?
We do.
How do you do that?
We do the photographs, and I document it in my report.
All right, so I have what's previously been shown to defense counsel states exhibits 2 through 11. Can you look at these real quick?
Sure.
You recognize them?
I do.
What are they?
These are photos taken at autopsy of this individual.
Okay. And are they a fair and accurate representation of the individual or this child at the time you performed the autopsy?
They are.
Do they appear to have changed or altered in any way?
No, and we have our markers in all the pictures. When we take a picture of anything, we have the case number of that individual, and it's on it's in the photograph, so that we can show that this was our picture that we took.
And Your Honor, the state would offer an evidence states exhibit C to 11.
They're admitted with the objection continuing.
So I think you said something about a number, right? So I'm going to, with the court's permission, put this on the overhead. And yeah, you can turn around and measure. So is that the number that you're talking about?
Yes, this is an identification photograph. Everybody that comes to the office, they get an identification photograph. It's just a placard and their face shot.
So when you, this is kind of the beginning of the stage, right?
This is right at the beginning of the autopsy.
And so when you were getting ready to perform your autopsy, did you have any impressions as to kind of what may have caused the death or any backstory on why he was there?
As far as the backstory goes, we were told that it was that he was taken to his family pediatrician because he had been having breathing troubles and had been given breathing treatments. And then when he was at the pediatrician, he was unresponsive, so the pediatrician began resuscitative measures while he waited for EMS who then, I guess, took him to the hospital.
Okay. And so I guess it was your impression that maybe you were looking at some kind of respiratory problem?
That's the impression that we were given at the beginning, was that this would sound like a child with some type of inflammatory awareness.
And when you performed your autopsy, did you find any evidence that there was some kind of disease, respiratory disease?
No, we did not.
Okay. What did you find?
We found, well, first of all, an external examination, we found a lot of injury on the body. And the recent injury, there was nothing there, like such as a scab. It would have been, I would describe that as an older or remote injury because it's been already scabbed. These injuries were all within a recent time frame. There weren't hours between them. So then I just note those, and I note those on the body.
Okay, so what external injuries did you look at?
We saw some abrasion. Abrasion is just a scraping of the skin. We saw abrasion around the nose here. We saw some contusion, which is bruising around the corner of the mouth and on the inside of the lips. I'd have to look at the report, but we also
So if you need to look at your report, go ahead.
Right nostril is a red abrasion. That's what the way I describe abrasion. If it's an older abrasion, they dry up. Eventually they become a scab. But if they dry, there's no fresh hemorrhage or anything, and it has a kind of a brown color to it. When I describe it as red, that means that's from either the contusion, if it's contusion, or it's from the abrasion, it's the hemorrhage from an abrasion. This was, I had an abrasion on the right upper lip, an abrasion on the left upper lip, and an abrasion on the mucosal surface, which is the inside of the surface of the lower lip, So that's a contusion on the inside of the lip. There were a couple brown, red, blue contusions, which are recent.
Where were they?
Oh, this was on the left side of the face. Some injuries, contusion. A small contusion on the right chest, adjacent to the sternum, next to the breastbone. A round red contusion on the right upper abdomen, along the costal margin, which is right where your rib cage, if you feel your rib cage, that's the costal margin. Blue-green discoloration on the abdomen, that's another contusion. Red contusion on the abdomen, overlying the umbilicus, which is your belly button. A squared red abrasion, a couple of them, on the underside of the scrotum. So just underneath the scrotum. And a couple small linear red abrasions on the right mid-abdomen, so the middle of the abdomen.
So I'm going to publish State's Exhibit 3. You can look at
Sure.
it behind you. So what are we looking at in this picture?
This is the, your pointer?
I didn't know.
Unfortunately, the laser pointer does not work very well
Okay.
on my new fancy TV screen. So
If you
feel
need-
free to stand up,
Yeah,
doctor,
stand.
if you need to, but I want you to speak up real
Oh, I
loud
will, okay.
for the jury.
All right, I will. This is a contusion around the cheek here. This is some dermatitis. If it's not really, it looks worse than it is. It's not really, this is, some kids get that chafing. But this is the contusion. That's a red contusion right there.
So let me just focus on that
Sure.
contusion that you're
Sure.
talking about.
Sure.
When you say contusion, what do you mean?
A contusion, I'm sorry, is a bruise.
A bruise? Okay. So,
It's the blood vessels, under a bruise, the blood vessels have broken, but they have not broken the surface. So then that discoloration you see is the hemorrhage underneath.
could that contusion that you're referring to in this photo on his cheek be some kind of reaction to something else, like an allergic reaction?
No, that's not.
That's not an allergic reaction. I'm going to publish States 5 now. And what are we looking at in States 5?
These are the contusions I talked about on the upper lip. And this is the mucosal surface of the inside of the lip, and that's a contusion on the inside of the hand side.
Okay. Now let me ask you this. So the CPR is performed on this child. When you're doing an autopsy, do you look for signs or injuries that could be a result of CPR?
Yes.
Okay. And what would those be?
Well, in adults, it's usually fractured ribs
Okay.
from compressions, because the EMTs work them very hard. And but in a child, most of the time, we don't see injury because the child, especially someone under the age of 4 or 5 years old, their lungs or their rib cage is still very pliable. So you can put a lot of pressure on that without causing any breakage or anything like that. I didn't see any signs under the sternum or around the ribs of hemorrhage.
Okay. Yeah, I didn't quite ask you the question I meant to ask.
Okay.
So oftentimes when people are trying to keep someone alive, do they give like trachea? Do they try to get oxygen to them?
Right.
Okay. And do you look for injury from that?
Oh, yes, we do. Yes, well, he had an endotracheal tube somebody put in, which I can't just count that as not being part of the injury on the lip there.
Okay.
And there. Up there, not so much, but here, that's in the same place where they replaced the endotracheal tube.
The upper lip, not so much?
Not so much on the upper lip, no, because the tube going in here and down.
Okay. And as part of that, so what is this little part right here?
This,
Yes.
that's the frenulum.
Frenulum? Okay.
And that has a little bit of contusion on it, but that, again, that could be possibly from the endotracheal tube.
Okay. So I'm going to publish now States Exhibit 6. I apologize for the glare. I'm trying my best here.
Okay.
What is being depicted in this photograph?
On this, I'm just showing, or we're just showing there were some areas of bruising or contusion on the abdomen, and that's what these little areas are right here around, and this is on the right side of the abdomen right here. And that's where those injuries are. This is the costal margin, or the edge of the rib cage would be right down along here.
Okay. So you said areas plural.
Yeah, there's several.
Several. So can you specifically point in that picture to where they are?
Mm-hmm. This I will need. Red contusion on the right upper chest adjacent to sternum, so that'd be this one right by that. There's a well-healed scar there. It has nothing to do with this, but it's right beside that well-healed scar is a contusion on that one. There was one on the midline abdomen along the upper margin. That would be this right up here. Those areas right there. There's another red contusion on the left upper abdomen along the costal margin. So that would be this contusion. This is the costal margin right here, so it'd be right in that area there. That's what that discoloration is. And then the others are other injuries on the body.
Yeah. So, and this is State's Exhibit 8.
This just shows some of the same areas of hemorrhage around the umbilicus, the belly button. There's some contusions around there that I measured and took photographs of.
So how many injuries are to that that you locate?
Six different.
And you found other external injuries, correct?
Yes, there was abrasion on the underside of the scrotum.
Okay, and this is State's Exhibit 10.
Yeah, this is just, this is an abrasion, not a contusion. It can be contused abrasion. It can have an abrasion that also has hemorrhage around it under the skin. And this is the abrasion though, right here. And then there's some contusion around that. But this is the injury that's right underneath the underside of the scrotum, which is right in what they call peritoneal area, right underneath between your buttocks and your scrotum. Or male.
So you can have a seat.
Oh,
Yeah, sorry, thank you.
sorry.
All right, so we just talked about the external injuries that you observed, correct?
Correct.
Okay. And as part of the autopsy that you performed on the child, did you find any internal injuries?
Yeah, we did.
What kind of internal injuries did you find?
The major internal injury that I saw was a laceration of the liver. And I'll refresh my memory here with how long it was. A 2.5 inch laceration of the liver at the attachment of the falciform ligament, which is where the liver has a right lobe and a left lobe, and there's a ligament that goes right between them. It's right next to the largest lobe of the liver. There's two lobes. Largest was on the right.
Now, I think you said it was either the main or the major injury that you located.
There was other hemorrhages in here.
Well, then let's talk about those.
Okay,
You
sure.
want to
There
all of the internal injuries that you found?
Okay, sure. There was a hemorrhage on the scalp. When we reflect the scalp, what we do, we reflect the scalp means that we open it. In other words, we make a cut across from one side of the head to the other. And then we take the scalp and pull it forward this way and pull it forward and back. And then that in the right and the back right, I think it's the back right, right posterior parietal, which is back in this area, there was hemorrhage in the scalp there. So that was indicate that there was some type of trauma in that area. Something caused that hemorrhage in the scalp. Also, there were there was also at the vertex. There was some hemorrhage at the vertex, which is the top of the scalp. The anterior abdominal wall muscles, in other words, your six-pack or whatever you want to call those muscles in the front, the rectus abdominis muscles, there was hemorrhage in those. So that's from some time of trauma to those muscles that were caused them to bleed. The tissue in the mesentery, what the mesentery is the fat, in your small and large bowel, kind of goes like this, fish like back and forth through your lower abdomen. And between that, what holds that together is mesenteric fat. And there's a lot of blood vessels in there. Well, there was hemorrhage in these blood vessels and in the fat of the small and large bowel. And then the laceration of the liver was that was the major injury that I saw. And about 200 ml of blood, which is
When you say ml, what do you mean?
oh, milliliters. I'm sorry, 200 milliliters of blood, which is probably the size of the amount that would hold in a cola can. There was hemorrhage in the pancreas, which is right there with the small, right next to the small bowel. There was hemorrhage in the testicular cord, which is the cord that holds the testicles. So near the same area as that abrasion was. And there was some serosal hemorrhage of the intestines. Serosal surface of the intestines is just the top surface, and there was some hemorrhage in that. Also from trauma.
Right, so this is State's Exhibit 11.
Okay,
What is that?
that's the, this is it's the right lobe of the liver. The liver sits right up here under your diaphragm, or right below your diaphragm. And this, I'll perform a little bit of this thing right here. And it's right in the middle between these two lobes. Like I said, this is the right lobe of the liver is large, and it tapers and gets smaller over this side. But there was trauma to this part of the stomach that caused that to tear. The liver is a pretty solid organ, but it's still very friable, meaning you can tear it or push into it easily.
Okay.
So it doesn't take much force.
Sit back down. So as part of your role as a medical examiner in performing the autopsy, do you determine whether there's a method, manner of death?
We do. Our job is to determine cause and manner.
Okay. And what information do you use in order to make that determination, provide that opinion?
Well, partly is we base it upon the coroner and law enforcement because they will tell us what circumstances would require this person to see, to brought it to us to be the autopsy. The other thing is then we take into consideration what injuries we see, and is it something that would be consistent with one incident, or could it be consistent with several different incidents, especially with child?
So when you say incident, what do you mean?
I mean, was it just one thing? Was it just a lacerated liver, or was there other things that we can document that were? So that's our part of our job is to determine all these different things, whether what one or which ones contributed to this person's demise.
Okay. And did you find just one thing?
The main thing was hemorrhage was the main reason. The laceration of the liver, hemorrhage, and the hemorrhage in the abdominal, the intestines, things. That all collectively contributed to that.
Okay. You said collectively.
Yeah.
But there's evidence of other injuries, right?
The injuries, the external injuries, were all ones that we would consider. We would consider those. We'd look for something, especially in the shop. We look to see what kind of injuries they have. In children, a lot of the injuries that we see on a child are not necessarily in this case, but when children will see where they're a toddler or something, they may have scrapes and things like that from walking into furniture or falling down or things like that. But we don't see a lacerated liver with that.
Okay. Well, when you performed the autopsy, did you find any of those bruises or scrapes on any of his extremities?
Not on the extremities. It was mostly on his mouth and his abdomen.
Okay. So what, in your opinion, was the cause of death?
It was a blood force trauma of the abdomen and the liver.
Okay. And was that laceration of the liver?
Correct.
Blunt force feedback?
Correct.
Laceration of the liver? Okay. And what was the manner?
The manner of death we determined to be homicide.
Okay. So so you said that you based this on kind of the information that you gathered plus the autopsy, whatever you find in the
Right.
autopsy. Is this a scenario where it could be an accident?
In this case, no.
Okay, why do you say that?
These injuries are ones that it doesn't support an accident. If a lacerated liver is something I see like a car accident. Lacerated liver is serious. I mean, that's a major injury. And the story that we were told or the information we were provided didn't indicate that this child had been in any kind of situation where he would get an injury to his liver that devastating.
And you say it's a major injury, and I think you kind of put it in the context of a car accident.
That's
Are you referring kind of to the force that's needed?
Yes.
Okay.
Yeah, exactly.
Okay. How much force do you think is needed to lacerate the liver?
Well, it would take a significant amount because the liver is somewhat protected by the abdomen, so you've got to put some force onto that. And the reason I say car accident is because we do see that in car accidents. We see a lot more injuries than just that in a car accident. But this was directed, focused on that abdomen and that liver. In other words, this was to get that falling down on your belly. You're not going to get a lacerated liver. falling out of a bunk bed, you're not going to get a lacerated liver. The only way you would get that is if you fell onto something. And it would have to be something significant that was hard, that enough that whenever you fell on it or were high enough to fall on it and hit it hard enough to push in far enough to lacerate your liver. We don't see that in kids.
And is it fair to say that if you did fall off a bunk bed and land on a traffic cone, you would see one impact?
Well, yeah, if we're talking about like one of those plastic cones or something like that, and that would have to, in my mind, that plastic cone would maybe not even, but that type of shape, it gives you a focus. A focus point is the top of that cone. If you're falling from a height and you hit that, possibly went in, in deep enough through the bowel and hit the liver and lacerated. But just falling from the bunk bed or something like that, I wouldn't expect to see a lacerated liver.
Could this potentially have been caused by CPR?
It's unlikely. The reason I say that is because the CPR that from what I understand, that was performed was done at the pediatrician's office. And a pediatrician would know not to push on the abdomen to do CPR.
Right. So when you're doing CPR,
You push on the chest over the line of the sternum.
okay. So let me ask you this. So it took a while for this report to be generated, right? Your autopsy report.
It takes a little while, yeah.
Yeah, but I mean, I think this one probably took longer than normal.
Well, we had to wait for toxicology results and we had to
Okay.
wait for histology results,
Okay.
which is looking at tissue under the microscope.
Okay. And so, I think, were you able to determine the time of death?
No.
Or, excuse me, let me rephrase that. A time for when the injury occurred.
I can't give you it wasn't days. It was probably hours.
Well, and that's what I'm referring to. So do you recall a number of months later that there was a meeting with some people where you guys went over it and
Well,
discussed
I went over with the chief there.
With the chief?
The chief medical examiner. His name is Jonathan Eisenstadt.
Okay.
Yeah.
And at that point, was there a time frame for the injury?
I would have to look back. I'm not sure. Jonathan's very good at what he does, but I don't remember.
No, that's okay.
He gave us
That's
the
okay.
time.
But you just recall that there was another medical examiner
Right,
who
this was
got
important.
involved.
Right, this was an important case to look at very carefully, so I included the chief medical examiner, and I don't remember if there's anybody else, but we went over the case. And I'm sure if he came up with a timeline, I just don't remember it.
Thank you, sir. You can be seated. Can you say your name for the record, please?
Jonathan Eisenstadt.
Can you spell your name for the court report?
Sure. JONATHANEISENSTAT.
And how are you currently employed?
Currently, I wear a couple hats. I still perform autopsies at 2 medical examiner offices, Cobb County in Metro Atlanta and New York City, where I did my training. So I go there about once every month and a half or so to do cases. I also do autopsies for 2 Emory hospitals, St. Joseph's and Johns Creek. And then my other hat is doing consulting work as an expert witness in forensic pathology.
And so, since you work for GBI at some point.
I worked for GBI for a while, yes.
And how long did you work for?
So I started as an associate medical examiner in 2006. In 2014, I became deputy chief, so second in command. And then in 2015, I became the chief medical examiner, which I stayed in until January of 2022, I believe.
Okay. And so the chief medical examiner, so you kind of oversee everybody who's performing the autopsies and so forth.
Right. I still did autopsies, but I basically ran the state death investigation.
And let me back up. If we could talk about your education, your educational background, you can tell us.
Sure. So after medical school, I actually started in surgery. Realized it was not the profession I wanted to stick with, so I transferred out of that after a year and a half and started general pathology training. That's if you go to the hospital, have surgery, anything taken out, that goes to the pathologist, look at it under the microscope, and at the tissue itself, make the diagnosis, let your doctor know, and the doctor lets you know if it's cancer or something else. I did that for 3.5 years, and then did a year of pediatric pathology, which is, again, the same thing as that hospital pathology, but now focusing on everything from fetuses up to around 18 years of age. After that, I did a year of forensic pathology training at the New York City Medical Examiner's Office, and stayed on 1 more year and did forensic neuro and forensic cardiac pathology training, which is looking at brains, spinal cords, hearts, vessels, things of that sort.
Roughly how many autopsies have you performed in your career?
I'm somewhere between about 4,300 and 4,400 right now.
And of those that you performed, how many were on children?
Oh, well, during my fellowship in pediatric pathology, I don't remember the exact number, but it was probably somewhere around 100 autopsies on children. And then throughout my forensic career, probably in the hundreds, because it's everything from children in like car accidents through quote-unquote SIDS, which is a different terminology now, and child abuse cases.
And of the times that you have performed an autopsy, have you had the occasion to testify to your findings in an autopsy?
I have.
Okay, roughly how many times?
In the hundreds.
Okay. And so let me, I guess I'm getting ahead of myself. So I think you said something about pediatric, you have kind of training in pathology, kind of a wide, maybe not a wide range, but there's adult pathology and then there's kind of pediatric pathology, is that correct?
Correct.
Can you talk more about your training in pediatric pathology?
Sure. So that was at New York University Hospital, so NYU. And children are not little adults. Their disease processes are different. The way they break down things can be different. And so that's why there's a whole subspecialty in that. So during that year, I did autopsies on, again, babies from fetuses. I think during that year, probably the oldest child was in the early teens. And then also any biopsies or surgeries that were performed, the diseases of childhood can be different than the diseases of adulthood. So during that whole year, any specimen that was taken out by a physician, or a clinician, would come to us and we would look at it to make the diagnosis of what disease process, if it was a disease process, what it was.
And over your career, do you have kind of continual training or education in the field?
Yes. So, I go to national conferences. I keep up with my continuing medical education, which is required to maintain your medical license. I'm a member of a number of organizations, which I actually am on a committee that writes continuing education articles for other physicians and investigators.
And, well, let me just do this. John, at this point, I'm going to offer the witness as an expert in forensic pathology with a subspecialty training on pediatric pathology.
Mr. Greer, do you have voir dire or objections?
I have no objections, Your Honor.
He shall be so qualified.
So we're kind of throwing a lot of big words around, although I'm sure it can get a lot more complicated. So what is your role? So this is back in 2020, 2021. So you're the chief medical examiner for the Georgia Bureau of Investigation. I believe that's the Division of Forensic Sciences.
Correct.
So where are you kind of headquartered?
So the headquarters are in Metro Atlanta, in Decatur. And at the time, I believe we had 2 other offices. One was in Macon and the other in Cooler, which was a coastal Savannah office. I was headquartered in the Atlanta office, but I would travel, obviously, throughout the entire state, considering the fact there are 155 of the counties in the state. where we did the death investigation for them. And so I'd be traveling quite a bit, but I was headquartered in Atlanta.
Okay. And so I think earlier you testified as chief medical examiner, you kind of oversee the medical examiner's office, is that correct?
Yes.
Okay. And so other than administrative tasks, do you have any duties that are specific to certain types of cases or something like that?
Well, we would have a meeting every single day, both in the morning and in the afternoon, to discuss the cases that came in. And then we would also have meetings, and this was with all the offices, about difficult cases. And then just because of all those subspecialty training that I had in pediatrics, neuro, and cardiac, a number of the other physicians, the other medical examiners, would bring cases to me to review and give my opinions on.
And so did it come to your attention that an autopsy had been performed on a child named Karter Ambrose?
Yes.
Do you remember when that was?
I remember that it was in November of 2020 is when the case was performed. I have to be honest, I don't recall when I was first notified of the case.
Okay. But at some point, did your involvement increase in that particular case?
Yes.
Okay. And what was your involvement? What was the reason for that? Can you walk us through?
Sure. So the general approach to a child death is, just like any other case, we have to look to see if there's traumatic injuries, if there's natural disease, is there something that predisposes the child to something, and then obviously since the child usually does not have the ability to, or may not want to convey whatever may or may not have happened, we have to look at the case and see if it fits with a specific story. And so this was a child with a fairly isolated injury. And I say injury again in a general term. What caused the liver to be injured? Was it an inflicted injury? Was it an accidental injury? Could there have been an underlying natural disease that predisposed the child to bleeding or softening of the tissues, so not as much force would be needed to cause the liver to be damaged? So Dr. Brown, who he just testified, I believe?
He did.
Okay, so Dr. Brown performed the autopsy, and at that time, every medical examiner office is extremely understaffed. So he was coming back and helping us do cases. And obviously, child death is well, I guess we would call it a high priority case. And so when I was notified about it, and it was an isolated injury, I wanted to review the case. And this is where the investigative side and the medicine side need to come together. And so I got involved because there were questions by law enforcement or the investigators, the coroner, and then eventually I called a meeting of all of us together so we could sit and go over the facts and the circumstances that the investigators were told, and if it fits with what we found in autopsy.
Okay, and so you guys had a meeting,
Yes.
and I believe it was Zoom or something, with a whole bunch of people.
Right, because we were all in so many different places. I believe Dr. Brown was either in Ohio or Pennsylvania, I can't remember. I was at headquarters. Perry, which is usually about a 2-hour drive. Today was a 3-hour drive because of just typical traffic. So it was just easier for all of us to do it in a Zoom. And the reason I wanted a Zoom is because I wanted to show pictures. Sometimes that's easier to understand what happened than just verbally.
Okay, and so you come in to look at this, and I think you said it was some people had some questions.
Yes, I'm sorry, I didn't mean to interrupt.
No, you're okay.
Not uncommon in difficult cases and childhood cases.
Okay, and so you were called in to try to help answer those questions.
Yes, I had looked at the case already. It had not been finalized, meaning the autopsy obviously had been performed, but there's a lot of other studies that need to go into it. And I actually added some more work that I wanted to look at myself. And then when that was done, I called the meeting so we could all come together.
Okay, and what was that work that you did?
So I went back and put in, sometimes when we do an autopsy, we'll save some tissue in formaldehyde if it's that's a preservative, so it doesn't continue to denigrate in essence. And so I wanted to go back and put in more sections of the liver because when I say sections, those are tiny little pieces that get processed onto slides, and then we look under the microscope. And so I wanted to look at more of the liver to see if the liver was normal, meaning before the injury, if it was normal, and then also to look at what type of reaction was there to try and put it into a time frame, the injury.
So I think there's kind of two parts here, right? So I think maybe there's a kind of symptomology, and then this time frame portion that you looked at. Is that correct?
Well, the symptomatology would be the investigative side.
Okay.
There was no doubt that the child died because of a liver injury. Now comes the question of what was the underlying cause of that. And especially in cases where timing can become an issue. Childhood deaths are very common with timing as issues, and then there's some others where we want to know how long the injury's been there. So for me to feel comfortable, I went back and I put in more sections. So that's the timing aspect.
Okay. Well, but let's back up to the underlying issue aspect.
Sure.
So what all did you do to see if there was an underlying issue? Why would you look at an underlying issue and so forth?
Right. So anyone who knows anybody that, let's say, now I'm moving away from children for a second, just to give an example. Someone who is a chronic alcoholic and has liver cirrhosis. The liver is very important for blood clotting. And so if you know someone who has cirrhosis, if they fall, they can get a huge bruise. Whereas someone who doesn't will get the normal bruise that will go away after a week or so. So since this was a liver injury, and the liver led to bleeding, and that's essentially what caused the child's death, I wanted to make sure that the liver itself did not have any underlying cirrhosis, or a lot of genetic disorders affect the liver. And I sort of got off track from your question, I think. But we, just like in the hospital pathology, we look at the body, we look at the tissue, and then we look under the microscope. And each one of those can take us further and further into what a diagnosis may be. So the long and short of it is here, I looked at all the photos taken at autopsy, I looked at the slides that had already been taken, and then I went back and put in more slides. And I did not find any natural disease process that could account for the child's death, and I did not find any natural disease process that would predispose the liver to having an injury.
So the liver was healthy other than the injury?
Other than that, essentially everything was healthy. And you know, the child, if I remember correctly, had a history of asthma, and that's very important as well. And that we see that in the lungs, but in this child there was no evidence of an acute asthmatic attack.
Okay. And so, when you're looking at whether or not there's an underlying issue or disease, why is that important?
For predisposing factors. Again, if I were to fall and hit my head, I probably should not have bleeding over my brain. Whereas somebody who may have that cirrhosis or some underlying disorder, same exact fall, may predispose to bleeding. So with the child, I just wanted to make sure there was no genetic or molecular or basically any underlying natural disease that would predispose this child to dying.
And is that important in the context of the blunt force injury?
Absolutely.
Okay, why is that?
Well, I mean, some of these underlying disorders can predispose someone to bleeding. Some of them can make the tissues change and get softer, so can be damaged easier. And so here, the liver looked normal except for the area around the injury. And that was all due, the changes were all due to the injury. So I didn't find anything that would make this child susceptible.
Okay, is the liver easily damaged?
No, it takes a decent amount of force to cause a laceration of the liver. We see those in motor vehicle collisions and in significant blunt force injuries.
Okay. So then kind of the second part of this is, I think you talked about time frame.
Yes.
Can you elaborate on that?
Sure. So, for any of us who've had a bruise, going back to like sort of a simple comparison, we know the bruise can be like purple or red at first, and then over a few days it may turn to yellow, and then after the yellow it can go brown and go away. If I were to look under the microscope, I'd look for very specific cells to tell me how old that bruise is. Because I can't tell you how old the bruise is just looking at it. Even with the yellow change in color, I have to see a specific cell under the microscope to say, this is at least 3 days old or not. So it's the same as any other tissue, including the liver, right? Let's say you cut yourself. You're going to have that cut with the red around it from the bleeding. Then it may turn yellow a little bit. Then you get the scab. Then you can get a scar. The organs do the same thing in a healing process, in essence. So the only way to age the liver injury is to look under the microscope. And when I look under the microscope, I look for blood, and the blood cells will start normal, and then they'll degenerate. I look for inflammatory cells. There are different types of inflammatory cells that can help me age it. I look for these spindly cells that come in, and that's what ends up forming a scar. And then I look for that yellow, that cell that's called hemosiderin. It's a breakdown product of blood, and that shows up at around 3 days after an injury. And we use a very special stain called an iron stain because it contains iron. And if we see it, we know that injury's been there for about 3 days. If we don't see it, and then we can add in all the other inflammatory cells, we can get an age range to that injury.
Okay, and so when you looked at what you were looking at, and considering all these different things that you just explained to the jury, what did you see?
So I saw blood that was degenerating. I saw the liver tissue dying, which in the autopsy report is called necrosis. I saw inflammation. I stained it for iron. I didn't see any iron. Even before staining it with iron, I didn't see any of that yellow discoloration. I did not see any of those spindly cells coming in to try to heal it. So when I took all of that together, it told me that this injury occurred somewhere from 1 to 3 days prior to the time the child died. So the pronouncement of death.
Okay, so if you take the pronouncement of death, you have to go back full 24 hours. Is that correct?
Right, somewhere around 24 to 72 hours prior to the death.
Okay, so if you died Tuesday morning, you're going to have to back up, right? So Monday morning.
Right. So the injury would have occurred somewhere from Monday morning back to Saturday morning.
So obviously you're looking at internal things, you're looking at slides. Are there kind of external symptoms that can be present that someone may be experiencing that could indicate a laceration in the liver?
Well, I mean, there's bruising can help us identify where the impact occurred. And that's what I said. I looked at the autopsy photos, which showed some bruising in the right upper quadrant, which is where the liver is beneath, as well as some on the head, but there was no internal head injury. So the bruises can sort of guide you to where the impact happened.
Would someone potentially be throwing up as a result of the injury?
Oh, those kind of symptoms, yes. So as a person, just think about anything going on in your intestines, right? The liver takes bile, condenses it into the gallbladder, which shoots it out into your intestines. The pancreas, which has some hemorrhage around it, has a whole bunch of enzymes that come out and help digest certain things. And so if you have an injury to any of that, nausea, vomiting, abdominal pain, can be. Take away the abdominal pain, the nausea and vomiting are sort of non-specific. But again, nausea, vomiting, and abdominal pain would point us towards an abdominal injury. Or a natural process. But again, that's why we do a complete autopsy and we look under the microscope.
And so, you've given us this time frame, right? And you said that you reviewed kind of the case file, you guys had this meeting, you familiarized yourself with it, and you know, it's been deemed a homicide, right? With blunt force impact to the abdomen causing the lacerated liver. Do you guys look, and you've described a lot, but do you look at, it's a homicide, and I know that you referred to car wrecks earlier, stuff like that. Why isn't it an accident?
Sure. So, and I'm sorry if I'm repetitive, I don't know what Dr. Brown testified to, but we basically have 5 manners of death. Natural, which we ruled out through the autopsy. Suicide, this is not a suicide, that's an intentional self-inflicted injury. Accident, and I'll explain how we determined not accident and yes, homicide. Homicide, which means death at the hands of another individual. And then the last is undetermined. And undetermined is if we don't have enough evidence to go one way or the other. So here, this is part of the investigative process, is to get the information that the investigators have compiled. To lacerate a liver in an almost 3-year-old child, you have to have a very focused injury, very focused area of pressure. And externally on the skin, there were multiple bruises. It's not a single bruise, but multiple bruises in the area overlying where the liver is located. So that moves us along the route of more likely than not a homicide at that moment. Then you think about the mechanism. A child who's running like a toddler is running around, not usually, I don't think I've ever seen, would fall and lacerate their liver. They may fall and bruise their hands, or they may fall and spin their knee, or something to that effect. So from the autopsy, we already were at the point of more likely than not an inflicted injury. And then from the investigation, there was no story that was given to us that would comport with an accidental type of death. Nothing fell on the child that we were told of. Just nothing from the investigation pointed towards an accident.
And so, something, we discussed on the phone prior to your testimony, one of the things that we discussed was CPR, whether or not CPR could cause this type of injury.
Right.
Can you kind of elaborate as to whether or not that can be true?
Sure. So CPR can cause injuries to internal organs. More often that's in an adult because our ribs are much firmer than in a child. So when you do CPR in a child, the ribs have a lot more cartilage still, so they're more flexible than in an adult. But when you do CPR, the heart is over the center and left of the chest. So you're doing CPR here. The liver's over here. The only times I've ever seen liver injury as a result of CPR is, and when I say adult, I'm talking about like in the teen ages all the way up, is when there's been aggressive CPR on an adult and you have rib fractures and because they press so hard, and then you can see the ribs are pushing down onto the liver. So that's part one. Part two, again, multiple marks that were round and circular in the right upper quadrant of the abdomen. I don't think I've ever seen that in CPR. Multiple round contusions or bruises overlying the liver. I've seen it over the chest because in a child sometimes, usually an infant, you want to do CPR with a few fingers, but that's here, that's not over here.
Let me ask you just one question. Do you charge for testifying?
I do. I mean, I charge for testifying in my consulting work. Here, since I don't work for the GBI anymore, I basically just ask for a little bit, so you have to take the whole day off.
Right, and so have you asked for that money?
I did.
How much is it?
$500.
Nothing further, no.
Yeah. And you can speak up for me, okay?
If you would, Ms. Starr, state your name for the record, please.
Sure,
And would you spell your name for the record, please?
SHIRLYTHARPE.
Thank you, ma'am.
Ms. Stark, you're gonna have to speak up. You're real soft spoken, okay? Nice and loud for me.
And if you do need to lean over the mic, that's fine too. All right, Ms. Starr, what do you do for work?
I babysit kids.
Do you do that in your home?
Yes.
Do you have your own daycare business?
No,
But you take care of kids in your home?
I do.
And back in 2020, did you take care of a little boy named Karter Ambrose?
Yes.
How long have you taken care of Karter Ambrose?
From 9 months until his death.
So let me talk to you about that. Ms. Stark, you kept him since he was 9 months old until his death.
Yes.
Did you keep him the day of his death?
No.
Did you keep him the day before his death?
No.
Let me back you up a little bit further. Did you keep him the week before his death?
I had him that Friday.
Did you notice anything was wrong with him on that Friday?
No.
When you kept him on that Friday, what was he doing that day?
Simply playing with the, he had started playing with the other kids. If he had his tablet, he was on his tablet or watching TV. Pretty much, he was alone. He was mostly to himself.
You said he was a little bit of a loner.
Uh-huh.
Did he have a nickname or anything?
His nickname with me, I called him Baby Karter.
Did y'all have a nickname for him named Eeyore or anything like that?
No.
You called him Baby Karter.
Yes.
Did Baby Karter, while you kept him, have any kind of breathing issues that you remember?
I have gave him breathing treatments before.
Did you give him a breathing treatment on that Friday that you kept him?
No.
Did you keep him all day on Friday?
I did.
Did you notice anything out of the ordinary with him on that Friday?
No.
Who picked him up on that Friday?
His mother,
And who's his mother?
Kianna Davis.
Is she in the courtroom?
Yes.
Can you point her out and tell me what she's wearing?
She's here with a white sweater on, hair in a bun, wearing glasses.
Let the record reflect that the witness has identified the defendant.
It will so reflect.
Now, you mentioned earlier that you did not keep him the Monday after.
No.
Why did you not keep him that Monday?
He didn't show up.
So no one brought him to your house?
No.
What would usually happen if a child didn't show up for daycare?
Well, the first day I did call, the second day I'm automatically going to give her a call and text. I think I texted her and asked her. I was just checking on baby Carter. She responded, please pray. He's unresponsible to the hospital. I asked her, do you need me to come? She said, no, his dad's here. Probably 3-4 minutes, I get a text back saying he didn't make it.
Did you keep in contact with Kianna after that?
Yes,
Did you attend baby Carter's viewing?
I did.
If you don't, please answer the relevance in this.
I established that she kept contact with Kianna after that?
Is there, let me see counsel up here.
Let me ask you again, Ms. Starr, you went to baby Carter's viewing.
I did.
Did you see Kianna at the viewing?
I did.
Did she say anything to you that day?
Yes, when I walked in, she came and gave me a hug. I had a T-shirt made in his honor, a mask made in his honor, and a pillow made, and I presented that to the mother and the father.
What did she do when you did that?
She, like I said, she gave me a hug, and she told me and my 2 daughters and my sister and 2 of my grandkids was with me. She took us to the room, well, she pointed to because she never did go in while I was there. Where the body was.
She never went into the room where baby Carter's body was out
No,
while you were there at the viewing?
no.
Thank you, ma'am.
And Judge, I don't understand the relevance of that.
Objections overruled. Go ahead.
Did she say anything else to you while at the viewing?
She said that she wants to remember him like he was.
Ms. Tharp, if I were to show you a picture of baby Carter, would you be able to identify him?
I sure will.
We have no objections to the photograph, no?
All right.
May I approach him?
May.
Let the record reflect, I'm showing the witness what has been marked as State's Exhibit 12. Ms. Tharp, what is this a picture of?
Baby Carter.
Is that how you remember it?
Yes.
And is this photo a fair and accurate depiction of what baby Carter looked like?
Yes.
Has been changed or altered in any way?
No.
Your Honor, at this time, the State will tender into evidence State's Exhibit 12.
Objection.
It's admitted.
So, Ms. Tharp, that's baby Carter.
That's baby Carter.
Ms. Stark, while you were at the viewing, did Kianna say anything about he's in heaven now?
She said that when I want to say either, it was the same day that he passed, I was crying, she was crying, and then she stopped and said, he's in heaven. So that was the same day he passed, that she said that.
Do you know if baby Karter was buried after the viewing or cremated?
He was cremated.
Did you think there was something odd about that?
If you don't, please.
Objection sustained.
Did you continue to keep in contact with Kianna after that?
I did.
Did she ever say anything to you about a detective on the case?
She said that the boyfriend was never questioned, and she also told me that she said that she asked me my address and said her attorney would get in touch with me, but I never heard anything back from her about that situation.
Did she ever tell you that the original detective was no longer on the case?
Yes.
What did she say when she told you that?
At one point, she said she was coming down here to get his autopsy report, and she's supposed to be coming by my house afterwards. And she stayed, I waited 2 or 3 days, and I texted back and asked her what happened to her. And she said that they was trying to railroad her, pin it on her or something to that state.
Did she ever brag to you about the original detective no longer being on the case?
Yes.
What did she say when she said that?
That he was, that he's no longer on the case, and pretty much that that her aunt had gave her the money to get a lawyer because that they kept questioning about it. And I guess after you get an attorney, you'll have to talk to her.
Ms. Tharp, I've got a few more questions for you about the Friday with the cat Karter.
Okay.
I believe I asked you earlier if he had any kind of breathing problems that day. Did he? You didn't have to give him breathing treatment?
No.
Did you notice if he had fallen or anything while he was playing with the other kids?
No.
And in your experience, keeping him seemed pretty normal that day?
No.
Didn't look like he had fallen?
No.
But then come Monday, he's not at daycare that day.
No.
And come Tuesday, he's not at daycare that day.
No.
Nothing further at this time, Judge.
Mr. Brewer?
Just a few questions, John, thank you.
Commissioner Hurd?
Yes, Judge.
Ms. Tharp, you mentioned a discussion that you had with Kianna about your granddaughter Kennedy.
Yes.
Okay, tell me about that discussion.
I took Kennedy. Kennedy was throwing up. She had diarrhea. She couldn't walk, so I pulled my car up to the front, and her brother told her out to the car. She had been transferred to Macon. And the next day when I talked to Kianna, I was telling her what was going on with Kennedy. everything that I said was going on with Kennedy, she was saying the same thing that was going on with baby Carter, that he was throwing up, he had diarrhea.
Did she ever have any kind of discussion with you about him falling?
No.
She never said anything about Carter was on the bed, he fell back?
Yes.
Okay, tell me about that.
This may have been the same day that he passed, and she said he was on the bed and he fell back and he said, oh,
Did she say anything else?
that she think that he passed when he was in the car with the boyfriend while she was on the phone.
Did she ever blame the boyfriend to you?
No.
Let me ask you a couple more questions about the Friday that you kept informed about. You would have changed him that day?
4 or 5 times.
Changed him every day? That was normal?
Every day.
And you would, I assume because it's a daycare, you would feed the kids, right?
She brought his food, yes.
So, let me ask you this then. Kianna brought his food,
Yes.
and he ate that day.
Yes.
Did he seem to have any problems eating?
No.
No problems eating, bowel movements normal?
Yes.
Did he eat a lot?
He ate? Yes. He ate what she brought.
Did he seem happy that day?
Fine.
So, for all intents and purposes, a normal day for him.
A normal day.
And because you would have changed him, he was still in diapers, right?
Simple up, yes.
Still in pull-ups. Did you see any bruises on him that day?
None.
Any bruises on his genitals, his scrotum, anything like that?
No.
And just to clarify, you hadn't seen him throwing up that day or anything?
No.
Thank you, Ms. Clark.
Nothing else, Sean?
All right, Ms. Stanley, if you would, state your name for the record, please.
Kiyon Benton.
And if you don't mind, would you spell that for the court reporter?
First name is Katie, as in kite, I-Z, as in zebra, E-T-T-E. Last name is spelled like Daniel with a Y, so D-A-N-I-E-L-Y.
Thank you. All right, Ms. Stanley, what do you do for work?
Insurance agent.
So you're currently an insurance agent.
Mm-hmm.
At some point back in 2020, did you sometimes help your mom at the daycare that she had?
I would be there sometimes, but I wouldn't say necessarily like help, because I work for her or anything. But I would be there sometimes, like I'd be around the children.
Were you there on the Friday before baby Carter passed?
No.
But you do know baby Carter.
Mm-hmm.
If I were to show you a picture of baby Carter, would you be able to identify him?
Yes.
May I first judge?
You may.
Let the record reflect that I am showing the witness what's already been tendered into evidence as states Exhibit 12. Ms. Stanley, is that a picture of baby Carter?
Yes.
Is that how you remember him?
Yes.
Ms. Stanley, do you know Kianna?
Yes.
How do you know her?
I think the first time I ever knew Kianna, we went to high school together. I think she's maybe like a grade ahead of me. We didn't really like have any interactions or anything during school, but I got to know her a bit more once my mom started, like iPads and stuff like that. Sometimes she may have to contact me to let me know that, she's coming in on the way to come get him or something like that. But I think we probably started talking more after Carter's passing.
And your mom is Shirley Carter, right?
Yeah.
And she would feed Carter sometimes?
Who, my mom?
Yes.
Yeah, she was a daycare.
So Kianna would sometimes reach out to you to let you know if they delayed, anything like that?
Not many times, but sometimes if I was there. Or if I had to contact her, or something like that. Not many times.
Do you remember the day that Karter passed?
I do.
Were you with your mom that day?
Mm-hmm.
Did Kianna call your mom that day?
I think my mom called Kianna, or at least text her, one or the other. I just know she was reaching out because he missed daycare. Might have been like day 2, and so she'll normally reach out to the parents. But I think she either called her or text Kianna. I know they had a phone conversation. I was right there. She was on speaker talking to her.
So you were able to hear Kianna too? What do you recall from that conversation?
I think my mom might have asked, if he's okay. Maybe asked why he, hadn't been there. I just know that Kianna said that he wasn't doing well, or that they were in the hospital. That's what I recall.
Did you keep in contact with Kianna after this?
For a little bit.
Tell me what you mean by a little bit.
I'm saying that because I don't remember the exact time frame. I feel like maybe up until March of 2021. Maybe in March of 2021. So a couple of months.
So just a few months after that. Did you see Kianna in person after that day?
After the Karter passed?
Yes.
I remember December the 18th. I don't remember that date because of text messages, but my mom always does like a Christmas party for the kids. Kianna came to my house to get food, I believe, that day. And so we talked that day, and then I saw her at David Carter's viewing at the funeral home. Those are the only 2 times.
What do you remember from the viewing?
I remember when I first came in, I naturally went up to Kianna. I gave her a hug. I remember I was crying. She was like kind of comforting me a little bit. And my mom, obviously a lot of my friends and family, they knew him, so they were there. I remember going in to see him. I remember he had on after he was holding the car. Kianna didn't go in the room, from what I remember. So that's it. I don't think I had any other like interactions with her there. I don't think.
You mentioned a second ago that Kianna was kind of comforting you.
Yeah. Yeah. I was crying.
Was she crying? Was she crying?
I don't see the relevance of that, Your Honor.
Objection sustained.
You mentioned something about a little car a minute ago. What is that?
I believe he was holding the car. He always played with cars and stuff like that. Fire trucks and stuff at my mom's house. I believe he might have been holding the car in a casket, from what I remember. I remember he thinking he had like a little hat on. I just don't remember what he had on.
In those few months that you kind of kept in contact with Kianna after Karter passed, did she ever tell you that she found out why he died?
No.
Did she ever tell you anything about an accident?
No, the day that she came to my house, the day of the children's Christmas party, I remember her asking if Kadeem, the child's father, if he had told my mom or told us how he passed or what was the reason for the passing. I remember saying no. And she said that he had a lacerated liver. And that was like, I guess, me and my mom's first time hearing that. Obviously, my mom was a different conversation, but I did relate to her, like what happened. Because Kadeem hadn't said anything. But she said that she had Googled how that could possibly happen because she didn't know how. And that Karter.
Can I please, hold on.
Let me see counsel up here.
Carter, she asked if Kadeem, the father, had told us about the passing or how he passed. She mentioned that he had a lacerated liver. I didn't know what the heck that meant. But she said that she had Googled to see how it could happen, but she didn't know how. And that she mentioned that I believe sometimes Carter would like jump off the beds or like couches or something at home, and she wondered if that's how it happened. And that was the end of that.
So she mentioned after her Google search to you that he had jumped off the bed or the couch or something like that?
Basically that I guess sometimes he, he plays or whatever, he's active at home, and that maybe she was wondering if that's how it could happen. And that I guess she was Googling how like this child feel lacerated liver.
Did she ever tell you that she saw him go off the bed or have an accident, anything like that?
I don't recall, I just remember her saying that sometimes he was active at home and make her jump off the couch or the bed, something like that.
In the time that you had contact with her after Carter's passing, did she ever blame anyone for Carter's passing?
No.
Did she ever blame medical personnel for Carter's passing?
Repeat that, sir?
Did she ever blame the EMTs, the nurses, medical people?
No.
Did she ever say anything about he had diabetes?
No.
Nothing further.
Thank you, City, for your hand down. Can you state your name for the record? please?
James C. Kennedy,
Can you spell your name for the court reporter?
James Kennedy.
Mr. Kennedy, do you know who Kianna Davis is?
Yes, she's my granddaughter.
Okay. And do you see her in the courtroom
I
today?
do.
Can you tell me what she's wearing?
She's wearing a white sweater and glasses.
For the purposes of the record, it's identified. Do you know Karter Ambrose?
Yeah, he's my grandson.
Who's your grandson?
Great-grandson.
Great grandson?
Yeah.
And if you turn around and if you could look at the screen,
That's him.
that's him. Now, I know it's been a while, but do you remember 2020, November 2020 at all?
No, I don't.
Okay. Do you remember when Carter died?
Not the exact date. No.
Okay. But does fall 2020 sound right?
Yeah.
Okay. You remember him being at your house at all during that time?
Yes, he was at my hospital that Saturday before, previous Saturday before.
Okay.
Saturday or Sunday with one. He was at my house that weekend.
Okay, okay. You don't remember if it was Saturday, Sunday?
Right.
Okay. And who was he with?
Yeah.
Was it just the three of you?
It's,
Was it just the three of you at the house?
Yes.
Okay. Do you remember what time they got there?
Not really.
Okay. You recall how long they stayed?
Couple hours.
A couple hours. Did Kianna cook dinner or something for you?
Didn't say.
Okay.
I think she brought lunch for him.
Okay. And what was going on? Was everybody just hanging out?
Yeah.
Hanging out? What was Carter doing?
What 2-year-old do?
What was that?
Play.
He's playing? What was he playing with?
Refrigerator magnets, broom and dusting, that kind of stuff.
Running around?
Just running around being a 2-year-old.
Did he seem happy?
Seemed happy to me, he was always happy.
Did he seem like he had any kind of injuries or pain?
No.
And you don't remember what time they left?
After a couple of hours.
After a couple hours. Was he complaining about anything?
No.
Did he throw up at all?
No.
Nothing for me, Ron.
Mr. Drew?
Thank you, Don. More Ms. Rose.
swear or affirm testimony about you will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you, sir. You can speak up. Can you state your name for the record, please?
Kadeem Ambrose.
Can you spell that for the court reporter?
Kadeemambrose.
Thank you. Mr. Ambrose, where do you live?
I live in McDonough, Georgia currently.
Okay, currently. You live in Middle Georgia at all?
I used to.
Okay, when was that?
I moved from Middle Georgia in 2021.
Okay. Are you employed?
Yes, sir.
How are you employed?
I am a firefighter with Gwinnett County.
When you lived in Middle Georgia, how were you employed?
I was a firefighter with the city of Warner Robins.
Okay. So did you live in Warner Robins when you worked for them?
Yes, sir.
All right. Do you know Kianna Davis?
Yes, sir. Yes, sir.
How do you know her?
She's the mother of my child.
Okay. The two of you were in a relationship?
Yes, sir.
How long did that relationship last?
Approximately 4 years, 3 years.
Did y'all live together?
Yes, sir.
Where'd y'all live together?
First apartment was Sandpiper off of Leisure Lake. Then the second apartment was off of Lakeview, I think is the name of the road.
Lakeview? So y'all lived together at Lakeview?
Yes, sir.
All right. When did y'all break up?
March 2012.
Okay. Were you guys living in Lakeview at that time?
Yes, sir.
All right. And who moved out?
I moved out.
And so Ms. Davis stayed behind?
Yes, sir.
Okay. Do you remember the specific address?
To our
To the
apartment.
Lakeview apartment?
11 something. I really don't remember.
Was that apartment in Houston County?
Yes, sir.
And do you see Ms. Davis in the courtroom today?
Yes, sir. Yes, sir.
What is she wearing?
She's wearing a white and gray sweater.
For the purposes of the record, he has identified the defendant. Now, you said y'all had a child?
Yes, sir.
Okay. What was that child's name?
Karter Ambrose.
And when was he born?
January 14, 2018.
2018. So I'm going to show you what's been previously admitted into evidence of State's Exhibit 12. Do you recognize that? What is it?
It's Karter.
It's Karter. When was that photo taken?
This photo was taken right before I took her to daycare. I think it was November 12th,
November 12th?
2020.
What were you guys doing that day?
That was in the morning, and I just got him ready to take him to daycare. And we just started in the morning, brushed teeth, eat breakfast, and we left the house around 7:30.
And you took him to daycare?
Yes, sir.
Where was daycare?
Daycare was with Miss Faye off of Russell Parkway.
Is that the last time you saw him alive?
Yes, sir.
So I want to back up a little bit. So you took him to daycare. Did you have him that week?
Yes, I did.
Okay. Where were you living at the time?
230 Caitlin Circle off of Receiving Boulevard.
And did he go to daycare that week?
No, he did not.
Did he stay with you?
Yes, he did.
Okay. And so you said you were a firefighter?
Yes, sir.
All right. So what's your schedule like?
We work 24/48, so it's 24 on, 48 off.
Okay. So if you were off, did you keep Karter home?
Most of the time. Sometimes when I'm off, I work a part-time job, so I just pick up shifts elsewhere. But if I'm fully off, then say 50% of the times I have him.
And that Thursday when that picture was taken, how was Karter?
Karter was perfectly fine.
Was he throwing up?
No, he was not.
Did he seem sick at all?
No, he did not.
Let me ask you this. Did he have any breathing problems?
He did.
He did? What kind?
So he had like respiratory problems where he would like need a rescue inhaler or a nebulizer at times.
Okay. He said nebulizers, that's like a machine?
Yes, sir.
Okay. And when he would need that machine, what would happen?
Well, for him to need the machine, sometimes it would be, like say if he has a cold or a fever, and then it always seems to tie in where his respiratory would like be affected.
Okay.
But mainly he would need it like if he's running a cold.
Okay. And what would be symptoms that he would need the nebulizer?
You would see more like him kind of struggling to breathe a little bit, like kind of using more like auxiliary muscles. So he kind of be, wheezing a little bit and like kind of struggling a little bit more to have a full breath.
Did you ever give him, you would sometimes give him these treatments? Right?
Yes, sir.
Was throwing up ever a symptom that he needed breathing treatment?
No, sir.
So, November 17th of 2020, that's the day that he died, right?
Yes, sir.
Okay. So I kind of want to get what's going on in you and Kianna with your relationship at this point?
At this point, we still communicate. It's strictly on the basis of him. We don't hang out. We don't really talk much outside of, he needs this or anything pertaining to Karter. Because main focus of our conversation.
And what was the custody arrangement, or was there one?
It was never really a definitive custody arrangement. She was sole caregiver for Karter at the time, and we just kind of made arrangements around my schedule on when I should have them.
Okay.
But it wasn't anything definitive.
Okay. Was it anything that was like predictable?
Yeah.
Okay. So tell me about that.
So we would look at my schedule and the days I have 2 days off back to back, usually like every other weekend, and also like at least 1 day out of the week. And if I can't get them every other weekend, then at least 2 days back to back in a week. So it'll just be communication on when to have them for 2 days back to back.
And so at this point, you and Kianna are split up.
Yes, sir.
Right. Were you seeing anybody now?
I was at the moment.
You were back in 2020, November 2020.
Sir.
Do you know if she was seeing anybody else?
Was she seeing anybody else?
Yes.
Not to my knowledge.
Kianna.
Oh,
I'm sorry.
yes.
Was Kianna seeing anybody else?
Yes.
Do you know that person's name?
Yes, sir.
What's his name?
Kiyon Benton.
Kiyon Benton. Have you ever interacted with him before?
Once.
Okay. So you met him once. Do you know if they live together?
I don't think so.
And so, you dropped Karter off Thursday at daycare. That's the last you see him. Now, are you and the defendant, is there any child support agreement in place?
We recently just got a court-ordered child support agreement.
Okay. And so were you ordered to pay child support?
Yes, sir.
How did you do that?
Through the court, initially when I moved, we settled on a fixed amount. And that's when I first moved out of the apartment. Then we talked about it and we settled on a set amount. But then later on, she wanted more and we talked about it and couldn't come up with the actual agreement because I was trying to stay away from actual court-ordered child support, but that's a route that we went with, and that's how we got to the court-ordered child support.
So it's court-ordered child support. So how do you pay? How much was it?
It was, if I'm not mistaken, $750 a month. And it was set to be deducted from my paycheck.
Okay. When was it set to be deducted?
I knew it was supposed to start in November.
Okay.
And that's when the first payment was supposed to happen.
And do you know if that payment was taken from you in November?
Yes, it was.
Okay. And how much was it? Was it the $750 that you said?
I think it was partial. I think it was the first half of that that came out of my paycheck.
Okay. Was there something about you overpaid somehow?
Yeah, so I wasn't too knowledgeable on how child support worked. So I knew that I get paid on Thursday, and I think I messaged Ms. Davis saying, hey, can I go ahead and just make this first payment because I know that you have there's a 5-day grace period for your rent to be due. So I'm gonna go ahead and pay the first part through the child support app, and then whenever I get paid, if it's deducted from my paycheck, then we can just, even that out. Because I did not know if it was going to be deducted from my paycheck at that time.
Okay. So, did you make kind of your own payment and then it was deducted as well?
Yes, sir.
Okay. And that weekend, what all were you doing? So, you dropped them off Thursday, then Friday, so not Saturday, Sunday. Were you working? Were you at home?
I worked Friday at the fire station. I think I was off that Saturday. And I picked up a shift Sunday and Monday.
Okay.
And Tuesday.
When you weren't with Karter, would you be able to speak to him over the phone?
Yes, sir. Most of the times I would either FaceTime or talk to him on the phone.
Would you do it like once a day or multiple times? Or
Average once a day.
Okay. Okay. That weekend, did you get to FaceTime him at all?
No, I did not.
Okay. Did you ask?
Yes, I did.
Who?
Miss Davis.
Okay. And she had Karter that weekend.
Yes, sir.
Right. What, did she talk to you at all that weekend?
We talked, I think it was Friday, when we realized that the payment was deducted from, when the payment was deducted from my paycheck. And after that was the last time we talked because you blocked my phone number.
She blocked your phone number?
Yes, sir.
Okay. And how did you figure out that she had blocked your phone number?
The calls wouldn't go through, text messages wouldn't go through, and this happened before, so I pretty much know how it is being blocked from.
Okay. How many times did you call and try to text?
I cannot recall.
Okay. Was she mad at you?
Yes, sir.
What was it about?
About overpaying on child support.
Okay. And the purpose of your calls or texts, were they just about the child support?
Before I was blocked, yes. So we had a phone call prior to, I think the last actual phone call that we had was about the child support and her saying that I messed up everything as far as the child support payments. And I'm like trying to still figure out how I did that and not really understanding how me making a payment through the Defects app and then having it deducted from my check, how would that mess up anything?
Mm-hmm.
And that's what she was mad at me about.
And were you calling as well to try to speak to your son?
That night I was.
Okay, which night?
Pretty much the entire weekend.
Pretty much the entire weekend?
Yes, sir.
And were you able to?
No, sir.
So that was the weekend. Is the only way you tried to communicate with her text or email that weekend?
That weekend I sent her just emails because calls and text was not going through, so I had to email her to at least get some type of response to her.
Okay. So I'm going to show you what I've just shown the defense counsel, and it's marked as State's Exhibit 13. Can you please look at that? Do you recognize it?
Yes, sir.
What is it?
It's an email of me messaging Ms. Davis and an email of her replying back to my initial email.
Okay, do you remember when that email was?
Yes, sir.
When was it?
It was November 16th.
November 16th, so that Monday?
If I'm not mistaken, it was either November 16th or, yes, it was that Monday.
That Monday? And is this a fair and accurate representation of that email?
Yes, sir.
Okay. Has it been changed or altered in any way?
No, sir.
Your Honor, this time we offer evidence states 13.
As long as I can cross on it, I have no objection.
It's admitted.
So I'm going to put it up on television, we'll publish it. And that is behind you. So if you could turn around and take a look at it for me. So you said that you had texted her, or emailed, sorry. Is that correct?
Yes, sir.
And at what time did you email?
10:43.
Okay, and she responded to you?
Yes, sir.
All right, can you please read to the jury what she responded to you?
Stop emailing me. No, you can't. Yeah, or talk to Karter. Leave me TF alone. And that's the last time I'm going to tell you.
What does TF stand for?
The fuck.
And that's the last time I'm going to tell you?
Yes, sir.
So this is Monday. Do you have any idea what's going on, where Karter is?
No, sir.
Did you guys have any communication after that email on Monday?
No, sir.
Was there a phone call?
No, sir.
Did she call you about needing to get Karter?
Oh, yeah. So later on that night, she did call me. And I'm not too sure if it was a call or a text. I know we did talk later on that night for her saying that I need to take off of work the following day so I can keep Karter.
Okay. Did she tell you why?
She said that he's sick and he's been throwing up.
He's been throwing up. Did she tell you how much he's been throwing up?
No, sir.
Did she tell you if anything had happened to him?
No, sir.
Okay. And did you take work off? And
I did not.
okay. Why was that?
I didn't take off of work because I was pretty much begging to even see him, FaceTime him, and I would get no response. And even to the point of like, I would kind of like make concessions with him. Like, if you let me FaceTime him and see him, then I'll take off of work and I'll keep him. And those were going unanswered. And the only thing she told me was just that he's been throwing up and he's sick. I need to take off of work.
You wish that you had?
I did.
Was that the end of your communication with her for the time being?
We talked Tuesday morning when I was already at my part-time job, and that's when she told me that Karter's being rushed to the emergency room now. I need to get back.
Okay. You remember what time that was?
It was in the morning time. I said approximately 8 or 9.
Okay. Did she say what was wrong with him?
No, she just said that he's being rushed to the hospital. She didn't say what was wrong.
Okay. And he was being rushed to the hospital. So where was your part-time job at that time?
I was on an ambulance in Darren.
Ambulance in Dublin? Are you EMS?
Yes, sir.
Okay. So did you drop everything and head to the hospital?
Yes, sir.
And where was the hospital?
It was Perry Hospital off of like pretty much Watson.
Perry. You thought you were going to Perry, or was it Peach County?
Peach County.
Okay. It was Peach County. Did she say anything about who had taken him? If he went to a pediatrics office?
I'm not sure if she did or not.
Okay. So all you knew was that it was being taken home?
Yes, sir.
All right. And did you end up making it to the hospital?
I did.
And when you got there, was Karter alive or dead?
He was already deceased at the time. She called me before I got to the hospital and told me that he was deceased.
Okay. And when you got to the hospital, what did you do?
When I got to the hospital, I came through the emergency bay, the ambulance bay, and they led me to the waiting room that was kind of off to the side. And that's when I saw Kianna and Kiyon there.
Were the police there?
They had hospital police staff in the waiting room as well.
How long did you stay at the hospital?
we had to wait a while before we could actually go see his body. And I stayed there until, I can't say how long I stayed there, but until it was done.
So you were ready to go?
Well, until they, I think until we went to see him and in the room, and we welcomed us to our last goodbyes with him at that time. And I think that's when the coroner was coming, and that's when we left.
Let me ask you this. So you guys lived separately. Did he have a bedroom in your apartment?
Yes, sir.
All right. Did he like to sleep in that bedroom?
He never slept in that room.
Where did he sleep?
In bed with me.
Okay. Was that kind of his thing?
Yeah.
Is that a habit that he had?
Yes, sir.
Do you know if he did the same thing when he was at the defendant's?
I can't definitively say, but from my time living there, yes.
Okay. Do you know if the defendant was upset about the fact that he wouldn't sleep in his own room?
I cannot say.
Do you know if Kianna wanted you to break that habit?
Yes, sir.
Okay. She spoke to you about that?
Yeah.
Okay. Did y'all have a funeral for Karter or a service for him?
We had a viewing at the funeral home, and then we also had a balloon release pretty much at the fire station that I used to work at.
Okay. And do you recall where the viewing was?
McCullough Funeral Home off the house.
Was the defendant there?
Yes, sir.
Did y'all interact at all?
I don't think we did. If so, mildly.
And you said there was a balloon release?
Yes, sir.
When was that done?
Can't remember the exact date, but it was in December.
Whose idea was that?
Mine,
Was Kianna involved in that at all?
not in the plan.
Okay. Did she go?
She did.
Did you have to make her go?
I don't think I made her go, but I suggested it. I would like for her to be there.
So, after the balloon release, do you remember when the balloon release was?
The exact date?
Yeah.
I don't remember the exact date, but I have pictures I can look back.
Well, I mean, so did the viewing happen first?
Yes, sir.
Okay. And then there was a balloon release?
Yes, sir.
Was it a few days, a couple weeks later?
I'll say maybe 2 weeks later, 2-3 weeks later.
And did you and the defendant stay in contact after that balloon release?
Seldom.
Seldom? Did you guys ever discuss Karter?
Yes, sir.
What was that discussion?
Just in the time frame after that.
Mm-hmm.
Most times, if we were to discuss Karter, it'll mainly be pertaining the happenings of him not being here, or the investigation and the prolonged autopsy results. It would mainly be something around that basis of what's going on with the case.
Okay. And any time did you have a conversation with the defendant about Kiyon Benton's potential involvement?
We had one interaction where it was when we got the preliminary autopsy results back, and when we got the preliminary autopsy results back, the preliminary results said lacerated liver, and I was a little mad, angry, and I was on the phone with her, and she got the results as well. And I told her, I said, Kianna, I said, if something comes back that said this guy did something to my kid, I don't know what I'll do.
How did she respond to that?
She responded by pretty much telling me, she said, how can you even say something like that? He would never do nothing like that. And he was even a better father to Carter than I was.
Was she mad that you said that?
By her tone, yes.
Did she cuss you out?
That's all she said.
You guys talk more about the situation than just that time, right?
About
So, I mean, have you guys had other conversations?
Yes, we
about
have.
what happened?
Not about what happened, but we've kept somewhat of an open contact, but we never really talked about what happened.
Well, but did she ever say what she thought happened?
No.
Did she ever blame Kiyon?
No.
Did she ever get mad at you about the fact that it happened?
Yes, sir.
What happened there? What was that?
It was a conversation we had where she stated that I should have been there to take care of him. I should have took off work and I should have had him. And if it wasn't for that, this whole thing would have happened.
So because you didn't take off work to take care of Carter, none of this would have happened?
I don't know, possibly.
Do you know what she was referring to when she said none of this would have happened?
No, sir. I guess just speculating on as
I
far as
don't you just speculate, but I mean, if you don't know, you don't know.
I don't know.
Sorry to cut you off. But you would, or at least did on one occasion, try to get information from her about what happened, right?
Yes, sir.
And what would she tell you?
She would not tell me anything, just saying she don't know what happened. Maybe he jumped off of his bed, or maybe some type of accident happened that she don't know.
Okay. Did she say anything about him being sick?
Only when we initially talked, when she told me to take off of work.
That weekend, was that the only time that she had kind of refused you access to him?
Yes, sir.
Because earlier you said that, I think you said that you knew you were blocked because it had happened before. But that was the first weekend where you weren't just blocked, but you couldn't even speak to Carter.
That was when I was blocked for an extended time. Most of the times that she blocked me, it would be for a couple hours or not even a day.
Nothing further at this time, Your Honor.
Mr. Grove, did you
Thank you.
state calls Matthew Whitehall? Do you swear affirm testimony you shall give to the court as well as the truth, the whole truth, and nothing but the truth, so help you God?
I did.
You would state and spell your name correctly, please.
Officer Matthew Whitesell, WOJTAL.
Where do you work?
Work at the City of Warner Robins Police Department.
What do you do for the city of Warner Robins?
Police officer.
What do you do as a police officer?
I'm on the patrol division, so I respond to 911 calls.
And what does that usually entail? What does your day-to-day look like?
Coming in and mainly responding to 911 calls for service, traffic enforcement, and so on and so forth.
And let me take you back to November of 2020. Were you a police officer at that time?
Yes, ma'am, I was.
Okay, did you still work for Winter Robins or a different agency?
Still with one Robin's contact career.
That being said, how long have you been with Winter Robins?
Total of just over 8 years at this point.
And have you always been patrol?
Yes, ma'am.
Were you on patrol back in November of 2020?
I was.
On November 17th of 2020, did you receive a call out of primary pediatrics?
I did, ma'am.
Okay, what was that call for?
I believe the call was titled Assist Agency as far as EMS. It was in reference to a CPR progress.
And you were right on scene, correct?
Yes, ma'am, I did.
Okay, what was going on when you got there?
I arrived on scene and observed that the ambulance, which had already been on scene, back doors were open, and if I recall correctly, medical staff was in the back of the ambulance performing CPR and still working on an individual.
Who was that individual?
That would be the 2-year-old Karter Ambrose.
And he had already been loaded into the ambulance, is that correct?
Upon my arrival, yes, ma'am.
What happened after you arrived there?
Initially made contact with medical staff to find out basic information of what was going on. We were then instructed that the child was going to be transported to the hospital, to which I did follow the ambulance to that location.
Which hospital?
Peach County Madison Hospital.
And you followed the ambulance there?
Yes, ma'am.
What happened when you arrived at Peach County Hospital?
Got to the hospital, ambulance and medical staff unloaded the male from the ambulance into a treatment room where they attempted to continue to get on further care to resuscitate the male.
And were they able to do so to your knowledge?
No, ma'am, they were not.
After that, did you leave Peach County Hospital?
Stood by momentarily until then I was instructed to respond to the residents at 6080 Lakeview Lane, or Lakeview Road, excuse me.
And that's 6082 Lakeview Road, is that your house in County?
It is.
And what happened when you responded?
I made contact with the lieutenant on duty and sergeant on duty who were providing scene security in the lead zone.
So when you arrived at the apartment, because this is an apartment complex, correct?
Correct.
When you arrived at the apartment complex and relieved your lieutenant and sergeant, what happened from then?
I remained on scene for scene security, and to my recollection was there until the scene was done being processed.
Did you speak to anyone on the scene?
I did.
Do you recall who you spoke to?
Miss.
Did you speak to Miss Davis?
I did.
Now, were you wearing a body cam at that time?
Yes, ma'am, I was.
Was that body cam on and recorded?
To my knowledge, yes, ma'am.
Was it working properly?
Yes, ma'am.
Do you regularly wear a body cam?
Every day.
Now, at the time you spoke with Miss Davis, the body cam was on recording.
Yes, ma'am.
Was she in custody at that point?
No, ma'am.
Was she free to leave and discontinue the conversation at any time?
Yes, ma'am.
Was she read Miranda?
No, ma'am.
And why is that?
Because she was not in custody, nor was she even thought of as a suspect at that time.
If I were to show you a copy of your body cam, would you recognize it?
Yes, ma'am, I would.
Madam Clerk, Your Honor. Your Honor, I'm showing the witness was been marked as 014. This is the copy of the body cam. Officer Westall, have you had a chance to review that body cam?
Yes, ma'am, I have.
And was it a fair and accurate representation of what was going on scene that day and your conversation with Ms. Davis?
It is.
Has it changed or altered in any way?
No, ma'am.
Your Honor, at this time, the state will tender the evidence states exhibit 14 and published for the jury. And submitted.
And of course, we received it.
Submitted over objection.
I was the first one there. I was there with them. Well, I was there with. Yeah, they were all pretty distraught.
They've all been since day one a part of the issues I never have to ask. And I know maybe because they automatically know.
Let me grab something. So, are you dead? They were all pretty distraught.
They've all been since day one a part of the issues I never have to ask. And I know maybe because they automatically know.
Let me grab something. So, are you dad or you stepdad? Okay. So is dad the EMT that showed up? Okay. What's his name? I am. Mom and stepdad are uncle. What's his name? What's his name? You know what his birthday was? Okay. You know where he lives?
Yes, he lives right next to the fire department on Kimberly. Right here, station number 6. Right.
Oh, okay, over by off of Tegan?
Yes, like right that little some townhomes right over there.
You know what the address is over there?
Hey, what's your address? 230 Kateman Circle. Kateelyn Circle. One around Georgia. We're going over there. Okay. I'm waiting on the cop that over there because we can't go in. We'll get a house, I guess, or whatever. Mine.
What's the name of this home where situation going on?
Phone number is 478
Yes, ma'am.
998 7199.
Okay. Thank you. I forgot to get this information earlier. So, was that? Did he? Oh, yes, he was. That's completely, had this on a personal note. I'm gonna write down my name when y'all go to do services form, you call the police department and leave a message for them. I really appreciate it. And I understand emotions run high. To let you know, I had to yell at him. Because he was sniffing the tailpipe of the ambulance, and I actually talked to the out there. He goes, I thought you were going to pull him over. I said, at one point I was, and then I was just like, no, they got an ambulance in front of me, behind me, nobody's going to go in between.
He worked so hard, and I was trying so hard to get here.
Carlson County Juvenile had to hold it because of him passing. At that point, that's the least you're concerned.
For the record, Judge, I'm pausing at 9 minutes and 21 seconds. Fast forwarded to 14 minutes and 23 seconds. I previously discussed with defense counsel that I would fast forward to it was in order to optimize the pitch.
Okay. Record will send a.
I'm waiting on juvenile because we contact outside juvenile and they run with everything. So I think we're going to get out here. So we will say about our house.
Pausing at 15 minutes and 38 seconds, fast forwarding to 18 minutes and 10 seconds.
It won't. It won't. Unfortunately, I've dealt with stuff like this quite a few times, and it won't be you until between a day and maybe a week or two. And then all of a sudden, you'll be able to degree. But let me preface that by also saying, know that if you start to progress, you start to So you did let him go?
I let him go.
You got to know mom, man.
He loved over there. And I was like, grateful that he got to feel the last time. Like, it wasn't what they thought that.
GBI. Don't forget, they get cases from everywhere in Georgia. GBI is like the FBI for Georgia. So literally, like, we get DUIs, we get blood from somebody, it goes to the GBI crime lab. They get shell casings, they get guns, they get all sorts of different stuff that they have to process and do. And of course, when there's other scenarios like this that are happening across the state, so they have those high profile cases that happens where they can get that done for whatever reason. Pretty much.
I was so crazy that he changed his sheets when I moved to the new bed, but I still pour all the bed, all the couch. There. I'm hoping that he did it like that.
When Dr. Collins gets over here, we're also going to have our parenting inventory. So basically the name, process thousands and thousands and thousands and thousands of terms. So they know what it is. And you were saying y'all have tested for COVID now?
When he got back to the trip, he got tested for COVID, came back negative.
After he started getting sick again, you don't get tested again, huh?
No, so. Since October, he went home from October 19th.
When you get back?
He got back on the 23rd.
Okay.
And
That wasn't too long.
it wasn't long. He went back. Like I said, I told him.
No, about 4 years. Did I ever go out off of your road, there was like a deer? Had to go and move the deer off the road. When you worked at Cochran High School in?
I worked at the Woodman.
Okay.
When I used to do a enrollment program for the high school.
Okay.
They send me to the high school that they are in over. Primarily to be a Jones, if they hire somebody so they can see a problem and it's Jones. So,
But they send you to Warren High School in Cochran?
high school and the House County Career Academy.
Okay, yeah.
So I go there and I do that. Whichever high school.
So what kind of classes?
I'm actually, I got hired on to be a night teacher, teaching programming next year.
All right.
Yeah, I'm just trying to keep you guys time. I know it's a big situation, stress levels up and all that. So we try to give y'all guys some space at the same time while doing our group. But it's important when this happening comes up, we have to do things like that. Things that that sort of thing. It requires one teacher, it requires you to send you guys, it requires you to listen. Usually that's the way it goes. I have to I have to listen. I have to do it. So I.
I do.
You would state your name for the record, please.
Investigator,
Investigator, where do you work?
Waterloo Police Department.
What do you do for Warner Robins Police Department?
So my role's a crime scene investigator, also late fingerprint examiner.
So you are primarily a crime scene investigator and you are also a late crime victim.
Yes, ma'am.
What do you do for crime scene investigations?
Crime scene, when we on call, we respond to different crimes.
And how long have you done that?
For 19 years.
Is that how long you work for Winter Islands Police Department?
Now, I was hired on January 29, 2007.
What did you do when you were initially hired?
I was a booking officer.
And so what did you do from there?
From there, I applied for the crime scene due to my training before to the Department of Homeland Security on fingerprint. And then I got the job in March 2009.
And since then, you have worked crime scene investigations for Winter Islands Police Department.
Yes, ma'am.
Thank you, sir. Let me take you back to November 17th of 2020. Were you working in that capacity on that day?
Yes, ma'am. I was on call that day.
Did you receive a call out to 6082 Lakeview Road?
Yeah, the first phone call that I have, it was to respond to the ER at the Perry Hospital in Peach County.
Did you actually go out to Peach County?
Yes.
What did you do at Peach County?
I met with Coroner Galpin and Juvenile Sergeant Collins to photograph and bag the child so I can send him to the morgue at Houston County.
So basically, you saw the child, Karter Ambrose's body at Peach County?
Yes, ma'am.
And you were taking photos, right?
Yes, ma'am.
Were you the one who bagged him?
Yes, ma'am.
And after you bagged him at Peach County Hospital, what did you do?
I follow EMS to the Houston County morgue, and myself, I lock him in the morgue.
So you transferred the body to the morgue.
Yes, ma'am.
And what did you do from there?
From there, just photograph the lock in the freezer, in the cooler section, and just went back to the scene.
And by the scene, what is the address for the scene?
Yeah, so the scene, okay, it was 68 Lakeview Road, apartment 2408.
And that's in Houston County, right?
Yes, ma'am.
What did you do when you arrived on scene?
When I arrived to the scene, I met with Officer Matthew. He had the scene secured. So then I also met with Sergeant Collins from Houston County, investigator, and proceed to start photographing, documenting the scene and collecting evidence as a request of the Sergeant Collins.
Great, thank you, sir. Tell us how you process the scene.
When we get to the scene, we start with photograph. We photograph the entire scene. After we photograph the entire scene, we mark the items of evidence that most likely we're going to collect. And from there, we collect all the items. If we need to do all the type of process requested, then we do that as well. Yeah.
Is that how your training process is?
Yes, ma'am.
Do you have extra training for processing things?
Yeah, we do have, depend, what is requested. We need to collect footwear evidence. We collect footwear evidence. If we have to process for fingerprint, we process for fingerprint. If we have to collect DNA sample, we do that as well. Or if we need to collect all the other foreign objects, so we also collect those.
Did you collect, let me ask you this first, actually. So you would photograph the scene.
Yeah.
Did you take photographs of this scene?
Yes, ma'am.
Okay. If I were to show you those photographs, would you be able to recognize them?
Sure.
May I approach you? You may. Investigator, I'm showing you what's been marked as state's exhibits 15 through 61. If you'll take a minute and just look at those.
Taken by me, and also the markers that I use to mark the evidence that I collect.
So you are the one who took these photos?
Yes, ma'am.
And are they fair and accurate representations of the scene as you found it?
They are.
Have they been changed or altered in any way?
No.
Your Honor, at this time, the state will tender into evidence states exhibits 15 through 61.
You said 61?
Yes, ma'am.
Okay.
We have no objection, Your Honor.
Darren,
And state it has to publish to the jury this one.
you may do so.
Officer Career, if you would kind of turn around a little bit when we put these up on the screen. Showing states exhibit 15. Can you tell me what it says?
Yeah, that's a living room area from the TV and going out to the back porch or the patio area. And those are markers 1, 2, 3 with the stains on the carpet.
And you said those are your markers
Yes, ma'am.
that you use to process the scene.
Yes, ma'am.
And those are markers 1, 2, and 3.
Yes, ma'am.
States exhibit 16. Investigator, you can tell me what this is?
Yeah, it's a close-up picture of the stain that are marked as item number 1.
And what is that item number 2 right there?
Number 2, it was another stain next to number 1.
So in processing a scene, you would notice those stains and put markers there? Is that process?
Yeah, this one.
State 17. Investigator, can you tell me what it says?
Yeah, that's a close-up picture with the ruler, so we can see how large is the stain that I'm marking.
So, just be clear, that is your marker number 1, your ruler, measuring the stain that you found there. States 18. Investigator, can you tell me what this is?
That's another medium range photograph of number 2, the stain marked with mark number 2.
So you mentioned medium range. Can you tell me what that means?
We do, the way that we, for evidence that we collect of items of evidence, we do overall pictures, medium, and close. So,
So this will be a medium range photograph.
the ruler, yeah.
States 19, can you tell me what this is?
Yeah, this is the same stain, marker number 2 with the ruler.
Stage 20 investigator, can you tell me what this is?
Yeah, that's a close-up picture of stain marks number 2 with the ruler as well.
So essentially the same picture as State's Exhibit 19, just close range.
Yes, ma'am.
Thank you, sir. Stage 21 investigator, can you tell me what this is?
Yeah, it's like a medium picture with item number 3 with the stain marks, item number 3.
Stage 22 investigator, can you tell me what this is?
It's the stain mark number 3 with the
And this will be a close range photograph?
close-up range, yes.
Stage 23?
Same stain number 3 marker with the ruler. Most of the time we take several pictures, we focus on to make sure that we can focus right and we can see it well.
Essentially, so you can get a clearer picture, is that right? And Stage 24 investigator, can you tell me what this is?
The mark number 3 with the stain also with the ruler.
So just another shot of the same thing?
Yeah, based on the lighting and close-up, and focus on that.
Thank you, investigator. Stage 25 investigator, we've moved on from markers 1, 2, and 3. Can you tell me what is shown in this photograph?
Yeah, it was a napkin with stains located in the counter next to the sink with marker number 4.
Is there a particular reason why you took that photograph?
Yes, because of the stains that the napkin contained.
The same as that the napkin contained?
Yeah.
Stage 26 investigator, the same shot essentially?
Same shot, a little closer.
And Stage 27 investigator?
And same closer shot, number 4 with the ruler.
So this is another view of the mark number 4, the napkin that's like.
Yes, and we always also use the ruler for the sides of that.
Stage 28 investigator, we've moved on from mark number 4. What is shown in this photograph?
That was a diaper that we used and some shorts that was located on the floor on the hallway bottom.
And what is that next to marker number 5?
The diaper.
So the diaper is next to marker number 5? And the shorts are next to marker number 6?
Yes, ma'am.
Do you recall why you took photos of those particular items?
Do I recall what you said? Do
Why
I
did you
recall that
take
picture? Yes, ma'am.
Why did you take pictures of those?
I took the picture because being the location where it was and also the diaper contained pieces and, it can be taken to the lab if it's necessary.
And States 29 investigator. What's shown in that photograph?
That's more like a medium close-up picture of number 5. Yeah, I can see it.
States 30, what is this?
And that's a close-up picture on item number 5, the diaper with the
And States 31.
and also a close-up picture of item 6 for the shorts.
32?
Yeah, close up with the ruler, same height on the 6.
So measuring the shorts, laying on the ground?
Shorts, yes, ma'am.
States 33. Can you tell me what's in this photograph?
This is a overall picture. This area is located in the master bedroom floor, in the carpet area, and overall item 7 through 11.
So this photograph was taken in the master bedroom, and those are marker numbers 7, 8, 9, 10, and 11.
Yes, ma'am.
States 34, investigators, tell me what this is.
Close-up picture of item number 7. It will be part of some of the from medication for the inhaler.
States 35, investigator, what is this?
Close-up picture of the inhaler right next to the Huggies. Number 9 would be one of the capsules. I think probably medication for the inhaler.
And states 37, is that a closer view of marker number 8?
Yes, ma'am, with the ruler.
And the inhaler.
Yes, ma'am.
States 38, is that a closer shot of marker number 9?
Yes, ma'am, with the ruler.
Those would be capsules for, say, a breathing machine.
I believe so, yes.
States 39, what is this?
10, market 10 will show the nebulizer, I believe, that will be the treatment for asthma, most likely. And 11 will be, I think I know the short, it's a clothing. So, 11 will be the medication package.
You said marker number 11 would be the medication package.
Yeah.
State exhibit 40, what is this?
So number 10 is a close-up picture with the ruler of the over the nose piece of the inhaler.
States 41, what is this?
11 was another capsule with a ruler. That was the medication package that I told you. That was marked 11. I couldn't see it well.
Gotcha, thank you. And states 42, investigator, what is this?
This is an overall picture of the items located by the bedside, and then marked number 12 is a clear bag with green leaf material.
And where did you locate this in the house? Was this also in the master bedroom?
This one master bedroom next to the bed, on the floor.
States 12, what is this?
That's a close-up picture of the bag containing that green leaf material, also with a partially smoked blunt. Mark 12 with the ruler.
And states 44. Tell me what this is.
It's a close-up picture of the same bag green leaf material with the blunt, marking 12 with the ruler.
States 45, investigators, tell me what's going on in this photograph.
13 was a towel on top of the bed.
So this is a towel on top of the bed?
Yeah,
And where was this photograph taken?
master bed.
States 46, what's going on in this photograph?
This is also on the master bedroom area, floor area, and marker 14. And for that's like a medication product. And 14 would be another, type of maybe part of the inhaler used to for that purpose.
So marker 14 is placed next to something that appears to be part of, say, an inhaler or some kind of medical device?
Yes, ma'am.
States 47, what's going on here?
Here's a close-up picture of the measuring cup. Also, it's one of those nose, beer nose, so it's about the maybe mucus out of the nose.
States 48, investigator, what's going on here?
15 is close-up picture of the ruler, also with that piece of equipment probably from one of the analyzer or one of the
States 49, investigator, tell me what's going on in this photograph.
This is the bedroom, the child's bedroom, and this is, it was two beds, a large bed and the child's bed, so this should be the child's bed against the wall. With a marker, I believe, 16? Let's see, yeah, 16 and 17. So 16 will be marking the stain on the bed, and 17 the pillow, stain on the pillow.
And just a note, because there's a little bit of a glare on the screen here, that marker where that glare is marker number 16.
Yeah, from here I can hardly see it, but it's 16, right? Yeah.
And that is next to a stain on the bed.
This one.
And marker number 17 is another stain.
This one.
Why did you take pictures of these particular things?
I take picture because it's, it could be body fluid, it could be vomit, it could be something related to the type of scene that I was working.
States 50, investigator, what is this?
A close-up picture of 16, marker 16, with the stain on the bed and the ruler.
States 51, what is this?
Another picture, item 16, the same stain on the child's bed with the ruler.
States 52.
17 would be the pillow located on the child's bed with the stain.
And again, there's that glare, the stain is kind of where that glare is, right?
Yeah, kind of pinkish, yeah.
States 53.
Yeah, this is another shot on the same stain on the pillow with the ruler, 17.
States 54.
And marker 18 is the pillow located on the larger bed located in the child's bedroom as well, showing the stain on that other pillow as well.
And so mark number 18 is next to another stain. Is that right?
And located in that pillow.
And so this is all still in the bedroom where the smaller child's bed was?
Yeah, a larger bed next to his bed in the other corner of the bedroom.
States 55, investigator, tell me what this is.
Close-up picture with the ruler of the stain, mark 18.
States 56, what is this?
Same marker 18, same stain on the pillow, with even closer with the ruler.
And states 57, what is this?
Same marker 18, same stain, different shot with the ruler.
states 58. What is this?
This is the kitchen area. This medication, I got this medication from one of the top drawers area on top here. Mark 19.
States 59. What is this?
Plus a picture of all the medication. We can see what medication is what. And Mark 19. Yeah.
Is there a reason why you took pictures of the medication?
Yeah, we do. We collect medication on child's dead, and most of the dead we also collect medication.
State 60. What is this?
This bag is located in the between, like in the bar area of the kitchen, on top of the stool. And I marked the whole bag as 21 was collected completely, entire bag, and also contained some medication as well.
And state 61. What is this?
Plus a picture of market 21 from that bag. The medication was inside the bag.
And so all of the items that are next to these markers, that would be physical evidence that you collected.
Definitely. Some of the stains were swabbed to later on. If the detective wants to submit it to the lab, he can, but pillows were collected. I cut the stain on the child's bed. I took the stain completely from the bed.
Now, do you do testing for, say, swab stains
No.
in-house, or is that sent to GBI?
Yeah, the detective will send it to the GBI. We just do the collection.
Do you do any more of the investigation other than process the scene?
All the documentation and collection of the crime scene.
Mary's right hand, please. You swear affirm testimony about giving me the truth, the whole truth, and nothing but the truth, so help you God. I do. Thank you, sir. Can we see you? Can you say your name for the record, please?
Justin Heath Collins.
Is that just common spelling on everything?
Yes, sir.
Okay. Are you currently working in law enforcement?
No, sir.
Okay. What do you currently do?
I'm currently a realtor, landmark realty, and home repair business.
Okay. And prior to that, did you work in law enforcement?
I did.
Which agency did you work for?
I was with the Houston County Sheriff's Office.
How long were you with the sheriff's office?
From November of 2010 to February of 2021.
Were you in the same role at the sheriff's office? Did you have different roles?
I had different roles. I
Okay.
was promoted to the juvenile division around 2004.
When you say promoted to the juvenile division, what is the juvenile division?
The juvenile division of the sheriff's office, where the primary function is to investigate either delinquencies involving juveniles or also child victim crimes.
Okay. And were you working in that capacity November 17th of 2020?
I was.
Were you the on-call investigator that day?
I was.
Did you get a call about a deceased child that day?
I did.
Where were you when you got that call?
I believe I was at the juvenile office.
Okay. You remember about what time that was?
I believe it was morning time.
It was morning time, kind of early in the morning. That kind of maybe just got into the office.
I believe so.
And when you got that call, where did you go?
I was responding to the Peach County Hospital.
Okay. And when you got to Peach County, was there any understanding that you had about kind of what was going on before you got to Peach County?
Prior to my arrival, my knowledge was that I had an unresponsive 2-year-old that was in route to the hospital.
And when you got to Peach County, were you able to identify the child involved?
Yes.
What was his name?
Karter Ambrose.
Okay. Do you remember how old he was at the time?
Around 2 years of age.
2 years. At Peach County, was he still alive when you got there?
No, sir.
He was declared deceased at that time?
That was my understanding.
Okay. Was there anybody there? Was there anybody there that you had any contact with associated with the child?
My initial contact was with hospital staff who informed me of the child was deceased. And then at some point I made brief contact with the family.
Okay. And at this point, did you have any kind of working knowledge about how the child may have died?
At that point, no, sir.
Okay. You didn't have any information about it?
Prior to speaking with the mother. No.
Okay. At some point, were you made aware that there was a breathing issue with the child?
I was informed of a history of breathing issues with the child, and that the child had prior medical issues mentally.
And do you remember how long you stayed at the Peach County Hospital?
I don't, but it was probably at least an hour or so.
Okay. And then where did you go after the Peach County Hospital?
I responded to the apartment.
Okay. Whose apartment?
Miss Davis' apartment.
Okay. Do you remember the address of that apartment?
It was on Lakeview Road, 68. Lakeview Road.
Okay. Is that in Houston County?
It is.
And you said that Miss Davis lived there. Was there anybody with Miss Davis when you first interacted with her?
There was her boyfriend, Mr. Benton.
Okay. And you said you went to the apartment there. Do you recognize Miss Davis in the courtroom today?
Yes, sir.
What is she wearing?
White sweater, gray, white dress.
For the purposes of the record, witnesses identified the defendant, Kianna Davis.
Okay.
What was the purpose of going over to the apartment?
Well, anytime you have a child death, that's where the scene was last known for the child prior to being to the hospital. So we wanted to secure that scene and make contact there with the scene.
Okay. You secured the scene. Did you have the scene searched?
Did.
Okay. Did you ask for consent to search prior to searching?
I did.
Okay. And who did you get consent from?
From both Ms. Davis and Mr. Benton.
Okay. And did you actually go in the apartment?
I did.
What do you remember observing when you went in the apartment?
I remember some stains on the floor in the living room, either spill or throw up stains. I remember some medicine in the kitchen area on the counter. There was a nebulizer running in the back bedroom. In the child's room, there was a lot of throw-up stains on the bedding. And then in the bathroom, there was some water in the tub.
Okay. Was there a soiled diaper on the floor?
There was some.
Now, you went through it right, but somebody else actually documented the scene, correct?
That's correct.
And who was that person?
That was Juan Guerrero, one off speedy crime scene.
And he just testified, right?
Yes, sir.
And he took swabs or samples or cuttings from the apartment, didn't he?
Yes, sir. I believe so.
And did you collect those from him?
I did.
Okay.
From
Okay. But they ended up somehow in the sheriff's office possession?
right, that well,
Warren Robbins?
Right.
Okay. Now, let me ask you this. Did you send any of that to GBI?
I did. That's on part of Warren Robbins.
Okay. But, so, to your knowledge, had anything been sent?
From the apartment?
Yeah. Anything? Okay. So, at some point, did you take a statement from Miss Davis about what happened?
I did.
Okay. How many?
I spoke to her at the juvenile office on 2 separate occasions.
Okay. Do you remember the first occasion?
I do. It was the day after the incident day.
Okay. And where did that statement take place?
the juvenile division office in your office.
Okay. Do you remember about what time it took place?
I had it documented. Would have been, I believe, around 4 o'clock.
Okay. Now, when did you ask her? I mean, did you ask her to come to the station, come to the juvenile office and give you a statement?
Yes, sir. Prior date, I'd asked her to meet with me.
Okay. And was the initial plan for her to meet on the same day that you had asked her?
Yes, sir.
Okay. And what happened?
I received a call that she did not feel like coming in at that time.
Okay. So you guys scheduled it for the next day?
I did.
Okay. And as part of your investigation, did you also interview Kiyon Benton?
I did.
Okay. How many times did you interview him?
We had 2 separate contacts with him.
Okay. Were the interviews with Kiyon Benton on the same day as the interviews with this defendant?
Yes.
Okay. And do you know how Ms. Davis arrived at your office the day that she gave you the statement?
I don't.
Okay. At this point, was she a suspect in anything?
At this point, no, sir.
Okay. At this point, did you have very limited working knowledge of kind of the facts in the case?
Yes.
Had an autopsy been done at this point?
No, sir.
Okay. So was she under arrest at all? Did you offer her any promises or hope of benefit to come and speak to you?
No, sir.
Did you threaten her or coerce her to speak to you?
No, sir.
Did you read her Miranda rights? Can you explain what those are?
Miranda rights are anybody's rights that are required any time an arrest is being made and interrogated.
Typical what you see on the cop shows, right? Okay. You didn't read her those?
No,
What was that?
she was not under arrest.
Okay. Have you reviewed her first statement prior to coming to court today?
Yes, sir.
Okay. And is it a fair and accurate, I mean, it's a video recording, is it not?
Yes, sir.
Is that a fair and accurate representation of the interview that you did with her?
Yes, sir.
And has it been changed or altered in any way?
No.
As it, I'm going to offer it in evidence. It states 62.
All right.
And I will tell the court that both are on state 62. Both interviews with the purposes of this. We'll just start with the November 18th, I believe was the date, interview.
Of course, over objection, Your Honor.
Yep, that's committed.
Is there kind of parallel investigations that are going on at this point?
Yes, sir.
Okay. And where is that room that we're looking at?
This is at the juvenile division office in the office.
And before I continue, so you reviewed this, right?
Yes, sir.
So this interview is actually in 2 different videos, is it not?
Yes, sir.
Okay. So if one stops just for the purposes of everybody in the courtroom, we have another part too.
That's right.
So try to do this and keep dealing with it, okay? some water or something, yeah. So again, we're sorry we didn't do this morning, we just gotta get through it. Really, I'd like to just, I know that, you know, we talked a lot yesterday about him being sick and stomach and things like that. Could you tell me when that started?
Friday, I picked him up from daycare. And he was complaining slightly about his stomach, but he said it once and didn't say anything else. So the next morning, Saturday morning, he woke up and he had this bump in his eye, on the side of his eye, and two under it. And he was just rubbing it, so I was just like, he's so used to having allergic reactions that I just thought it was another allergic reaction. So when he rubbed it, the eye swelled up, and I gave him some Benadryl, and he was taking Benadryl all day Saturday, every 6 hours, on this Sunday, every 6 hours. And then on Sunday, I cooked dinner. And he was happy, nothing was wrong. He ate, and then after he ate that night, I put him in bed, and he usually watches cars. And he said, "Mommy, my stomach hurts. My stomach hurts." And I said, "Okay, baby, just lay down." And that was Sunday night. He started throwing up. And it's not uncommon for him to do it. He's been to the doctor multiple times. But throwing it, just randomly just throwing it all over the place. So I didn't think anything of it when he started throwing up. That it was just a virus. I did what they always tell you to do, give him some Pediatrics, make him lay down. I went to work on Monday.
How many times you think you threw up?
Once on his little beanbag, on the floor, on the couch. We walked around the house for a little bit. I gave him a bath because he was all nasty, and as soon as I gave him a bath, he threw up again. I just asked him to just go lay down, stop getting him juice. Gave him some Pediatrics, put him in the bed that night on Monday. He threw him in the bed, and that was a alarm because, like, whenever he threw up, he did it when he was awake, and so he never done it when he was sleeping. And I should
You couldn't have known.
Monday night, I was in the room, and I saw him threw on himself, and so I picked him up, and I took his shirt off, and I put him in the other bed. He had 2 beds in his room. And when I moved him, he kind of whined like I was hurting him. And I said, "Are you okay?" He said, "Okay." He said, "My stomach hurts, Mom. My stomach hurts." I said, "Okay, baby, just go back to sleep." I said, "You'll feel better in the morning."
Can you tell me about what happened?
I mean, so what are we talking about?
Okay, so Monday night.
Yeah. I got up for work that morning, and I went in his room to check out, and he was kind of laying off the bed. And so I pushed him back on the
I'm used to it.
Right.
So I went to work. I work in Jones County.
And you left about what?
I left at 7:15.
Okay.
I got to Jones County around 8:30, 8:15. I stopped and got gas. I went to the school. I was there for about 10 minutes when my boyfriend called me. He said, Karter he looks weak. He looks weak. And he was on FaceTime with me the whole time. He said he's breathing weird. I said, well, just go get his treatment and just give him treatment.
At what time did you say he called you?
This is about 9. Because I didn't even do my class. I have a class at 9:30. I was gone from Jones County before the class even started, so it was between 9 and 9:30.
Okay. So did you see him on the video?
I did. And
how was he when you saw him?
He was looking dead at me. That's why I asked to see his chest. I remember I said, let me see his chest to see if he was retracted in the middle because that's what I'm used to doing. And he pulled up his shirt. He wasn't retracted, so I said, okay, just give him treatment. And he said, he just looked weak. He said, I'm about to take him to the doctor. I said, okay. I said, just get there. And he left. He was on the phone with me the whole time. The doctor's office is literally right beside my house. He raced up there when they were on the phone. All I heard was the doctor just grabbing his knees. He got pulse. I was just on the phone just driving. I was trying to get here. I don't know what happened after that. All I know is that they told me to meet him in Madison. I got to Madison.
I understand. Going back just a little bit. You said that was around 9.
Yes.
You're not exactly sure the time?
I'm almost positive it has to be around 9. I got to Jones County at 8:30. I was on leave the room by myself, or just not on the phone with anybody. I was just by myself getting the class ready for about 15-20 minutes.
Okay. All right. So I want you to think about when he called you, video called you, and showed him to you. Can you describe him to me? Was he making noises?
He was making noises. He was talking.
He was talking?
He was talking. He has a mask on his face, so I really couldn't hear anything. The mask, the breathing machine is going, but he looked at me and nothing.
So he was already on the breathing machine?
He was on the breathing machine.
He called you?
Not when he called me. He wasn't on it when he called me, but he said he's not breathing on me. I said, just get him the breathing treatment. I told him where it was. It was in the laundry room at the top of the counter on the top. And I said, just give it and give him a treatment. I said, give him the ball one because he takes 2 different ones.
So he said he wasn't breathing?
He said he wasn't breathing regularly.
Okay.
That's why I asked to see his chest.
But you said he was talking?
He was talking. Before that, he said that I wasn't there. So, I mean, during the process, I heard him. He was talking. Something was wrong. If I would have thought something was wrong, there's just no way that I would have even say not do breathing treatment. That's always my first step, do a breathing treatment. If that, after that, I normally just check his breathing. If it's not right, I go straight to the doctor and I let them do the treatments and do the steroids and everything there. I'm never.
When's the last time he's had any kind of breathing attack?
He had a virus a couple months back. But
And what did he have been treated for that?
he had to get a steroid shot. They usually just give him a shot immediately because if they don't, his O2 levels go down and he wasn't even, I think he was at like a 92 that day. So they just gave it to him because they know how bad it can get. The entire doctor is very aware of Karter and all of his issues.
Yes. Could you have it for me? Could I ask you to give me the time that he called?
Now 15.
he kept him at all before?
He has
Nice,
a
man.
daughter, he has a 3-year-old daughter too, so.
Okay.
He comes down and makes the time to kiss me on this.
So he's been a kid. Does he know the, all the medical issues that he has?
I fully equipped him. That's why he knew what to do. Because I had already shown him he was before. When Karter had to take a treatment there, I showed him how to do it. He knew everyone around him knew. I made sure of that.
So you're on FaceTime, and I'm sorry to go through it, but you're on FaceTime with him, you see him checks his chest, so he's breathing at that time.
Nothing about it was, oh, when I asked if he was having an asthma attack like he was normally having.
Now, at what point was you on the phone with him the whole time from that point? Or?
The whole time.
Okay. So kind of walk me, if you would, through it best you can. From that point, okay, he called you, he already had the Bible with him. Had he thrown up anywhere after you left?
No.
No? Okay. So he called you, says that he's, what exactly does he say to you when he called you?
He said he doesn't know, he was weak.
Okay.
He said he's not breathing normally.
Okay.
So I said, let me see. That's why I said, let me see, because he said he's not breathing normally. And I know when my child is about to go on certain stress.
But you didn't think that's...
No.
Okay. So was it that was in the bedroom?
Yes, he was in the bedroom, he already had a mask on, he was doing treatment, and when he lifted up his shirt and showed me.
He already had the mask on?
Yes.
But he didn't have the mask on when he called you?
No. So he ran out the mask,
Okay.
put the mask on, I walked him through. I'm at this point, I'm driving.
Yes, ma'am.
I'm driving in the car, I'm still on the phone the whole time.
And what was he wearing?
A yellow shirt.
So he's in the bedroom on the floor, you said?
No, he's gonna sit on the
He's
bed.
on the bed? Okay. That's where he's getting the breathing treatment?
That's where he was getting treatment.
Okay.
He had the mask on. He showed him to me, I said, let me see him. I said, you okay, baby? I said, let me see his chest.
So he answered you when he asked you about it?
But he was very faint because he had his mask on. But he did like this.
Okay. How long do you think, I know it's a tough question, but how long do you think after he called you that he had the mask on in the bed and you saw him? So, 5 minutes, 10 minutes?
It wasn't 5 minutes. It wasn't that long.
Okay,
It
so
happened so fast.
you just within a few minutes of him calling?
Within a few minutes, because he called me because he looked weak and then he said he's not breathing on me, so I immediately said, go get the treatment. I didn't ask him questions or anything before he put the mask on.
Was he, did he have the shirt on, he had any pants on?
He had, when I left, he had my IBW and suits and pants, so.
When he was in the bed, was he wrapped up? Was he just on top of the covers?
He was wrapped up, he threw him on covers.
But that was him. And he threw up on the covers at what point?
That was when he was in the bed before I moved him.
Before you moved?
Yes, he didn't throw up again when I got up that morning for work.
Did he eat anything, y'all, other than I know y'all said he had Pediatrics?
He wouldn't eat, he wouldn't drink anything, but that's his normal whenever he's throwing up like that. He doesn't even like Pediatrics, so I wasn't even surprised that he wouldn't really drink that. He would drink the juice though. And I stopped giving it to him because that's what he was throwing up.
Do you know what he ate all weekend?
I cooked
big tits and rights on Sunday. Saturday, he just had beefaroni and normal. And then we went Saturday, we went to my granddaddy's house. And I cooked dinner on my granddaddy, and he was fine. He was walking around, running around with his toys, nothing out of the ordinary. Other than that morning when his eye was swollen, he was on getting drilled that whole day, but he was still.
And tell me about what, it was a Sunday morning that he had, or Saturday?
Saturday morning when the guy got swollen.
Okay, so.
And we usually wake up at 6 o'clock in the morning because we're still on my work schedule, so we want to still get up early. So as soon as we woke up, we found noticed the bump on his eye, and he was just rubbing it.
That was around 6 o'clock Saturday?
No, 6 o'clock Saturday.
So he didn't have it right?
No.
Okay. Now, can you describe the bumps to me?
It almost looked like not a sty, but it was right here in the corner of his eye. It was not a small circle, it was noticeable and it was puffy. And then he had two kind of under his eye, but they were a little bit smaller in size. But when he was rubbing his eye, it instantly swelled, like it was shut. So I gave him a Benadryl.
Did it look like bites or did it look like just
That's what I thought. I thought it was bites. It didn't look like a pimple because it didn't look like it had pus in it or anything.
So he rubbed it and he was swelled up.
I gave him a Benadryl.
The night before versus the night before when you had beef tips and rice, did you have anything
No, that was, he had beef tips and rice on Sunday.
on Sunday?
Sunday night. I cooked it.
Saturday was a beefaroni?
Yes. And we also ate at my grandfather's house, so we had, as I went over there and I cooked Saturday, we had, cube steak and mashed potatoes.
What did y'all have on Friday?
Friday, he probably said to me, probably I didn't cook.
Yeah.
It was Saturday. It was Friday.
Is that at your grandmother's house?
Yes.
Actually, so you said Saturday morning he had the bumps and he drove and his eye swelled, and you gave him Benadryl. Did it reduce the swelling?
Yes.
So
He took a nap. We went to my grandfather's house at 12. He took a little nap at the house because I gave him a Benadryl, so it kind of made him sleepy. We got up and we started running his house at 12:15, 12:30. And I went over there and he went back to sleep because that's his normal nap time. So I made him go to bed. And I cooked.
So what time did you get back home?
On Saturday, I'm not sure, it was after 5.
Okay. But you went to your granddad's at what time?
At 12:15, 12:30.
And that was on
Saturday.
So while you were at the so before you left for the grandfather's house, was his eye like back at home?
Yes. Now back to normal.
Well, and went down. Yes. Was it swollen at all while you were at the
It was
grandfather's
still
house?
swollen, just not one of those things that you have to know is now swollen for you to notice that it was swollen. A couple weeks before that, he had a bag of chips, and his eye got swollen again. So and they gave him something for that.
What kind of chips?
Sour cream and onion. And it was true because I bought the bag and he had never ate that kind of before. He eats all the other chips in the bag and he's never had a reaction to it. And when he ate that bag of chips for 5 minutes, his lip, his face, everything was just swollen. I'm trying to run the picture. Let's go get you to the doctor. Here.
Would you mind telling me?
What allergies do you know that he has?
They haven't tested him, and that has been my problem. This entire time I've asked for him to be tested for allergies, and they kept saying he's too young. I know when he was smaller, he couldn't drink regular milk. I couldn't just use the regular baby milk cans. He had to go to soy milk because the regular baby milk was making him vomit all the time. So, and they wouldn't even switch his milk. I had to get his milk switched just on my own. I just decided to change it to the soy because it just wasn't working. And they wouldn't switch it over. They wouldn't test them.
They ever had a reaction with anybody like secondhand smoke? Anybody smoking around this?
We don't smoke around him. He has.
Do you know if he's ever had a reaction to?
No. He's only had a reaction to the chips, his brain reaction to the milk, then the viruses. Anytime he gets sick with the virus, he always goes respiratory distress. Every time. It started when he was 1, the day after his birthday. We spent 3 minutes in the ICU. It's never really gotten better, and this time of the year I'm always so cautious.
Does there anything else he's had a allergic reaction to?
The one I don't even know if he has the eye reaction to because he had just woke up, so it was very random.
Any new medication that weekend? No. Other than that?
No.
What medication is he on? Other than the breathing?
He takes an allergy medicine that is prescribed from his doctor. It's kind of like Claritin. He takes that once a day. 5 milligrams. And then he takes the Gattie once in the morning, once during the season, once in the morning, once in the evening. And that'll be raw if he starts having breathing issues every 4 hours.
Okay. And the inhaler?
No, he has an inhaler, but he doesn't like it. He just uses the breathing treatment.
You know if the inhaler was tried at all?
Yeah, I tried that inhaler. He just.
I'm talking about that morning.
No. No, I immediately said it's just breathing treatment because I already knew he wasn't going to do the inhaler. He just doesn't like it.
Let me back up a little bit. Where you were on the phone. So you're on the phone. He's in the bedroom on the bed. You're leave at that point or some point, and then you said he was driving.
Oh, yes. So next he told me that he was not breathing okay, or not breathing normally. I ran out of choking.
Okay. Did you see at what point he moved him or from the bed to anywhere else?
Because he put the phone down to go get the treatment out of the laundry room. I told him, call me. I guess went on the bed. Couldn't see anything because at that point I was driving and trying to get to him. I just know that I told him, I said, let me see him.
Did you see him anymore after that on the phone? Do you know at what point he left the house?
Within the breathing treatment, he gave him the breathing treatment, and while he was giving him the breathing treatment, I don't even remember what he said. I just know that he said, no, something's not right, and he said, I'm taking it. He took the breathing treatment off, he ran out the door. I was on the phone the whole time.
so I trusted her with him. She knows how to give him the treatment if something's wrong. But you for where?
But it was kind of sudden because he hadn't had that issue for a while. And that morning when you left, he was not having any trouble at all breathing. But he was sick in his stomach.
He doesn't even like to lay on his stomach, but he was laying on his stomach.
Has he ever had a bad habit of getting anything or into anything in the house, like under the cabinets, or is there anything around that he could have
No,
drank? Or y'all used any poison or anything in the apartment lately or anything like that? No bug issues or anything?
I'll usually spray around the doors during the summertime and stuff. During the wintertime, I don't even try to do it because bugs aren't even out. So we have pest control come by. So, but I usually still, I'm very cautious. I go around the door edges and.
Has pest control been by lately?
I don't know their schedule. They come by some, they just do it on their own.
They come inside?
They usually do. And spray. And they'll leave their cards, let me know they've been here.
Can you remember the last time? But you say every month?
I don't think it's every month. They're on a schedule, and I know it's on Fridays for sure. It's the only days that they come by. Because if I ever see any bugs and I have to call and get them to come out and do something, they always do on a Friday where they can come.
Now, I know I probably already asked you, but the stomach issues like that, or at least to that severity, has that ever happened like that before?
No. Whenever he started throwing up, of course, he said hurt, but he really just started talking, so this is the first time that he could tell me mommy's stomach hurts, but he still just point. But I knew it was because he throwing up that he just, knew where it was coming from. But he always pointed to it. So I didn't think it wasn't alarming. That's what this is. What's your word? Nothing. He didn't show me no signs or anything.
I understand. So how, and just, I didn't want to ask you, I'm sorry. How often when's the last time Kiyon was kept?
It's been a while since he's been down because I'm in school. So I asked him for a couple of weeks just to not come so I can finish on a project. So the last time he's been here, he didn't even keep him cut through one weekend. But he normally keeps both of them because they're always there together.
Said it was Monday, he said he went to work. So who kept, and Monday was he going to daycare?
No, Monday he was with Kiyon.
So he was with Kiyon all day Monday?
Yes.
At your house? Did they go anywhere?
No. I don't allow that.
Do you know if Kiyon fed everything that day, or did you put out food for him to work?
I know I told him that if he, because I cooked Sunday, that I said if he's hungry, to give him food that I fixed last night. Give him a little bit because Karter doesn't really like meat, so I told him to mix it. And how did we get it right? But he did give him some that day.
Gave her some of the Kiyon before any kind of car acting with all one day one?
Kiyon himself, we're in the process of time training, and I put the underwear on Karter. He knows not to pee on himself. So I said, put the underwear on him because he's probably peeing on himself because of the pull-up. He put the pull-up, he took the pull-up off, put the underwear on, and he went to sleep, and he said he still peed on himself. I said, that's weird because Karter knows better. But I just said, he just kept peeing on himself.
That was one day. Right.
But I know he knows when he has all those underwear and he goes to the potty.
Did you leave? What time did you leave for work?
Same time, 7:15.
What time did you ride home?
I usually get off at 4:30 because on Mondays and Wednesdays and Fridays I work in Winter Office first, and then I head to Jones County. Then I leave Jones County around 4:15. So I can get back to Winter Office and drop off the car to the school and get back home. So I'm going about 5:30.
So Kion's pretty much hung out all day at the house with him?
Yeah. Then I FaceTime him in the day, all day, like I normally do. But I have to talk to her all day. He was fine, talking. Hi, mommy. Did you eat? No. What's wrong?
How much compliance did he have with his son?
To me, just when I woke him up. And then that was just the one time that day. He didn't say anything else that day about his stomach hurt. He said that one time.
So nothing Monday during the day except when you woke him up?
Just when I woke him up, when his stomach hurts.
That was out of the two?
No, that was Monday, because he was throwing up all day Monday. And then Tuesday morning, when I went in the room and I moved him, that's when he said it again. He said, "Mommy, stomach hurt," and he had said it twice.
Do you remember when was the first time you threw up Monday?
I wasn't there. And that was one of the things because when I was at the floor, Kianna thought that he had just spilled his juice. Karter likes to take his top off his juice and throw it everywhere. And I got in the house and I said, no, I said, that's normal because I could see the spit things in my floor. And I went and I tried to clean my carpet with the carpet cleaner. When I walked in the house, he was laying on the couch. And he was sleeping and he woke up when I walked in. And there was throws all over him. And that's when I went, gave him a bath because he was nasty. I gave him a bath. And it had just happened because the throat was fresh. I went and I gave him a bath, and then I put on his clothes, and I went in the kitchen, started dinner, and he was right here on my shoulder, and then all of a sudden he just started vomiting again, just more and more vomiting in the kitchen. So I cleaned him up, I took his shirt off. He didn't vomit anymore that night until in the middle of the night, I went and shake up and he had threw up in his bed. And that's when I said, that's odd, because he never throws up in his sleep. He'll throw up during the day, and I didn't give him any more juice or anything.
What was the juice?
It was Hawaiian punch. It was a mango something flavor. It was orange.
Was Kion's daughter there?
She normally she would be, but she's not with her mom this week because he has full custody of her. She was supposed to go with her mom, so he left her in Atlanta. go back and get her on Wednesday. So, she's grateful that she wasn't here because he would have never made it to the doctor.
That's why I'm sure that is right. So when you got home Monday, he had already thrown up, he was laying on the couch.
He had thrown up, looked like he had thrown up while he was laying on the couch. But like I said, he looked like he was waking up from a nap because when I walk in the door, my door chime goes off and he knows when I'm coming home. And as soon as he sat up, he did like this. He said, "Mommy," gave me a big hug. Nothing was wrong. Out of the ordinary, so I just went and gave him a bath. And he was, "Mommy, I'm nasty." And I said, "I know, baby." He took a bowl bath, played with his toys. I took him out. We went in the kitchen so I could start dinner because he liked to cook with me. And he started throwing up in the kitchen. And I was like, "Okay, baby, go lay down, go lay down." And then that night he ate dinner. And that's what I'm saying. He was fine. And after he threw up, he was in his room. I put him in his high chair and we watched Cars. And I fed him and we were singing and nothing was wrong.
No breathing issues at all.
He was smiling, laughing, singing, talking. So I thought he was feeling better. Until the morning, until the middle of the night, and he threw up and I was like, "Okay, maybe he's not feeling better." So I picked him up and put him on the bed. And he acted like what was hurting him. And that should have alarmed me, but I just thought maybe his stomach just really hurts. I was lay down and I kissed him and we normally, we had this thing where we kiss each other, but we suck on each other's face. Suck him on something. I did that and he laughed. I went back to sleep. Woke up out. You know, immediately got up and checked on him.
And what time was that before?
I normally get up. My alarm was off at 6. I had to get up at 2 or 3 in the morning because I know when I went and lay back down, I only got about 2 more hours of sleep before it was time for me to get up and get ready for work. He was kind of laying off the bed. I pushed him back over like I normally do. He just moaned. He said, "Mommy, something hurt." And I said, "Okay, baby, lay down. Do you want to go lay with Kiyon?" Because I asked him because I was leaving. I had to get ready. And so I was just going to put him in the room with Kiyon. And when I was getting dressed, Kiyon went and got him. And they were laying in bed together. He was laying on his stomach.
You know, wide awake, she sat down to sleep.
They're both wide awake. He had got a towel and laid on his stomach so that if he threw up again, he wouldn't get himself dirty or dead or whatever. And he was just laying there. And I walked over before I left. I gave him over a kiss. Karter, I put my hand on his back because he was laying on Kiyon's chest and I felt him. He was breathing fine. I gave him a kiss. He said, "Bye, Mommy." And I walked out.
You said you moved from his bed to the other bed this morning. Did he throw up in that other bed at all?
No, not the bigger bed. Not the bigger bed at all.
And do you know in his bed what part of his bed he had thrown up in or where the throw was?
The little bed that he was laying on, there was a big circle just throwing juice. His bed is not that big, so it kind of took up that entire middle part of the bed, which is why I moved him because it was too much to even try to clean that night or do anything with him, so I just put him in the other bed.
Did he sleep at all?
He slept good.
He slept good?
He didn't wake up in the middle of the night. He didn't whine. And he's a crybaby, so normally he still, when trying to get him used to sleeping in his own bed without me because he normally will sleep with me on the weekend. So whenever Kianna come down, I try to get him to sleep in his own room. And he always, if he wanted me, he'd stand at my door and knock on my door. But lately, he's just been getting better at it. So he slept the whole night. Didn't whine. Only whine when I touched him. It was just when I touched him, it was odd. It was just strange because when he was laying on Kianna, he wasn't complaining about anything. He didn't say that he hurt me. He was fine.
So that morning when he got up to start getting ready to work, did he complain at all about stomach cramp? Was he still?
Yes. One time, when I got stomach cramp, I said, okay, baby, just lay down. Do you want to go in with Kianna? Mm-hmm.
How long does he normally stay on this when he does the breathing treatments? How long does he normally stay on that?
One of them is, it takes about 15 minutes to finish. The other one's a little bit longer. But he finishes all of it. He does it even, so I would do the breathing treatment because he's used to that one. They give it to him at the doctor's office and at the hospitals whenever he goes, so he's just used to sitting on that one.
And you were on the phone with him the entire time he was on the breathing machine?
He wasn't on it long. He was not on it long. Because I guess Kiyon just moved like, no. No.
You said the other one takes long. What was
He's on two. He's on budesonide, and then he's on albuterol. The albuterol is the one that takes a little bit longer. It's the bigger one. I think the budesonide takes about 10 minutes, and maybe the albuterol takes 15 or whatever. But I do know that when he had the reactions to the viruses, the only thing that will really keep him from having to go to the doctor is if I catch it early and I start giving him the allergy medicine. Which is why they prescribed it to him with refills, because it just was the only thing that would help prevent his airways from reacting.
What medicine do you give him for that?
Let's see if he is that. It's the first one.
Do you remember the last time he went to his dad's house?
November the 2nd. And, that weekend. Can't remember if it was Saturday, Sunday, or Sunday, Monday.
Just contact Dad about it when you see him.
I did. I called him Monday night and I asked him if he could take off work because I didn't want him to be at the house without one of us because we know his condition and I would just feel better if Dad would have him because he works for the EMT and he's a firefighter, so I just would have felt better if he said that he couldn't take off because he had to work. So, and I couldn't take off from work.
Sure. Davis, I do appreciate you talking with us this morning. I'm certainly sorry about you having to go through this. I gave you my card yesterday. Okay. You contact me for anything at all. You just call, okay? Sure we'll talk to you again. Mr. Davis, please. Talk to you in a few minutes.
Fair and accurate representation of the interview to the best of your recollection?
Yes, sir.
And what was the date of this interview?
It would have been November 18th.
Now, I think you had testified that there was a second interview of the defendant, correct?
That's correct.
Do you remember what date that was?
It was December 7th.
December 7th, so a couple weeks later.
Yes.
And what was the purpose of the second interview?
It was a follow-up interview after being contacted by Danny Galpin with the medical office.
Okay. Did he have some information for you?
He did.
Okay. And what was the information?
So I was advised by former Danny Galpin that the child had multiple contusions, a lacerated liver,
And I don't need the specifics exactly at this point, but he told you that there were some injuries.
That's correct.
Internal injuries,
Internal injuries.
that there was not some kind of asthmatic attack.
Right.
Okay. And so as a result of that, then you decided to re-interview the defendant.
And based on that information, do a follow-up interview with them to narrow down the time.
And where did that interview take place?
At the juvenile office in Raleigh.
Did she just want her in, or did you call her? But
I called her and said, after it came in.
did she agree to meet with you?
That's correct.
Did you interview Mr. Benton the second time that same day as well?
I did.
Okay. And do you know how this defendant got to the sheriff's office?
I don't.
Did you make her any promises to come speak with you again?
I did not.
All right. Did you threaten her, coerce her?
I did not.
Did you offer her any promises or hope of benefit?
I did not.
At this point, is she a suspect in the investigation?
Yes.
All right. But when she got to the station, did you put her under arrest?
No.
Was she free to leave, or well, I guess let me start. Was she free to not come and talk to you?
Yes.
And when she got there, was she free to leave?
She was.
Did you read her the Miranda rights that we just went over?
No. She's not under arrest.
And have you had the opportunity to review the December 7th interview?
I have.
All right. And is it a fair and accurate representation of that interview that you did?
It is.
Is there ever changed or altered in
it may take me a couple minutes to set this one up.
Well, let's ask, when, I think it was Saturday, okay. Did he have any stomach pain Saturday? Okay, when did the stomach pain start?
The stomach pain started Sunday night after he ate. A little bit after he ate. And it started around his bedtime, which is around 9-ish.
Around 9?
Yeah. Yeah, 9 because I put him in the bed and that's when I noticed, like, he wasn't acting weird, but he kind of was, but he also had been taking vinegar for 2 days.
What did he do Sunday?
Sunday, we were in the house all day.
Who all?
Just me and him until Kiyon came back later on that day, which I think was around 5.
Okay, that's the day Kiyon showed up?
Yeah.
Okay, to say.
Around.
So Kiyon showed up Sunday, and around what time?
Around 5.
Okay, around 5 p.m. Is he normally come on weekends, or what's the?
It just depends on the moment schedule. He comes on weekends most of the time, but sometimes like on Thursday and stay until the Saturday or anything like that. It just depends on the week.
I just know it being the end of the day Sunday, it's usually.
Yes. So that Sunday in particular, he was coming because it was actually supposed to be my last week at work before I went on vacation. And he was coming down so that I wouldn't have to take Karter to daycare. So he was with me on Sunday, kept him on Monday and Tuesday.
Okay. And you kept him before for you? How many times you kept him before?
I think he's not. 8. I don't know.
Okay. So, all right, so Sunday night, around 9, after he ate, he complained of stomach pain?
He was laying in the bed again, in my bed, and he was laying on us, and then I wouldn't say he looked weak, he just looked like he normally does when his stomach doesn't feel good. He's ready to go to bed, irritated. So I asked him if he wanted to go to bed, put him in bed.
How was his Sunday, say, from up until that point? I mean, was he
fine? Absolutely fine.
No problem at all? Didn't feel?
No.
It was Sunday night after he ate? Okay. So walk me through Sunday night.
Okay. Sunday night, I cooked him. Went in his room, we watched a movie together. And then he came into our room, laid him down. It really happened so fast because I was in between cooking and trying to get ready for Monday. Between 5 and 9, I cooked. I fed him. He was watching Cars while he was eating. He came in the room with us, and then I put him in bed. Once I noticed, he was just acting like his stomach was hurting.
Okay. So after putting him to bed, go from there.
Put him in bed, nothing happened. Sunday night, he was fine. I woke up that morning, I went to work. I normally wake up and go in his room.
So he didn't complain during the night at all Sunday night?
Not Sunday, it was Monday after the throwing up all day, where he was just like, my stomach hurts.
So he's fine all night Sunday night?
All night Sunday.
All right, Sunday or Monday morning?
I go to work.
Who's the first one up?
Yeah. I was the first one. I get up around 6.
Mr. Benton still asleep? Did he sleep through the night with you?
He sleeps in his room.
I mean, Mr. Benton?
Yes.
Okay, so y'all together, you never in all night?
And I go in his room, I check on him. He's in his bed as normal. I put on the cartoons for him. I give him breakfast into bed, and he stays in bed until they wake up. And I normally call him a million times. And then on Mondays I work in Warner Robins, so I'm in and out of the house all the time when I'm on lunch breaks and stuff like that. I came back. I stayed around.
Let's set that particular Monday. Okay, so that particular Monday morning, he'd been complaining of stomach hurt after eating on Sunday, but he was fine all night Sunday night.
All
No complaining, you slept through the night, no issues at all. Monday morning, you wake up,
He's fine.
okay, did you talk to him Monday morning?
I told him he's running around acting normal. I come home and I went for at 11.
Did you feed him that morning, anything?
I gave him probably Cheerios. That's what I always give him for breakfast. He likes to eat Cheerios.
So was he up running around when you left for work?
He was in bed, not running around, but he was up watching cartoons and kissed me goodbye. I was going to go with me as normal. And
so his son wasn't hurting Monday morning?
not to my knowledge, but I do know when I came back home, that's when he was on the couch, he was taking a nap, and I noticed there was juice on the couch and on the floor, and so I was just like, what happened? I asked Kiyon what happened, and he said, I think he just spilled juice in where his car likes to take his top off his shoes and literally throw it all over the floor all the time. He's in a terrible two-stage head, so I didn't think anything of it. So I went back to work.
Okay, that was what, you came back home what time?
11.
At 11 o'clock a.m. And at that time, he's on the couch. Okay, and what's he saying at that time?
He's not saying anything, he was sleeping.
He was
Taking a nap when I walked in. And then when I came in, he looked up, got up, because he heard me come in the door. Acting normal, nothing was wrong. That's why I asked about the juice, because I just saw juice everywhere, and I saw him standing at the TV. Once I walked to my bathroom, I usually put myself down, I go to the bathroom, I come back, he's up, standing at the TV, waiting on me to come back out in the living room, and nothing is wrong.
So everything was fine at 11 o'clock, wasn't it?
Yeah.
Okay,
I was up, literally running around, acting fine, and I left.
he didn't complain of stomach pain or nothing at that point, but you just noticed juice on the couch.
It was juice on the couch, juice on the floor. That's why I was just like, okay, he probably took his cup out, but then also the cup was in.
So he wasn't throwing up at that time?
I don't know if it was dope or not, and that's where I'm.
It didn't look like throw up, it looked like juice?
It's orange juice, so it's on my carpet, so at that point, like, there's no food or anything in it, it's just juice.
Okay, which he has a habit of throwing juice out?
He likes those things, but no, there's juice out there.
Okay. All right, so you leave at what time?
My class starts at 12:30, so I'm pretty sure I'll look about 12:15, because it's only down the road.
So, you were at the house for about an hour?
I eat lunch, I go back to work,
So what was he doing when you left?
still running around, wanting to come back. Obviously, he wants to go with me when I go back out the door, but he's acting normal.
What's Mr. Benton doing at that time?
In the room, watching TV.
Bedroom?
Yeah, he's usually in our room watching TV. We don't like Karter's room is right next to our room, so Karter's usually from the living room to his room. Both TVs are on. He's dragging toys, so we leave all the doors open and he's fine. So I'm pretty sure he probably in our room when I left.
What did y'all do at lunch?
I ate.
Okay, and did he eat with you or you doing something else?
He's in the bed. I usually, when I come home, I sit with Karter. I eat. I go back and forth in here with him. It's kind of just about.
Alright, so when you left, he's still in the bedroom? He's been just laying in bed?
And Karter is, I can't really say because every day it's just like I'm trying to leave out the house and he's trying to grab Karter so he doesn't see me leaving out the house and then scream. So I really can't say that he was in the room, but I know Karter was somewhere in the vicinity because I wouldn't have been able to get out of the door without.
Alright, so you leave at around 12:15. He's fine. He's not throwing up. He's not complaining of stomach pain at 12 o'clock on Monday. Okay, so you leave, you go back to class. Mr. Benton's there with you. Okay, so tell me from the time you leave until you get back home, you contacted about anything?
No. So I go to work. He's fine. I don't sure, like, nothing was wrong. I didn't have any knowledge of him throwing up until I got home and was in the kitchen, and he's literally vomiting everywhere while I'm in the kitchen trying to make me like food.
What time is that?
I get home, I leave usually around 4:30. I get back here at 5:30, but I have to drop off the car, so I'm pretty sure I probably came in the house about 6 o'clock.
Have anybody else been there?
No,
Nobody? Well, how do you know?
I don't have anybody in my house.
Was Mr. Benton have friends or anybody that comes over?
No.
Okay, so you have any friends that tomorrow hang out with you, or you don't have any friends that hang out with or anything?
Absolutely not.
Okay, so just him? Okay. So you get home at 6 and he's already gone?
When I got home at 6, I went in the kitchen to make some food. He's on the couch again, and I don't know, he threw up or he had stuff on his shirt, and I know that I went and took him and put him in the bathtub because I was like, okay, you're nasty, so you're in the bathtub. I put him in the bathtub, got him out of the bathtub. Once I put his clothes on, we went into the kitchen so that I can finish making my dinner or putting it in the microwave. And that's when he throws up all in the kitchen. And I'm like, okay, I just gave you.
Had you thrown up before you got home?
That's what I don't know if the juice on the couch from earlier that day.
Mine's the juice for you, the juice.
No. The only other time that when I walked in the door, I just saw his shirt was a mess. So I was like, okay, maybe something's going on. He had to like throw up. So I told him, I was like, he had to have thrown up at some point while he was in the living room.
What did he say about it?
He said he didn't hear him comment, but that's not uncommon because when Karter throws up, it's not a dramatic thing. He does it. It's happened multiple times, but every time I get to the doctor, it's the stomach virus. It's probably the stomach virus.
Okay. So you walk in the door, his shirt was a mess. Here he had already vomited or something. You clean him up in the bathroom. Okay. How's he doing when you clean him up? How does he look? How does he feel?
He's fine. He put
complaining?
all his toys in the bathtub, played with his toys in the bathtub. Literally, that's why I was just, it was unclear what had happened, if he had thrown up or not at that point, because he wasn't acting like he was sick until I put his clothes on and he threw up again, and I was like, okay.
Is that as you got him out of the bathtub?
That's after I put his clothes on, we're in the kitchen, and literally as soon as I walked back into the kitchen, putting on his clothes and taking it back, he threw up.
What does it throw up look like?
It's orange, it's literally just juice everywhere. So that's when I was like, okay, that stuff on the couch early and on the floor must be thrown up. It can't just be juice that he threw up. Because when he vomited the juice back out with me.
Did you ask Mr. Benton when he started throwing up? Or when he
I asked him if he noticed him throwing up or anything. He was like, no, I just came into the living room and I noticed like the juice all over the floor. I saw the cup.
So does he normally spend the day in the living room, Mr. Benton's in the bedroom?
He's not, Karter's not in, he chooses to be in the living room watch TV, but all the doors are open, so he just runs up and down, so he's running into the door. Yeah.
Gotcha. All right, so that was, you were cooking dinner about, you got home at 6, so after you bathed him, you're in the kitchen with him, that's probably what time?
7:30.
Okay. So tell me about from 7:30 on.
From that point, after he threw up, I went and put him in the room.
In his bedroom. So did he eat anything?
Not, I know he had just ate when he woke up from his nap from earlier, so I didn't feed him again, but it's in the room.
Okay.
So I put him in bed, asked him if he's okay. He said his stomach hurts. So I said, okay, just lay down. Put him in bed. He went to sleep.
And then this is around 7:30, 8 o'clock? Or?
This is around 8 o'clock when he
into a room, and me and Kianna, obviously, we landed on and watched TV together. Karter goes to sleep. I got back up in the middle of the night to go check on him.
About what time?
2, 3. That's when I noticed there was throw up all over his bed, and he threw up in his sleep, and it was more juice. So I picked him up, put him in the other bed. When I picked him up, he just acted like when I touched him it hurt, but then again, he was sleeping. And he doesn't like to be bothered when he's sleeping, so I mean, there was just nothing.
So you complained when you moved him to the other bed that he...
Just kind of did a jerk and turned his head.
Did he make any other complaints?
No, he was asleep.
That was between 2 and 3 a.m.?
Yeah.
And he went right back to sleep?
He never woke up.
So he never really woke up, he was
still asleep, and I just moved him.
but you noticed that he...
Yeah, he kind of jerked.
All right, so you put him in the other bed, he's thrown up more than one time?
No, just the one time in his little bed, and then that's when I picked him up and put him in the big bed. And when I went into that morning, there was no throwing or anything.
Okay. But he hadn't ate anything, all he's had is juice. And the throw that you see is what in color?
Orange.
Orange in color, okay. So you don't have anything else in the stomach? You didn't have water, no anything else in the food?
I tried to give him water. He didn't want that because he wanted juice, but I wouldn't give him juice because that's what he's throwing up.
Okay. So from 2 to 3 a.m., you moved him, you threw up one time in the other bed. You tell he's in a little bit of pain, put him in another bed, he's asleep, you go back to bed.
I get up at 6. The next morning, same routine. I go in his room, I check on him, he's still asleep. I asked him if he's okay. He said, Mommy, my stomach hurts. I asked if he wanted to go lay down with Kiyon. He said yes. And I went and I finished getting dressed. At some point, I guess Kiyon and God went out of the room because when I got a shower, he was already in the room and I'm getting dressed. I don't get dressed in my room because I don't like for him to see me walking past the door all the time to try to come get me, so I usually get dressed in the bathroom and finish up, and then I went back in the room to give them a kiss goodbye, and he's laying on Kion's chest. He kissed me goodbye. I asked him if he was okay. I put my hand on his back. He said yes.
So that was around 26 and 7?
Mm-hmm.
Okay. So...
I leave the house. I have to leave the house at 7:15.
So did he go and get in his bed with Mr. Benton, or did you take him in there and Mr. Benton go get him?
I don't know if he got up and went in there with Kiyon, or if Kiyon got up and went and got him, but somehow he got in there and was laying with him. I was in the shower and getting ready for work.
Okay. Before you got in the shower, he was still in his room?
Yes.
Okay, was he awake? Okay.
Wide awake.
But he was, says,
Just laying, he was just laying there. Saying stomach hurts. Wasn't acting a certain way.
Did he get out of bed while you were there?
No.
So did you ever see him up?
No.
So the only time you saw him that morning, he was either in his bed or in your bed with Mr. Benton? Okay. When you left, he lay on Mr. Benton's chest?
Then about halfway sleep, going back to sleep.
Okay.
Kissed him on goodbye, left. Got to Milledgeville around 8:15. I texted him and asked how he's doing. They were still asleep, so he never responded, so I ended up calling. That's when he's like, I don't know, he looks a little bit weird. And I was just like, well, how does he look?
So you said that was about what time did you go?
See, I got to Jones County at 8:15. I probably stepped into the classroom at 8:30. So probably about 8:30 is when I called.
And he answered. And that's when he said, what, Amy?
That's when I was just like, how's he doing? He said, he looks a little weird, and I was like, how does he look? He showed me, and I was just like, nothing was wrong with him. I was like, what's going on? He's like, I don't know, he's kind of breathing a little bit weird. I asked him to see his chest so that I could see if his chest was caving and he's breathing, and he was belly breathing. He wasn't doing any of that, so I told him, I said, just give him treatment. I was like, if he's acting like he's starting to breathe bad, maybe that's why he was feeling bad last night. It's that time of year where all this happens for him anyway, so I said, just give him treatment.
But he had no breathing issues at all?
No. And usually when he does, it's progressive. It's not quick. It's the belly breathing, and then it's more belly breathing, and I can calm it down with the albuterol. But he wasn't doing that. So I looked at him. He was fine, and then he said, I don't know. He's like, I don't feel comfortable with him looking like this. He's never seen him in sick or anything. He's never been around when he was having those issues. So I don't know. So I told him, I said, just take him to the doctor who lives right there, which is the purpose of me living so close to the doctor, because he has so many breathing issues this quick. I said, take him to the doctor, and by the time, he was running out the door, I was facing him the whole time. By the time he was running out the door, all I hear him saying is Karter, 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 and I'm asking what's going on, and he's like, I don't know, he just looks weak, and I'm like, well, just get there. Next thing I know, he's walking into the doctor's office, and I hear Darren.
Had he been around anybody else other than you and Mr. Benton over the weekend?
Saturday, we went to my granddad's house.
Saturday, you went to your granddad's house. Tell me about that.
We went over there around 12:15. I put him to bed. He went to the nap while I cooked for my granddaddy. He woke up from his nap. We ate. We left about 3. Got back home.
Was he in your supervision the whole time?
Mm-hmm. Okay. Other than when he was in the room sleeping.
Who was all in the house?
Just me, my granddaddy, and him. And he runs around my granddaddy's house all the time. So he's back and forth. And I'm in the living room watching TV. And he's running around, chasing after my granddaddy or just doing whatever.
When you see him in that terrible 2-stage, yeah.
Oh, yes, it was.
So how do you deal with that? Or tell me about his terrible 2s, you know, how ours was. How was he?
Carter's not a bad child. He's just, he has a little attitude, I would say. So his terrible 2s is more so throwing stuff when he gets mad, or snatching something, or if I tell him to put something back instead of him putting it back, he'll throw it across the room. That's his terrible 2, so that's why.
How do you handle that?
I laugh, honestly. I don't discipline him like I should, but it's just funny.
Yeah.
I mean.
Did you ever have to discipline at all?
Yeah.
How was the discipline?
Popping him. I pop him all the time.
Where at?
And, but it does not faze him whatsoever. What fazes him is putting him in timeout. So he has a chair, I'll make him go sit in timeout, because that's the only thing that works, is taking away stuff and not really popping him. So.
How does Mr. Benton deal with that?
Oh, he doesn't touch mine. No.
So you end up playing with him?
No, I don't.
What, I mean, he's got to do something when he's kind of controlling what you tell him to do, or what you know that he does.
Carter doesn't get out. Carter's not out of control with other people except for me and his dad, honestly and truthfully. He kind of is shy, so he acts more standoffish. Even at daycare, he doesn't really talk to the other kids there. He's always by himself. He goes to at-home daycare, so he's always by himself watching TV or something. Every time I pick him up, he's off in the corner somewhere. He's anybody to have to discipline him. He only does it with me because he knows he can get away with it. Type of
Was he pretty comfortable around everything?
Yes, he called me Daddy.
All right, we're going to pretty much do the same thing with Mr. Benton. Just need to run through the timeline again, because obviously there's a lot of things when you want to,
He said that he woke up, I believe it was on Monday, because you didn't feed him that night because he was throwing up. You didn't feed him because you know he had eaten when he woke up for his nap. You know what he ate when he woke up for his nap?
Probably ravioli. That's what he always eats for lunch.
You recall next what he ate?
I don't know, but I did cook on Sunday, so they could have ate Sunday leftovers. Honestly, I don't know.
Okay, so we're gonna run through this with Mr. Benton real quick, and then you and I'll talk again. Okay?
Are we gonna talk today? Are we gonna talk today?
Yes, ma'am. If I need to provide you with an excuse for it, I will.
Bring the jury in.
Not from the same, nothing from what's wrong.
You can bring them in.
I'm good.
Ladies and gentlemen, consent. Okay. So Kiyon shows up. Okay. Anybody come over? Did you go anywhere? How was his behavior Sunday? He was up there?
Yeah.
Okay. There's no issue Sunday, was there? Nothing happened, no accidents happened, no said nothing you point out?
Just Saturday when his eye got swollen. You know, that was it.
Okay. And I was just out of the blue, nothing happened that you know of causes eye to swell?
No, because we had just been to the doctor's about 2 weeks before that because he had a bag of chips and his whole face blew up. So, she said, when I was there, she told me that he could possibly have another
morning, obviously Tuesday morning, clear on Monday night, clear on Monday, clear on Sunday. Saturday, the only place you went was Granddad's. He was in your supervision the whole time. Okay. Real quick, Friday, what was Friday?
Friday, I went to work, he was at daycare.
He was at daycare Friday. Okay. Where does he go?
He goes to daycare at a lady named Faye Clark.
Faye Clark. She got you for PE. Is that a personal person? It's not like daycare.
No, she has a at-home daycare.
At-home daycare. Okay. Where is that at?
I don't think we're switching.
Yeah. I'm sorry.
Right on the same road as Lawrence Middle School.
Do you have a phone number? So you do have any company?
No, maybe not that address. It's 478-213-9661.
What time is he there Friday?
He gets there at about 6:30 in the morning.
And what time was he picked up Friday?
I pick him up at 6.
6 p.m. Okay. And that's what happened right there, 6:36. When you picked him up, was there any issues? Any complaints or anything going on then? He was fine all Friday night, he was fine all day Saturday, and all day Sunday. Okay. All right. Is there anything that we haven't talked about that you think is important?
Just not really from what happened, but I've been asking just for so long for allergy tests for everything because he's had episodes of throwing up all the time from regular milk to whatever, and we even been referred to a pulmonologist. We never got tested. So I've always had concerns that something, it was deeper than just a breathing issue that they were trying to tell me, because every time we go in, most of the time he's not sick. They test him for everything and the breathing just happens. So.
Well, I don't believe this is due to any kind of allergy. Okay? I talked with the medical examiner. Okay? What they have, the initial right now, okay, is he had a lacerated liver. Okay, he had blood in his abdomen. He had multiple contusions of his body. He had lacerations to his pancreas where it attaches to his body. Okay, there was no signs of any breathing issue that would cause his death. Okay. So there was something that happened to him. There was some type of injury to his abdomen that caused this to his liver and the contusions to his bowel, some sort of impact.
There's nothing that literally, he's never had any issues with his stomach. Never been hit. Nothing.
They don't think this would be from a fall. Okay, so it's not from a fall, and it's just multiple impacts that cause the injuries, to the internal injuries. Okay. It's like, getting hit with the stomach real hard.
You know what? He doesn't even hang out with the kids in his daycare.
Well, here's the other part of it, is that I understand this is the Georgia Bureau of Investigation that does these autopsies. They're saying that whatever caused these injuries happened within 24 hours of Well, there's some things that could happen, there's some things that had to happen, something had to happen. You don't get this without something happening. So,
Labor. The child isn't even.
how does Mr. Benton, does he ever him?
No. God.
About yourself, how do you know?
No. I don't even hit my child. That's literally part of everyone's issue is that I'm not disciplined. His fault. I'm too nice. He's 2. So there's no reason to discipline a 2-year-old when he's still learning.
Yeah. I mean, I understand. But something happened. And the only right now is, you were around, Mr. Benton was around, and if you go back far enough, Grandpa was around. But you were supervising the whole time there, and that was well before 24 hours. Okay, pretty much he started getting sick, according to y'all, after lunch Monday. That's when his stomach started hurting, it started throwing up. Okay. Who you been with between that time?
He's living with no one except for me. Thank you.
Okay. So the concern here, the obvious concern, okay, is that something's happened that either yourself or Mr. Benton are concerned to tell us.
God, no.
Okay.
If there was something, I would tell you and he would tell you.
Okay. Well, I hope
nothing happened.
Okay. Well, there's something. We don't.
There's nothing in my house that he could even break into. I mean, to the extent that he would hit. He didn't even, the child learns about everything. So if he would have hit something, he would have came running to me, he would have cried. He didn't even cry. So.
Do you think there's any chance Mr. Benton struck him?
No. The child, no. There's just no way he doesn't get his daughter.
Okay. Well, I'll tell you the only way to have a lacerated liver, multiple contusions of the bowel, a laceration to the pancreas, is from some sort of impact to the abdominal area. Okay.
No, if you're right mind. And you're talking about within 24 hours. Absolutely not. I call.
How often do you call?
30 million times a day, especially if someone has my child. And you don't want to
call Mr. Benton?
Yes.
Every 30 minutes on
I
that?
call him. Every chance I get, I'm calling. And it has nothing to do with anybody. It has just to do with me always wanting to be around Karter and wanting to talk to Karter. So.
Should you think you talk to Mr. Benton every 30 minutes on Monday?
Not every 30 minutes on Monday, but I have classes, but.
So I mean, it's important at this point that we know how often you talk to Mr. Benton on Monday. How often do you think you talk to him on Monday?
A call.
Well, let's go from that morning, because we know you come home Monday at lunch around 11ish, is that right? That's 11, 7:15ish, back at 11ish. That's 4 hours.
I am on Robin, so I didn't leave at 7:15. I probably left at 7:45 because I was.
No, we had a video you leave. Okay. So, what, between that 7:15ish and 11 Do you have your call log from that day?
No. There's really no way that ever touched my child. And that is, no. No.
Wow. You changed your phone service?
No.
Okay, so is it your phone line and your phone service?
Yes.
Would you be willing to get your phone bill and show me? Because I'll need to know how often you called him that day.
We would have no issue now, whatever.
Was there any change when you called him that they just sounded different or?
No, like that's.
Because according to everything, it really seems like something happened. I think it happened after lunch Monday, whatever it was. I think it happened after lunch Monday, after you left. And then he went downhill from there.
What you're implying,
Ma'am?
I said what you're implying just is so bizarre, just because of who he is and who he has always been and who he
Always been?
Yes, like he would never, never. My child literally loves him. My child calls him dad. And he doesn't even do that. There's just no way. And if Karter didn't like somebody, or if Karter felt a certain way about somebody, he would definitely not be around them, and I wouldn't know, and I wouldn't even allow it. I don't let anybody watch him except for the babysitter and me and dad. That's just what it is. And that's just because of his breathing issues. I don't trust people with him in that situation. So if I would never leave my child with him if I ever thought that he was even capable. The man is not even capable of hurting a fly. So.
Well, I mean, honestly, he seems like a pretty decent guy just from my person with him, okay, and yourself. But these are the facts, okay? There is no me changing this.
The facts are, there was nothing wrong with my child. And if something was wrong with Karter, or if someone hit him, or whatever, he's a crybaby.
What was his vocabulary with you?
Who's Karter's?
Yes.
Mom, my stomach hurt.
So he could say that much for you?
He says he can say it really, but he's not even to the point where he's like saying full wrong sentences. He can mix words together, but if something is wrong with him, he's gonna whine, or he's gonna come to me and point and show me what happened, or show me who did it.
I'm gonna stop it right there, Judge. I give it time to stand. Alright, so we watched all those videos are fair and accurate, representations of the interviews that you did with her.
Yes, sir, it is.
Okay. And after each of these interviews, she was free to leave.
Yes, sir.
So, I want to point out, in your interview with her that we just saw, you're working, you say, 24 hours. Okay, so this was December 7th of 2020, right?
Yes, sir.
And when did you end up leaving the sheriff's office?
February of 21.
Okay. You aware that there was a big meeting between the chief medical examiner, the forensic pathologist that performed the autopsy, and other members of the sheriff's office, DA's office? Were you aware that any of that happened?
At a certain point, that was.
Okay. Was it after the fact that it happened? Yes. Okay. But you weren't involved in that meeting.
No.
So at that time, you didn't have any information, really, other than what you've been provided, at least initially.
That's correct.
And at the time that you left the sheriff's office, you didn't have the final autopsy report.
No, I did not.
And the questions there, so you're asking about Kiyon, right?
Yes, sir.
and that something happened, at least with the limited information that you had at that time, you're asking in the context of what was Kiyon doing. And potentially, this could have been, Monday afternoon after you left. What is the purpose of trying, bringing Kiyon up? What are you trying to accomplish again?
Well, one of the things I'm trying to accomplish in this interview is to build a suspect list, a complete suspect list, and make sure anybody that the child in contact with, or certainly 24 hours, but well beyond that, at least a day or two. That was one of my initial objectives.
Okay. And at that point in the interview, you gotten any information to indicate that any person had done anything?
Sergeant, let me ask you a few more questions, if I may.
Yes, sir.
From the period of time that this event occurred until you left the employ of the sheriff, did you talk to Ms. Davis any other time besides in the office there at the sheriff's department?
I made contact with her by phone.
By phone? Did she ever make contact with you by phone?
She returned the call.
And would this have been after the conversation that you had with her on December the 7th of 2020?
Yes, sir.
In talking with her, did you advise her that you were leaving the sheriff's department and that be turned over to someone else?
I don't recall doing so.
Okay. Just a second, John. Judges, hold it. Thank you. Thank you.
Anything else?
Just briefly, Your Honor. So I think Mr. Gruber asked that at some point in the first interview, you may have said something about don't blame yourself or something to that effect. Do you recall that?
I recall hearing myself say that she could have known in the first interview when it seemed to be a medical situation.
Okay. So you didn't have a whole lot of info at that time?
I'm still gathering information.
Okay. And there was some questions by defense counsel about whether or not any evidence went to GBI at all, correct?
Right.
And there was one very large piece of evidence, for lack of a better way to say it, that went to GBI, right?
Referring to the deceased.
Yes. His liver and his body.
Yes.
Nothing further.
Anything else, Mr. Brewer?
Nothing else. Thank you, Your Honor.
Lieutenant Darren Meadows. Can you raise your right hand for me? You swear affirm testimony you're about to give me the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Thank you, sir. Can you state your name for the record, please?
Lieutenant Darren Meadows,
And you're a lieutenant. Where are you a lieutenant?
Houston County Sheriff's Office.
How long have you been with the sheriff's office?
37 years.
It kind of dawned on me that we get ranks of people who come up here and don't really explain what they are. What's a lieutenant?
Well, in my office, I'm the assistant division commander. So that means I'm like the number, there's a captain, and then I'm the lieutenant, and then we both have similar duties in that we manage the investigators in our office. and some other related duties.
And is that for the juvenile division?
Yes, that's for the juvenile division of the sheriff's office.
And what is the role of the juvenile division of the sheriff's office?
We have two main roles. One is to investigate child abuse-related incidents involving children under the age of 18, and also juvenile crime-related issues for children who go out and commit crimes.
Were you working in that capacity in November of 2020?
Yes.
And have you been working in that capacity since November of 2020?
Yes, sir, I have.
I assume you were working in that capacity before those dates as well?
Yes.
Okay. And as lieutenant, did you become aware of an investigation into the death of Karter Ambrose around that time?
I did.
Okay. And who was the investigator who was on call?
Sergeant Keith Collins.
And he's the one who just testified, right?
Yes.
And so he would be the person leading up the investigation, right?
That is correct.
Okay. And would you have any involvement in his investigation?
Possibly, it depends on the case. I have 7 investigators that work for me, so they're all working cases at any given time. So they usually keep me updated on the status of what's going on in their investigations.
Okay. And at some point while the Karter Ambrose murder was under investigation,
If you don't, please, let me just, that's for this jury to decide. I mean, I just object to it being characterized as being a murder.
Well, that's the objection's overruled. That is the prosecution's characterization, and they can ask that. Obviously, that will be the question the jury has to decide. So go ahead.
Did Sergeant Collins leave at some point?
He is.
Okay. And then you became involved?
I did.
Okay. And how did that come about?
Well, it was just kind of the natural evolution of the case. By the time, I think he left 3 or 4 months after the death of the child, and he had done most of the investigation. Up to that point, he had completed everything that was available to be completed.
Okay.
We were waiting on the medical examiner's report, so I was just kind of monitoring the case at that point just to make sure there wasn't anything else that was needed or something else that the district attorney's office felt like we needed to do or review. So I was just trying to kind of monitor what was going on with it up until the time the case was complete.
Okay. And it took a while to get the autopsy report, the finalized version, correct?
It did.
And prior to receiving the finalized autopsy report, was there some kind of meeting with certain people involved with GBI in your office?
Yes. We had a Zoom meeting with myself, I believe it was Eric Edwards with the DA's office, and then the 2 of the medical examiners from the GBI.
There's Daniel Brown, the medical examiner.
Correct.
And then Jonathan Eisenstadt, who at the time was the chief medical examiner.
Yes, sir. Yes,
And he said members of the DA's office.
yeah, that was on September 27th of 21.
And from your recollection, what was the purpose of that meeting?
To understand exactly, to discuss what the final outcome was of the medical examiner's autopsy, and to kind of nail down like time frames, what exactly happened, what was the report going to be, when were we going to get the report. We had communicated with them over and over again about needing the report, and it was trying to get all the complete information for the case.
Right, and at that meeting, I think a time frame for when the injury could have happened was discussed as well, right?
Yes.
And then after that meeting, at what point was the autopsy report received?
I received it on November 12th, 21.
And after that, up to this point, had you interviewed anybody involved in the case?
No, sir.
You had this meeting with people who were involved in the case, but the witnesses and stuff, I think you said Sergeant Collins had kind of completed all that.
It had all been completed months earlier. We were just waiting on the additional information to complete the case file and investigation.
Did you reach out to the defendant after that meeting?
Yes, after I received the final autopsy report from the GBI, I reached Kianna Davis, the defendant, and asked if she would like to come in to discuss it. We have received the final report, and she'd like to come in to discuss the report.
Okay, you said you called her?
I did.
Okay, do you remember, did she agree to come down and talk with you?
She did.
Okay, do you remember when that conversation took place?
She came to my office on December 9th of 2021.
And when you said she came, do you know how she got there?
I do not know. She just showed up at my office.
Okay. Was she a suspect?
I think so, yes, sir.
Okay. She was a suspect?
Yeah, she was the mother of the child with the child.
Okay. And in order to get her to come down or to drive to juvenile or however she got there and speak with you, did you offer her any like hope, benefit, or promises?
Yes.
Did you threaten or coerce her in any way?
Yes.
Was she in custody at the time?
She was not.
Did you arrest her at all that day?
I did not.
Did you read her Miranda?
I did not.
Why not?
Because she was not in custody. It was not an in custody statement. She was free to go.
I'm sorry. And after you guys spoke, did she leave?
She did.
Okay. And this interview, was it recorded?
It was.
Have you reviewed it?
I have.
Is it a fair and accurate representation of the interview?
It is.
Has it been changed or altered in any way?
It has not been on the way.
This is State's Exhibit 63, which I'll offer in evidence now.
It's admitted.
Over objection, Your Honor.
Noted.
Before I continue on, where is this?
This is at my office, the juvenile division of the sheriff's office.
Is this your interview room?
It is.
And is that Ms. Davis?
Yes.
How's the drive down?
Long.
Yeah.
Yes, traffic. It's so much traffic, and then they're working on the road still, of course, so.
Sure.
Lanes are closed, everything.
Always. Well, I had to go like North Georgia, I said last week, and the October route was through Atlanta, 75 to 675 to 85.
Yeah.
No. You're just rolling the dice
Yes.
every time you get up there. So, let me just get a little current information. Can you get your home address?
302 RCARD SLEY Place. That's Northwest Georgia, 393. And it's apartment 302.
What was it?
393.
All right, and your phone number's the same?
Yes.
What's that?
478-302-3335.
3335? And, no cross, is that the multi-line?
It is.
Okay. And where are you working at this is?
Peachtree Ridge High School in Gwinnett County.
Peachtree?
Ridge.
What do you do there?
A teacher of computer science.
Oh. And, let's see. Now, Mr. Benton, are y'all still together? No? Do you know where he's currently residing?
I don't, but I'm pretty sure he's in the same spot.
Somewhere in Atlanta area? Okay. That's what I thought. I'm just trying to make sure I have updated information. So, I don't know if you knew or not, but Sergeant Collins, who originally investigated the death of your child, was he's no longer with the department. So the case has been just kind of, he had done almost the entire investigation, but at some point we've just been waiting on medical examiner report, which for some reason took an extraordinarily long amount of time. I don't know, I've never had one take this long, so
contacted you to let you know kind of that it was finished. We had some discussion about the case and where we go from here, and I just kind of wanted to bring in and go through that. And I think y'all already knew some of this because Sergeant Collins had told you, but until we actually get an official report from the medical examiner for the GBI, then that's what we have to go by. So I'll just go through and read some of this to you. Now this part is from, let's see, Amy Goodman, which is GBI. So they've sent this report to the coroner, which is Danny Galpin, in reference to Karter. This was a full autopsy done. The immediate cause of death was blunt impact injuries of the abdomen with a laceration of the liver. They deemed the manner of death to be a homicide. And injuries would have occurred by the child receiving blunt impact trauma to the abdomen. Okay, and that was signed off in September of this year. They've got a lot of just report stuff that's just, some that's just medical terminology and stuff, weights and different things. And, let's see if I can get down here. Under the opinion, now this is the opinion of the medical examiner who performed the autopsy. I'll read it. It says, this 2-year, 10-month-old black male child, Karter Ambrose, died of blunt impact injuries to his abdomen. Karter was the last known alive on Tuesday, November 17, 2020, at approximately 30 hours. The mother reports that the child had thrown up in his bed around 0200 and told his mother that his stomach had hurt. The mother left the child in the care of her boyfriend at approximately 7:15. The boyfriend called the mother at approximately 8:30 and said that Karter was having trouble breathing and going in and out of consciousness. He had given the child a breathing treatment, but it didn't work. The mother said to take Karter to his pediatrician, which was located nearby. On arrival, he was unresponsive, and the doctor administered CPR. The nurses called for EMS. This then was transported to the hospital, where resuscitative measures continued but unsuccessful. Further information is contained in their report. The autopsy revealed blunt impact injuries of the head and torso. Most significant injuries were multiple contusions of the abdomen and a liver laceration, which resulted in bleeding into the soft tissue and abdominal cavity. Based on the information known, the manner of death is classified as a homicide. If any, so the cause of death. So that's kind of
which I know, we've been in contact with the coroner.
Okay.
My question would be, the blunt force, was that from CPR?
No. Because that's why he went into distress. His abdomen was full of blood. And even if, if you had a layperson that was pushing on someone's chest, these were doctors and nurses that, I think the doctor himself was performing the CPR. Mm-hmm. So you have a medical professional who's doing that. But no.
There's just no way. There's literally just no way. Because my son has been multiple places before this passing, all of which he showed no sign of hurting, no sign of anything until a literal, my stomach hurts. And that's the last thing, and it wasn't even my stomach hurts and he's in pain. It was, Mommy, my stomach hurts.
But then he started having the stomach pain and the vomiting started happening Sunday night too.
Correct. No, Sunday night is when I asked him. He looked like he wasn't feeling well.
Okay.
Which
night he did complain of stomach hurting. And then continued through Monday, off and on, was vomiting some, correct?
Monday was when I was at work in Warner Robins.
Right.
I literally went home and he was asleep on the couch. That's when I saw throw up on the floor. At the time I didn't know it was throw up because it just looked like his juice that he had been drinking.
But now, if he, was that carpet or like?
Carpet. It's orange juice.
Did Kiyon? Did he have not seen that?
Yes, he was sleeping on the couch. I don't know if he saw it on the floor or whatever, but me.
I just know if my wife came home when my kids were throwing on the floor and they cleaned it up, I'd be like, I'd be like in trouble, kind of thing.
I came in, he's on the couch sleeping. I go over to check on him, kiss him, just to see if he's fine. I look over, I see blood on the floor. Well, from what I suspected, juice.
Yeah.
Because he had his cup, his sippy cup. Karter is usually known for throwing the juice around or the cup around. So my immediate thought is he threw his cup.
Juice just went everywhere. But then you later figured out it was,
Later, as in when I went back to work and I came back home, there was also juice on the couch, which then I said, I then cooked dinner. I also bathed him. In the bath was when I was washing his butt, and he was complaining about his bottom area hurting.
Like his butt or like his stomach?
Like his...
Or lower abdomen?
Yes.
Okay.
Well, really his balls.
Okay.
And he had done that a week before. But I didn't make anything about it because he's dramatic. Karter, he's a mommy's boy. So I said, okay, I'm going to see if he complains about this again. Nothing else. The next thing I know was the day that he passed away. That night before, I had put him in his bed because of the stomach hurting. He had ate, we watched a movie, he danced, literally nothing until I went back in the room and I checked on him that night. And I saw that he had threw up in the bed.
Okay.
That was the first alarming thing to me.
Right.
Nothing else throughout the entire day, even when I got back home. Nothing else would even tell you that this child was in pain. He was not acting any kind of way, which is why it was such a... If his stomach hadn't hurt to the point where he would make any kind of movement to let me know that he was in that much pain, I lived next door to the doctor.
Well, and realistically, I don't know, I'm not an expert on those kind of injuries. I've been working in this office for almost 30 years, so I've seen a lot of stuff and, had a lot of investigations. I don't know how much pain he would have been in. If there was some impact to his abdomen that caused a liver to start bleeding, it could have just been slowly bleeding. I don't know that, maybe that's something that just over time got worse, and eventually that's what happened. He got to the point where, he was unconscious.
And that's what is so confusing about this entire thing.
But now, when we talk to the medical examiners, and they're giving us a window of, 24, 48 hours when the injury could have occurred. So we're looking at something in that time frame, and realistically, I know from looking back at Sergeant Collins' report that, I know you picked him up for daycare on Friday, so that's, we're talking almost 4 days earlier. You went to the grandfather's on Saturday for a few hours, right?
Basically the whole day, because I went over there and I cooked for my grandfather, and Karter was in the bed sleeping.
But he was with you that whole time, correct?
Correct. He was right there with me.
Right there with you. So then we have Sunday, which is all day with you, and then later that afternoon, Kiyon? Is that how you said it?
Kiyon came down.
Later this afternoon around 5, and then he was there that night, and was there all day Monday. Now, it's my understanding that you contacted the child's father. go to
Watch.
watch him because he was sick.
Because he was not feeling well.
Right.
Correct.
He was sick,
And I had to go to
and
work.
apparently he was unable to. So I guess that's why Kianna just stayed over.
Yes, it is.
Okay. So.
And the reason being is because my child's father is a firefighter. So I knew, number one, we're very familiar with Karter around this time, that time of year, having issues. And number two, if he could be with anybody, I wouldn't leave him with someone that's not me or him, or someone close to him.
Yeah, I understand.
So that's why none of this makes sense. I know for a fact it didn't happen within the last Friday, Saturday, Sunday, or Monday before, or the Monday before he passed.
Well, you don't know if you're not there. So when you're working, you're not there. You can't say something didn't happen. And I know from reading the other stuff that you think Kianna has nothing to do with this. And again, I don't know. I'm just doing the follow-up on this, okay? And I'm not here to rehash the whole case. Y'all already discussed it in other sessions. But you know, me as someone who's seen a lot of these cases, not necessarily this particular kind, but in general, I guess my question, I guess, from your end would have been, as the mom, why did you wait so long if he was sick and you were used to taking him to the doctor, if he'd been complaining like for a day and a half about, on and off about his stomach and throwing up at least 4 times.
Here's why. Because Karter is used to, for whatever reason, when he was first born, he would throw up for milk.
Okay.
He's had multiple situations where he'll throw up.
But that's not unusual for children who are on formula to throw up.
Correct.
I mean, that's.
However, Karter also, a couple weeks prior to this, and multiple times, would have random reactions to foods, anything, and every time I take him to the doctor, they just throw him on a steroid. Throw him on a steroid, send us on our way.
Okay.
So the stomach ache, if it would have gotten over to a 24-hour period to where he was actually complaining and still complaining about it, yes, I would have taken him to the doctor. But that's the reason why this doesn't make sense to me, that it couldn't have happened in that time frame. But
then my question to you is that if on Sunday night was his first time he was really complaining, saying he was hurting, and now Tuesday morning, you woke up in the middle of the night, early morning, and he's thrown up again, and you put him in the bed.
Well, that's not reason for calling his dad.
But that was, you called him Monday, right?
Correct.
Okay, but
Sunday night and Monday morning.
But you said something to the effect of it had been more than 24 hours, but it had been more than 24 hours.
Sunday was the first time that he had ever said anything, or not even really say anything, but started to act as if he was not himself.
Okay. And I get that, but we're at Tuesday morning, you leave for work.
Correct.
So we're
Tuesday morning.
We're over a day. You go from Sunday night, Monday night, now we're Tuesday morning, and he's still sick, and y'all give me breathing treatments, and
we gave him one
treatment, which I think that was when he was toward the end, and then of course he had to rush him to the pediatrician's office at that point. But,
correct.
I'm just asking, was there? Did you just not think he was that sick, or
A stomach ache is not alarming to me, which is why my initial thought was check his breathing, because that's his normal issues.
But he never had problems with the breathing.
We've been at NICU 3 times.
No, I'm talking about during this time.
During this time, I did not know. That's just my first immediate, let me check his breathing, because of the time of year, number one, and because of his history. He's continuously in the doctor's office for breathing issues. So that was my first thought. With a stomach ache, he's had multiple stomach aches before. So that's why I'm saying, if it was something to where he was crouching over or can't walk or not running around laughing and smiling, of course I would have taken him to the doctor. I go there more times than not. I'm sure they'll tell you. However, it wasn't that. It was literally, Mommy, my stomach hurts, and laying on me. Do you want to go to bed? Okay, let's go lay
ER that, you know, and he was bleeding internally, that maybe something could have been found on that?
I don't know. And here's why. Because any other time I take him to the doctor for the breathing, we'd be brushed off. Send him a steroid, send him home. We've been to a pulmonologist. Oh, he doesn't.
But this isn't breathing, this is abdominal pain and throwing up.
This is a stomach ache to me, not abdominal pain. This is.
Okay, well, it's hard to qualify, but I understand what you're saying.
If he came to me and said, and was crying, like, or acting as if he's just literally, from what you're telling me, he should be in the most pain.
Again, I don't know how that reflects. But if, and I'm just giving you a scenario, I have no idea. If you leave for work at Monday at 7 o'clock, and at 9 o'clock something happens, and 3 hours later you come home for lunch,
and he's asleep,
and
well, that's,
maybe he's not in pain, maybe he was, you know, there was some injury there and he bled and then continued to bleed until, you know, Tuesday. But you know, there's no way an internal organ can get lacerated.
there's no way.
Right, it just can't happen.
So,
Does this change any concerns you have
I
about Kiyon?
I know Kiyon as a person. I know who he is, and I know how he is with kids, and especially with my child. He's in the process of trying to get past his own.
I understand that, but you know, sometimes good people make mistakes and do bad things.
Sure.
I mean, it does happen. Sure. And I will tell you, it's from my experience, that when you have a child that's going through potty training issues, they're kind of in that transition where sometimes they have an accident or they do that. I think there was some discussion about he peed on himself some, and a few times during this issue, in this investigation, that sometimes those people get frustrated and that can make them act out angrily toward a child during potty training. I'm not saying you did.
No,
I'm just saying that somebody else could.
I understand what you're saying, and if that's the case, then do whatever you need to do. I don't care. Because at the end of the day, I know for a fact that in my care, nothing happened to my child. I know for a fact that when I got home, my child was not acting as if anything had happened to him or if anybody beat him up. And in my mind, because of the relationship that I have with my child and because of previous incidents where even if a child hit him or if someone told him something that he didn't want to do, he'd run to me and immediately tell me.
Let me ask you this. If Karter had been with his dad that weekend, only his dad, no one else, no girlfriend, no grandparents' house, he stayed with his dad all weekend and then had passed just like he did on Tuesday morning. And they come back with this report that says blunt force trauma, lacerated liver, bled internally. What would you think then? Would you say just because he's a good person he couldn't have done it?
I have the same questions because of who he is as a person.
Right.
I don't know. I can't speak on who people are if I have never seen them in that way.
Sure.
So no, I would not have felt any differently about this situation.
So you think, so your feelings are based on the fact that
of how I know the person.
The person, okay. And I assume how you've seen them interact with
How
your child.
I've seen them interact with my child. Neither one of them.
But you do understand that in and of itself is not enough to clear a person.
Oh, of course.
Because if we say Kiyon didn't have any part in this, then the only person is you. And you're saying adamantly you didn't do it.
Let's be clear. There is no way in the world that I would hurt my child, and I work with kids all day. That's me. So
But you're saying,
I don't care.
But you're saying if Kiyon did this, he should be punished.
Yeah. That's not even a question.
So
I don't care.
But I guess I'm a little confused from the standpoint of if you were the only person there,
If I was the only person,
then we would only be talking one other person that was there. How can
It's
you?
hard for me to come to a conclusion about someone that I've never seen. That to me that's like false accusations. I don't want to be a part of that. If he did, hold him accountable. Do whatever you gotta do. I don't care. It's my child. At this point, it's me and my child against everybody else. I don't care. But what I'm saying is that what I know is what I said. And if he knows anything, and if he feels if he didn't reveal everything, I don't know. But at the end of the day, I don't care. Because I just want to know what happened to my son, who did it, and I want that person held responsible. But I know for a doggone fact it didn't happen in my care.
Okay.
So,
Well,
I
I guess what we're looking at as far as the case goes, and ultimately, the district attorney's office makes the decision on who's charged and how they're charged. But you know, if he's charged with a crime of murder or involuntary manslaughter or something like that, you know, that'll be something that the DA decides. But you have to understand also, as a parent and as a caretaker, you bear some responsibility in the fact that you are the parent who's supposed to care for him, and he was sick, and he didn't get medical treatment or get checked, and therefore wound up dying as well. So there are
sick, it annoys me because it's almost as if I wouldn't have taken those steps.
I understand, and you know what? Hindsight's 20/20. We can all look back and say we should have done something different, or maybe you say you should.
I shouldn't have, because I would have done the exact same thing, because it literally, this child sang, danced, smiled, laughed, everything with me that night before. So for me, my immediate thought, because I know my child, I will be looking for all the signs.
Okay, but what I'm telling you is, from a legal standpoint, if the child had some presentment of some type of issue or problem that could have resulted in him getting medical treatment and that was not done or being checked, then you could also have an issue of legal responsibility as well.
So would you take your child to the hospital when they asked you for a stomach ache? Or said they had stomach ache? Would that be your first?
Well, it wasn't the first time. I'm not saying it's Sunday night just because he says he's has some issues or throws up that you immediately have to go. But you got Sunday, you got Monday, you got Monday night, you got Tuesday morning. So
Tuesday morning, nothing was going on with him. Tuesday morning.
When you said you woke up and he had vomited all over himself.
That was in the middle of the night.
But when I say Tuesday morning, I was told it was about 2 o'clock in the morning. So
when I went to check on him, he had thrown up in the bed.
I understand.
Before I picked him up.
And I don't want to get argumentative with you, but I'm just trying to explain to you where we're at. Where we're at legally, okay? That you could bear some legal responsibility from the fact that he wasn't given care and he obviously passed from injuries that appeared to be during that time. He had sustained injuries. Okay? So I don't know that will happen, but that's certainly something.
He certainly won't. That's why I have an attorney.
Well,
at
the
this
attorney
point,
can't keep you from
getting
charged with a crime.
But what I'm telling you is now you're irritating me.
I'm sorry, I don't mean to irritate you.
Because at this point, it's almost as if, and it has been, almost as if I'm a bad mother. And no one has asked about my reputation as a mother, as a teacher, as someone who's literally mentored kids since I was in 12th grade with this police department. So I don't care.
When I read through the report, they did ask about you.
Okay. And I don't care. At the end of the day, everyone around me knows I would do anything for my child. I will protect my child from my own family. If anyone did anything that I did not like, for instance, when my mother herself did not take his breathing issues as if it was a serious thing, she no longer got to watch him. So at this point, that's what I'm trying to tell you. If any indication, he would have been removed.
Well, I believe you on that. I'm not saying you.
As a single mom, what was I supposed to do when I asked his father to get him and take care of him? which is why I didn't take off and which is why I offered or asked his father to get him for that day because I was going to be off the rest of the weekend play. So, with that being said, I did everything I knew how to do and what to do. As far as this investigation goes, I don't care what you do with Kianna. But that's who seems like we need to be talking to. Because at the end of the day, I walked in my house, I saw throw on my, or juice on my floor, whatever it was, and I immediately thought, this is weird. But it didn't strike me to be like, oh my God, let me take my son to the hospital. I've been through many situations where he almost did not make it because of his breathing. I know that it's serious with my child, and I know how my child acts when it's serious.
But apparently this time you were wrong. Right?
Weird.
Your son passed away.
My son passed away, yes.
Apparently the wrong decision was made at some point.
Oh, Jesus.
Well, do you have any questions?
No.
Okay. Well,
I just need a copy of everything that she does, the medical reports I've been sending.
I can't give you anything because it's still an open, ongoing investigation. At some point when that's closed, then you can get a copy of whatever you need.
So can my attorney request it?
You can request it, but you can't have it.
Okay.
Until the investigation is closed. All right?
That video, that's very accurate rendering of the actual interview that you did with her.
It is.
Is that the extent of your involvement in this case, other than the fact that you're here today?
I completed a report based on that interview, and then I forwarded that along with video to the district attorney's office to complete the case file.
Did you handle any evidence in this case?
Other than the video and the report I heard. No, sir.
That you weren't out at the scene?
No, sir, I wasn't involved in the scene or the actual investigation.
Do you know where she was living at the time?
Apartment complex in Warren.
In Warren Robins? You know who was in Houston County?
It is.
All right. Do you see Kianna Davis on board today?
Right there.
What's she wearing?
White shirt.
He's identified that for the purposes of the record. This is State's Exhibit 11. What is that?
That is a picture of my child's liver.
Your child's liver. That's quite a laceration, isn't it?
It is.
It is. And you heard the testimony that it would be 24 to 72 hours out. So either Monday morning to Saturday morning, correct?
Correct.
And he was just telling you his stomach hurt?
He was pointing at one point saying my stomach hurts and that's all.
And you heard Dr. Eisenstadt say this is a serious injury, right?
I did.
And that quite a bit of force would be needed in order to cause that injury.
That is correct.
But so Monday he was just okay?
Monday he was throwing up. I was at work all day Monday, so I did not see him all day. I only saw him during the period of time when I returned home for lunch and when I returned home after 5 p.m.
Okay. And he was hurting overnight though, wasn't he?
No.
He wasn't?
Overnight, what day?
Sunday.
Sunday, no, he was not.
Now you said just a minute ago that you stand by the statements that you gave Collins, correct?
Correct.
And in your first statement, you told him that the symptoms started Sunday night.
I told him that on Sunday. He told me that, Mommy, my stomach hurts, and that was all on
No.
Sunday night.
That was not your first statement to him.
It was my first statement to him.
Well, we all watched it.
We did.
And they can watch it again.
They can.
Yes, they can. So Monday he's throwing up. Is that right?
Monday, when I got home from lunch, I suspected that what was on the floor was a puddle of juice. I did not suspect at that time that it was thrown up until after he threw up with me after I returned home around 5 p.m.
But you didn't take his calls for help seriously, did you?
I did take it as seriously as I could from what I was presented and what he was showing.
I think you had said that he'd never thrown up like that before.
He has thrown up like
He
that.
has thrown up like that before. But he's a crybaby, isn't he?
He
He's a crybaby in the sense of he would tell me or he would cry if something was seriously injured or seriously wrong.
He would tell you if something seriously wrong with him?
He would be crying and he would notify me that something was wrong. He could say full sentences yet, so it would be fragments of this, mommy this, mommy that.
Well, is a 2-inch laceration to a 2-year-old's liver serious?
Yes.
It's very serious. That's why he died, right?
Correct.
But he didn't say, point, he wasn't crying, it wasn't really alarming to you, was it?
He was not crying, he was not crouching over, he was not holding his stomach, he was not doing anything except for saying, mommy, stomach hurt, and mommy, juice.
Mm-hmm. And you expect the jury to believe that a 2-year-old crybaby, who you said cried over everything, who had a 2-inch laceration of his liver, wasn't really crying?
I expect him to believe what I saw and what I presented.
When did you break up with Kiyon?
Me and Kiyon ended our relationship around February of 2021.
Why?
Because
why?
Because he did. We just broke up. That was our first time dating. And 2, all of this was going on, so it was really a lot for me to even try to be in a relationship with anyone or focus on anything other than my child in this case.
Mm-hmm. And you knew him, right?
Correct.
Mm-hmm. And you repeatedly denied that he would have done anything to your child.
That is correct.
Mm-hmm. But you deny that you did anything to your child.
Absolutely.
And the time frame, as we've all heard, is that you and Kiyon were the only people who had access to him.
During Sunday to Monday.
Right.
Correct.
Right. Other than the Saturday that you were at your father's house. Right.
Yes.
Okay, but he was fine that day.
He was running around.
And then Sunday is when he's not feeling well?
Sunday night is when he first mentioned mommy, my son is hurt.
Okay. And then it's Monday?
Monday, after I got home from work, yes.
Okay. But you say Kiyon would never do anything like that.
That is correct.
But you deny having done this thing.
That is correct.
So who would have done it if the only 2 people were he and you?
That is a good question.
So we just don't know.
We don't. Considering, and I will say this, nurses, they've all testified that my child did not have bruises on his body when he was presented to them. That is Tuesday morning. So, according to that time frame that you're trying to give me, by Tuesday morning, if something like this would have happened, he would have absolutely shown bruises or something on his body to a complete staff of medical professionals. And every one of them got on the stand and testified that they saw nothing. So, I also did not see anything to a point where I thought that I needed to rush my child to an emergency room after hours, after everyone was already off. I did not get home from work until 5 o'clock. That is after hours. I would have had to make an after hours appointment. I did not choose to do so because that was the first time that my child had grown up in my presence. And I believe that keeping him home would have sufficed for enough time for us to be able to monitor him and then decide from there what we needed to do.
So you said you didn't see anything?
I did not see anything.
Right. At some point you said you gave him a bath and you complained his balls hurt.
I was washing his balls, scrubbing his balls obviously because he had threw up on himself, and he said ouch, and I assumed that it was because I was rubbing his balls too hard.
Well, and I'm looking at State's Exhibit 10, which is a picture of that very region of his body.
Correct.
Okay, so he said, is that not kind of a weird place to have a pain?
Not while I'm rubbing it, no.
Okay, so you never saw the injury.
I never
to
saw
him.
it.
You had no idea.
I never saw the injury.
What about the injury to his cheek?
I was not aware of any injury to his cheek.
No, you didn't tell Sergeant Collins that was from a hickey?
I did not tell him it was from a hickey. I told him that me and my child often kiss each other and like to suck on each other's faces.
And is that what caused that mark?
I have no idea.
So it could be from you sucking on your child's face.
Could be, I have video of me sucking on his face.
Now, it's your testimony that you and Kadeem moved to that Lakeview Road apartment so you could have easy access to the pediatrics office, all right? And we've seen the medical records, correct?
That is correct.
And you said that you were a regular.
That is correct.
And what would you take him in for?
There have been multiple allergic reactions, random ones. He also had breathing issues that either they would send us to the emergency room for, or we would already be there, or it was regular checkups. And then, of course, I always saw them whenever his allergies would flare up or his vomiting removed.
And you didn't have any problem taking him right away, right?
I didn't take him right away then either.
Okay, you never took him right away?
To the doctor.
Yeah, I mean, if you had a problem, you just took him to the doctor, right?
No, you have to make an appointment.
Okay. You have to make an appointment?
That's correct.
Okay. Well, obviously, you have to make an appointment.
That's obvious.
Would you make an appointment once you saw his symptoms?
I would make an appointment once I monitor his symptoms.
Once you monitor his symptoms?
Yes.
Like you monitor his throwing up?
From 5 p.m. until the morning that he passed.
Were you monitoring his symptoms when he threw up in his sleep?
I was sleeping, so no, until I went into the room. That was my intent to get up in the morning. I set my alarm to get up in the middle of the night to go and check on him.
But you were aware that he threw up while he was
Yes,
asleep?
correct.
And that wasn't alarming?
It was at that point. That was my very first alarm because he had threw it in his sleep and not while he was awake.
Mm-hmm. But you don't call Monday when you get up, right? When you wake up Monday, you just go to work.
Why would I need to call anyone on Monday?
I don't know. Would you potentially, you just said it was alarming that he threw up in his sleep.
That was Monday night.
Okay. And then he threw up again Monday, correct? So Monday he throws up in his sleep, which you say is alarming. Would you go to work?
Monday at 3, that will be Tuesday now at 3
Okay, it's
a.m.
Tuesday? See, I'm still hung up on the fact that you told Collins that these symptoms started Sunday.
I told Collins that he first mentioned that his stomach was hurting on Sunday. On Monday is when I went to work. He was at home. And when I came home from lunch, he was sleeping. And there was juice on my floor. And what I presented was juice because the sippy cup was sitting right beside it, tipped over.
Right, but I guess my point is that on the first interview that you gave Collins, you told him that the kid was throwing up, Karter was throwing up Sunday. It wasn't until a month later, a couple weeks later, that you told him, oh, now it's Monday.
I did not, and also, I spoke with Mr. Collins the first time, the day after my child had died. So I was completely discombobulated that day.
Okay. And so you had kind of no idea what was going on. You're just monitoring conditions, but Karter's just happy as can be.
I'm monitoring his conditions, yes.
Right, and Karter's fine?
From my understanding, he has not yet thrown up in my prison.
Okay, so why doesn't Kadeem get to FaceTime his child?
Me and Kadeem were going through obviously a court battle, and he was annoying me, so I blocked his number. He could still contact me via either email or he could call it.
He was annoying you by trying to figure out his overpayment of child support.
Why would he be overpaying for child support? That doesn't even make any sense.
You heard his testimony.
Why would he give you money for child support if he knew that he was overpaying?
I mean, he provided
He
his
gave me the
response.
money, that is correct. So that would not be overpaying. That is a voluntary. I'm giving you the money.
Stop emailing me. No, you can't get her to talk with Karter. Leave me the fuck alone. And that's the last time I'm going to tell you.
Correct.
All right. So, but you heard Kadeem's testimony about how you would block him when you got mad, but that he would always get to see his child, FaceTime or talk to him.
You also heard him say that he can only get his child during the time in which he's off work. So that would mean that he would have to be off work from his part-time job and his job at the fire station,
But-
which is not something that he can just say I'm off. It's based on his schedule.
I'm not talking about his work schedule and whether or not he gets to keep Kadeem. I'm talking about the fact that his testimony was that even when you would block him, when you would be mad at him, he would still see his child on FaceTime or be able to call the child. And now, the weekend where your child's suffering a lacerated liver, all of a sudden he can't see his child.
No, I called him on Monday and asked him if he could watch the child.
Right. You called him Monday at what time?
When I got off of work, he threw up in my arms.
Okay, after he's been sick for a while?
I saw him throw up for the first time that moment.
You saw him throw up for the first time at that moment when he was in your arms?
Correct, he threw up with me.
Okay. And that was when or where?
Monday in the kitchen.
Monday in the kitchen.
After I got off from work.
Okay, so we had the red flag in the middle of the night. Was that?
That was after.
That was after? Okay. All right, so you called Kadeem and said, come get him.
I called Kadeem and asked him if he could take off of work to watch him that full day and monitor him. Yes.
And then after the fact, you blamed him for this, right?
No,
Yeah? You didn't say if he had just come get him, none of this would happen?
I do not recall saying that.
You don't recall saying that, but you heard Kadeem say that.
That may be his feelings. I have nothing to do with that.
What do you mean you have nothing to do with that? It's a conversation between you and him.
No, it's a conversation between you and him, or him and his own thoughts. That has nothing to do with me.
So Kadeem's just making stuff up.
What would he be making up? He said out of his mouth, if he would have gotten the child, it probably wouldn't have happened. I had no control over that. All I could do was pick up the phone and ask my child's father, can you watch your child? And considering that she had just been calling me for 2 days, asking me if you could see the child, I would suspect that she would assuredly want to watch the child, especially knowing that he was sick. But he told me no.
Or, none of this would have happened meant that the finger would have been pointed at him.
No, I don't know what you're referring to.
Right?
Why would I tell him that? He's my child's father. He's never.
Why would you tell him what?
Why would I tell him that if none of this would have ever happened if he had been watching my child?
Well, if the child died on his watch, we point the finger at him.
We didn't know the child was injured at the time.
You didn't know?
No.
No. Just all this throw up, my tummy hurts.
Correct.
Mm-hmm. And you stand by your statements that Kiyon would never do this.
I stand by my statement that no one around me would ever harm my child.
So, if Monday he's throwing up, why didn't you just make an appointment for him then?
I asked for my child's father, who is an EMT and a firefighter, to watch his sick child. He is fully medically trained to watch his own child. He is medically trained to take care of anyone who is in an emergency situation. So yes, I went to him first before I took him to the doctor.
Well, you didn't take him to the doctor.
Correct, I did not have time. He passed away at 8:40 or 9:30 that next morning.
Right, well, but he was sick in the morning, wasn't he?
I went to work that morning.
Right, and that's my point.
I FaceTimed him, and I told Kiyon to rush him to the doctor's office, which was next door.
So after you couldn't pawn him off to Kiyon, or to Kadeem, you wanted to leave him with Kiyon.
Don't pawn him off to his own father? How was that?
This injured child, yes. Yes,
At
so
the
you just
time,
go to work.
He was injured. At the time, the only thing that he was presenting to us was throw up.
Throw up and his stomach hurt really bad.
Not really bad. Mommy, my stomach hurt.
Not really bad, a 2-inch lacerated liver, but he's telling you his stomach just hurts. It's not really bad. He's not crying, nothing.
He is not crying. I work with children. I would have suspected someone of this magnitude to be crouching over, to be holding his stomach, to be indicating something of pain.
I think we all would. So when Kadeem doesn't take Karter You don't make a doctor's appointment for him.
It's at this point around 7 o'clock, and after hours is what you would have to do in order to get an appointment. You would have to call the number, and if you get an appointment, they will then tell you that you can come in at a certain time the next day. So there's no instance where he would have been able to see any medical professional unless I called 911 that day.
Urgent care's open?
I don't know about urgent care.
Emergency room's open?
He did not present any symptoms where I felt like I needed to take him to.
And that's not what I asked you. I asked you, was an emergency room open?
I'm assuming
You're assuming
emergency rooms are open.
they're not open 24 hours?
I'm assuming they're open 24 hours.
You assume that's not something that you just know, you're just guessing that that's true?
I don't work for an emergency room, so I don't know what to
And neither do I, but I don't need to work for an emergency room to know that I can go there at any time.
Correct.
Right. So you do know that.
You can go to an emergency room at any time. That's basic information.
And if you had called your doctor, chances are you would have gotten a recording that said this is after hours. If this is an emergency, please hang up and dial 911.
Correct.
You did none of that.
Why would I need to call 911 for vomit or juice?
Or go to the emergency room.
He was vomiting juice, and this was not the first time that my child had vomited. And the first time that he was vomiting, we did go and see a doctor, and she told me that because it could be allergic reaction, that he would eventually get over it. So no.
But it is the first time that he vomited in his sleep and didn't wake up.
He did wake up.
He did wake up.
And say that he was on the phone with me and he was awake.
In his sleep the night before.
In his sleep the night before, he threw up in his sleep. I took him and I moved him to the other bed. When I got up that morning for work, which was a couple hours later, he was wide awake and he was talking.
When you were on the phone with Kiyon, when he was taking your dying child to primary pediatrics, correct?
I was on FaceTime the entire time.
Okay. Do you remember any of the statements that y'all made on the phone?
Statements on the
Do you remember any part of that conversation?
No, because I was at that point driving from Milledgeville. I ran out of my office and I was driving from Milledgeville back to Monrovia.
So you don't recall if Kiyon said to you, man, I should have brought him in last night when you told me to?
No.
Why would you have told him to take Karter?
That's a very good question because why would I tell him to take him?
Right, well, I mean, you did tell him to take him Tuesday morning.
On Tuesday morning?
You did.
Why wouldn't I tell him? He's the only one with him.
And he said, don't worry about that right now, just get here. Do you recall that?
I do not.
In the daycare, Miss Shirley, right? How long have you been knowing her?
I've known her since my child went to daycare.
And you kind of went to high school. You went to high school with Kazette
I did, but we did not hang out, no.
until you started bringing Karter to her mom, and then you guys kind of had more of a friendly relationship.
No, I never had any type of relationship with Kazette until after my child passed.
Okay. Till after your child passed. So what was that relationship like?
There was no relationship. It was more so they had a party and she invited me over and I went to her place and that was the last time that I saw or spoke to Kazette.
And you took wine to her place, right?
I did not take wine.
So you didn't go to her place to pick up a plate?
I went to her place, like I said, they were having a party of some sort and I went to pick up a plate of food, yes.
You don't even know what kind of party it was?
No, I don't.
You don't recall it being a Christmas party?
No.
You don't recall that Kadeem took Christmas gifts there?
He didn't tell me that he took Christmas gifts, so
Okay. Okay. But who called you and told you that you could get a plate?
Kazette.
Gazette did?
Yes.
And you could pick it up from her house?
Correct.
Okay. And you guys didn't discuss anything while you were there?
No.
You didn't tell her that he had a lacerated liver?
I don't recall, no.
Okay. You don't recall? Well, you just said that you didn't talk to her at all, and now you're saying you just don't recall if you made that statement.
I just said I don't recall telling her that my child's liver was lacerated. I obviously had conversation with her because I was at her place.
and you told her that you Googled it?
I don't recall telling her that.
You don't recall telling her that it could be because he jumped off the couch?
No, I don't recall telling her anything, but if I did, then I would probably have said what I researched.
And you never blamed Kiyon?
No.
Well, Miss Shirley, did you keep in contact with Miss Shirley after Carter's death?
Not really, other than her checking on me,
So you guys had a discussion though, right? She would check on you, would she just say, are you okay, and then hang up the phone, or would you guys actually exchange words?
I don't recall.
You don't recall anything?
It was 6 years ago, I don't recall.
It was 6 years ago. Well, she just testified that that's what happened.
That is what she testified to, but that's not my recollection of the conversation.
She spent a lot of time with your child, didn't she?
She watched my child.
Pretty much all day unless Kadeem wasn't at work, right?
Correct.
Right. She loved your child, didn't she?
Sure.
And she made, what was it, a pillow with his picture on it?
She did.
And at his viewing, he had some kind of vehicle in his hands, didn't he?
He did.
And that was her vehicle, Miss Shirley's, right?
I'm not sure.
You're not sure, and you didn't give it back to her?
Why would I? She left it in his casket, I'm assuming.
But you guys would never discuss anything after this? About Carter?
No, I did not.
Okay, so you never told her that he fell off and hit his head on the bed?
No.
So everybody's lying?
Yeah.
Except you.
Why would I have to lie?
Well, why would the primary pediatrics people lie?
What did they lie
About the statements that were made on the phone?
What do you mean?
With you and Kiyon. The people that you love, that we saw on the body cam, how broken up you were for them. About what happened to this boy because he was a regular and they knew him so well. The moment you went into the office, they knew you. Right? So why would they make up these statements that are made on the phone?
They only said that I told him to, or that he said, don't worry about it, just get there.
Yeah, and what were you doing?
Driving.
You were driving?
Correct.
Okay. And where were you coming from?
Milledgeville, Georgia.
What age kids did you work with? I think it sounds like maybe there were college students.
They were high school students.
High school students? But you don't really know anything about the statements on the phone.
I was driving. They just told me my child was being rushed to the emergency room. I'm driving. I have an hour drive. I'm also trying to contact his father to notify him of what's going on. There's a lot going on while I'm trying to drive on the highway.
So what is Kiyon referring to when he says don't worry about that, just get here?
I have no idea. I'm sure I was trying to find out information about my child.
Did you talk about this afterwards with Kadeem?
Talk
about anything?
I had multiple conversations with his father.
And was there any conversation about the lacerated liver and him and Kiyon? And have you ever found out about something?
Every time that I would try to contact my child's father about the case or anything involving the case, he did not want to talk about it, which I can understand that he didn't want to have more conversation about the death of his child.
Well, I don't think that's what I'm referring to. Because didn't he testify that he told you that he didn't know what he would do if he found out it was Kiyon? Didn't he testify to that?
That's what he said out of his mouth. I mean, that's his personal, emotional.
So he's lying too, or what?
Lying about what? That's his personal, emotional feelings. He doesn't know what he would do if he found out someone else did something to his child that has nothing to do with him.
Yeah, I'm referring specifically to the statement of that he made to you. He said that, right?
He did say that.
And what was your response?
I don't know.
Well, according to his testimony, you defended him, right? You defended Kiyon.
All I said was...
You got mad at Kadeem.
I did not get mad at Kadeem. All I said was I do not believe that Kiyon would ever harm my child.
So we know that Karter had his own bedroom in your apartment, correct?
Correct.
Okay. And that there was kind of this battle between keeping him in his own bedroom.
Not a battle, he was sleep trained.
He was sleep trained,
Yes, so I was training him to sleep in his own bed.
but he would come and knock on your door or try to find you.
Obviously, he would get up in the middle of the night and try to come back and sleep in my bed, yes.
Okay. He would. What about if you and Kiyon were in the bedroom with the door closed?
We wouldn't be in the bedroom with the door closed.
Well, what about, where would you guys smoke marijuana?
We did not smoke marijuana in my house. He would smoke outside or on the patio.
He would smoke outside on the patio?
On the patio.
So you never had anything to do with any of that?
I never had anything to do with any of that.
Try to get a new phone after this?
Did I try to get a new phone?
Mm-hmm.
As in a phone number or?
A new phone, like upgrade your phone?
I believe I did upgrade my phone only because me and his father shared a phone at the time online, and I was returning his, and I was eligible for an upgrade, so I believe that I did upgrade or whatever.
When did you become eligible for an upgrade?
I don't know.
Does December 6, 2020 sound right?
I don't know.
Okay. Do you know how many times you checked to see if you actually qualified for an upgrade?
I would never check to see if I qualify for an upgrade. I don't know.
I got one. Right. And it's in this is State's Exhibit 60.
All right.
Can you look through this form?
Sure.
Do you have any idea what that is?
Those are records of an eligibility check from, I guess, my account.
From your account? And there were a lot of pages, weren't there?
They are
Okay, what were the dates?
from November until, I believe it was January, I don't know,
So December or?
December, January. I didn't know the last day.
That's quite a few pages, isn't it?
Eligibility request for upgrade on my cell phone.
Mm-hmm.
Sure.
Okay. A lot of them came right after this incident happened, didn't it?
Sure. But I mean, I work in tech, so me upgrading my phone had no bearing on anything because everything was then transferred over to my new phone.
Why did you tell Kiyon to give him a breathing treatment that morning?
Because Kianna had mentioned that he didn't think that he was breathing correctly. So I immediately said, well, I asked him to lift up his shirt so that I could see if he was retracting a little bit. I did not notice him tracking, but because he stated that he thought that he was breathing oddly, I told him to get him breathing treatment anyway.
And you knew the signs and symptoms, right?
Yes, which is why I asked him to look at the shirt.
Right, and you didn't see anything?
No.
But you said getting the breathing treatment anyway?
Correct.
You don't recall saying that Karter threw up 4 times Sunday night to Collins in your first interview?
I don't recall anything from that first interview. Again, I had just lost my child. It was a lot going on.
How many times did he tell you his stomach hurt?
I don't know.
Was it once?
He told me Sunday night. I went to work on Monday. I never heard him say it again until I returned home and he threw up in my face. And then he said, "Mommy, my stomach hurts."
And did you give him a bath after that happened, or did you give him the bath prior to being in the kitchen?
I gave him a bath when I got home because I noticed that he had juice all on his shirt.
Yeah, but it wasn't juice, was it?
It was juice.
It was juice?
It was juice.
What was on the carpet?
Juice.
Juice was on the carpet?
Juice.
Okay. But you said that you kind of deduced that it was throw up at some point in your statements to law enforcement, right?
Throw up, in my mind, is throw up, which it should contain food, some sort of consistency, chunkiness, something. This was not that. This looked like water mixed with juice.
So, then why did you tell law enforcement that you kind of figured out later, once he threw up in the kitchen, that you figured out it was throw up?
I said, because when he threw up in the kitchen, he also vomited the juice and clear fluid. So I then immediately said that must have been what I noticed on the floor from when I came home from work.
You said if there was something I would tell you to law enforcement once they told you about the injuries, right?
Of course.
So there's nothing.
I did not witness any type of anything, no. And there was no evidence of any bruising or anything on his body to me, nor was there any evidence of any bruising on his body to the medical staff who saw him that Tuesday morning.
But Karter didn't run to you and point at Kiyon and say he hit me.
No.
And he reviewed that, right?
He never said anyone hit him, but if anyone did hit him, he would point to whoever. I would ask who did it, as I would refer to my child, and he would point and tell me who he thought would do anything.
Right, like if he got hit at daycare or something like that.
If he got hit at daycare, I wouldn't have known unless he started told me.
But you said if anything would happen, Karter, who was a crybaby in your words, would come to you and point at what happened.
Karter's always the last one to be picked up from daycare because I am the latest parent to pick him up. So whenever I pick him up from daycare, he is typically the only child there. So there will be no one to point to.
Okay, then why did you tell police that?
What?
Why did you tell police that if someone hit Karter, that he would tell you?
Because he would.
But he didn't do that with Kiyon.
So that obviously means no one hit him.